Selamat pagi untuk semua peserta yang sudah ada di ruang Zoom. 2 menit ke depan acara akan segera kita mulai. Bagi teman-teman yang sudah mendaftar lewat link ataupun panitia yang sudah terregister, mohon untuk segera bergabung di ruang acara akan segera dimulai. Dan juga bagi teman-teman yang sudah bergabung lewat YouTube, untuk sementara harapkan kebersediaannya untuk bergabung di ruang Zoom, karena nanti akan ada dokumentasi yang akan kita serahkan sebagai pertanggung-jawaban kegiatan dari kita hari ini. Terima kasih untuk kerjasamanya. Mohon untuk segera bergabung di ruang Zoom.
Good morning, everyone. Can you all hear my voice?
Yes, clear.
Good morning, everyone.
Good morning.
Good morning.
Good morning.
Good morning.
Morning.
Happy that all of you can hear my voice. Okay, I think we're going to start. So I would like for all of you to pay attention. Okay. I would like to read the activities for this seminar for this morning. Okay. First of all, I would like to welcome all the participants who joined this webinar or seminar this morning from the beginning until the end. And I would like also to welcome the speakers, okay, who come from all the way, far away, and come to Indonesia to this webinar or seminar in this Zoom. Okay, and then first of all, I would like to say thank you. Thank you very much for all the participants and the seminars who joining this webinar this morning. And then first of all, also, we would like to sing our songs, the Indonesia Raya. And then after that, we're going to sing the songs of the PPNI songs. And then we're going to listen and hear from our leaders, PPNI leaders, Bapak Wawan Hermawan. And then after that, we're going to listen from the owners of this webinar or seminars, okay, Ibu Sastrayani as cap nurse. And then after that, we're going to start our seminar. Okay, let's ready to sing our songs Indonesia Raya. Lagu Indonesia Raya-nya boleh diputar.
dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia, tercapai derajat kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan, dengan organisasi BPNI yang kokoh, padu bersatu serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia.
Next, our leader from the PPNI Jawa Barat, DPW Jawa Barat, please, Mr. Wawan Hermawan. Our leader from DPW Jawa Barat, Mr. Wawan is here.
Ya, terima kasih Bu Lina.
Selamat pagi, Pak. Silakan, Pak. Belum
Thank you
kedengaran
very much.
suara.
Mohon izin, saya lagi di perjalanan. Mohon izin banget. Bukan berarti tidak menghargai, lagi di jalan. Terima kasih. Mudah-mudahan hari ini kita diberi kesehatan semua. Di hari libur pun mungkin Ibu Lina ini luar biasa. The best, ya. The best dengan dari yayasannya yang telah mengembangkan keilmuan untuk kita semuanya. Memang perawat ini di mana-mana perlu meningkatkan pengetahuan. Saya yakin dan percaya. Alhamdulillah kemarin, mohon salam dari Pak Hari Padilla, beliau terpilih lagi menjadi Ketua Umum PPNI untuk 5 tahun ke depan. Terima kasih atas dukungannya semua pihak. Mudah-mudahan bisa kerjasama 5 tahun ke depan. Para ikatan himpunan bisa mengembangkan keilmuan. Para dokter-dokter keperawatan, profesor keperawatan bisa kerjasama dengan PPNI ke depannya. Oleh karena itu, para peserta seminar hari ini, mudah-mudahan narasumber-narasumber yang hari ini memberikan kontribusi yang positif terhadap pengembangan keperawatan. Saya yakin, percaya, tidak ada yang tidak mungkin. Kita bisa bekerja bersama-sama. Bersama-sama kita bekerja. Oleh karena itu, dengan didukung oleh semua tatanan pelayanan, kami berharap dalam mendukung era globalisasi, bagaimana peran fungsi perawat secara profesional, ya kita kerjakan tanpa melihat, tanpa pandang bulu dan sebagainya. Ingat sumpah perawat, ingat kode etik keperawatan, kita tidak boleh membeda-bedakan. Ya, kita tidak boleh ada satupun klausul yang menyatakan kita tidak melayani pasien. Semuanya demi pasien. Apalagi tentang Woundcare ini sesuatu yang menjanjikan ke depannya. Sangat luar biasa. Diperlukan di masyarakat bagaimana seorang perawat punya talenta-talenta, punya kompetensi-kompetensi yang mungkin saja diperlukan satu pemahaman yang sama. Ada gradasi-gradasi dalam perawatan luka. Ada PK1, ada PK2, ada PK3. Mungkin Ibu Dr. Lina nanti bisa memberikan pemahaman yang sama dengan teman-teman bagaimana seorang perawat ini bekerja di rumah sakit. Ada kompetensinya, ya ada kewenangan klinisnya. Kedepannya semua kita atur sebagaimana kita mestinya. Saya yakin dan percaya teman-teman hari ini tentunya ingin mendapatkan keilmuan, ya update keilmuan di dalam keperawatan luka. Woundcare ini satu-satunya keperawatan yang perlu ya teknik-teknik tertentu, ya perlu ketelitian di dalam kita memberikan satu perawatan. Ya. Jadi oleh karena itu, saya yakin kita tetap kepada harfiah kita, kode etik keperawatan kita, jangan sampai kita ada malpraktek, ya malpraktek. Jadi nanti ke depannya lakukan pekerjaan sesuai dengan standar, lakukan pekerjaan sesuai dengan kompetensi yang teman-teman punya. Kalau tidak punya, lakukan pelatihan, tingkatkan pengetahuan. Ini adalah salah satu bentuk bahwa perawat ini punya satu ketentuan yang sudah dibakukan di dalam kesempatan ini. Oleh karena itu, saya berbangga di Jawa Barat, ya, terutama nasional. Ya tentunya, mari kita sama-sama agar perawat ini bisa diterima di tatanan masyarakat. Di era COVID ternyata perawat ini makin terkenal gitu ya. Bukan berarti kita terkenal dengan COVID-nya, tapi dengan apanya? Dengan sumbangsihnya, tenaganya dicurahkan untuk kepentingan masyarakat. Ini paling penting. Salah satu profesi yang tidak pernah memandang bulu adalah perawat. Di mana-mana ada perawat. Oleh karena itu, jiwa raga kita, napas kita, senyum kita, semuanya demi kepentingan masyarakat, terutama pasien. Sukses selalu, mudah-mudahan seminar hari ini bisa memberikan hasil yang terbaik dan manfaat bagi kita semuanya. Jabar selalu mendukung di dalam pengetahuan. Indonesia tetap bersatu dalam satu lingkaran Persatuan Perawat Indonesia. Atas nama Ketua Dewan Pimpinan Pusat, Hari Padilah mengucapkan sukses untuk teman-teman semua hari ini yang ikut seminar. Mudah-mudahan ilmunya bisa dimanfaatkan untuk kita semuanya. Terima kasih Bu Dr. Lina. Kapan-kapan kita ketemu nanti di PPNI. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Terima kasih Bapak Ketua atas penyampaian kata sambutannya. Jalan Pak Ketua, saya tahu Pak Ketua punya tugas yang berat. Masih bisa memberikan kesempatan, memberikan sekata dua kata, memberi semangat kepada kami semua yang hadir pada pagi hari ini.
Amin,
Berikutnya kita akan dengarkan sambutan dari Ketua Panitia Acara Seminar. Silakan.
Thank you, ma'am. Good morning, ladies and gentlemen. Thank you to each and everyone for being here today at this wonderful place. My name is Sastrayanti Sinaga. It is such a honor for me to speak on behalf of the organizer. Let me begin by giving you a warm welcome in Nurse Identity and Update of Woundcare. Before we get started, I would like to express my appreciation to speaker and IGHB crew who generously helped us to make this seminar come true. And then in this today's seminar, we will learn about and sharing about nurse identity and update of Woundcare. Nurse identity is defined as the extent to which nurse know the nursing job. That it is a good and great profession. So we are proud to be a nurse. Mungkin saya sambung dengan bahasa Indonesia. Jadi terima kasih banyak buat semua partisipan dan tentunya pembicara dan juga Bapak Wawan yang sudah menyempatkan waktunya memberikan sambutan kepada kita. Terima kasih untuk semua dukungan dari perhimpunan dan juga semua yang sudah berkontribusi dalam acara ini sehingga acara ini bisa berlangsung dengan baik pagi hari ini. Adapun tujuan kita sebenarnya untuk menyampaikan hal ini adalah kita tergerak untuk mengajak semua teman-teman perawat di seluruh Nusantara untuk memahami dan lebih menghargai dirinya sebagai perawat dan juga bisa mengeksplorasi kemampuannya sehingga kita masing-masing bisa memiliki nilai jual yang lebih baik ke depan, bisa bersaing dengan dunia luar, bisa bersaing di era globalisasi, bahwa kita terbuka kesempatan seperti perawat lainnya dan seperti profesi lainnya yang layak dihargai dan lebih dipandang sehingga mendapatkan hak-hak yang wajar. Maka oleh sebab itu pemerataan kompetensi di bidang keperawatan terus kita upgrade agar kita layak untuk bisa berdampingan dengan perawat-perawat baik dari dalam luar negeri dan juga dalam negeri yang layak diperhatikan sebagai profesi yang membanggakan. Kami berharap semua perhimpunan dan juga aspek-aspek lainnya untuk terus mendukung kegiatan ini sehingga pemerataan kompetensi kita layak untuk menjadi perawat profesional yang lebih baik. Itu saja mungkin. Terima kasih kepada pembicara kami yang sudah hadir hari ini. Terima kasih Mem sudah memfasilitasi ini juga hari ini sehingga acara bisa berjalan dengan baik. Permohonan kami adalah kepada semua peserta untuk tetap stay on Zoom karena kegiatan ini tetap ada dokumentasi dan reportnya ke DPP sebagai pertanggungjawaban kami sebagai penyelenggara dalam memberikan seminar ini. Terima kasih Mem, saya kembalikan kepada moderator.
Baik, terima kasih Ibu Sastra sebagai organizer untuk acara pada pagi hari ini. Bagus sekali kata-kata yang disampaikan oleh Bapak Ketua PPNI Jawa Barat. Identity. Identity. Apa sih? What is identity? Okay. Identity is who you are. Who you are if I ask you, I'm a nurse. How about you? Are you a nurse? Show me your identity. Identity, the way of you think about yourself, the way you are viewed by the world and the characteristics that define you. Your strength, your passion, love is that you care about. Okay, that's a little bit about identity. Okay, to know who am I and who you are as a nurse. Okay, we can start for, let me read the rundown from today until 12 o'clock this morning. Okay, the first rundown, the speaker will be Mr. Dwight Hutapea. And then the second one, okay, hold on. Mr. Dwight will talk about nursing making an impact in society. And the second one will be Mr. John from Philippines. The topic will be shaping the nursing identity. And the third one, also from, no, hold on, this is from America. Okay, Dr. Chanel Concepcion. She will talk and share with us about nursing a vision for the future. And the last one for this morning until 12 or 1 o'clock, okay, it's about the role of nursing association in develop nursing practice. Ladies and gentlemen and all the participants, I would like you to listen very careful. It's a very nice topics that you need to learn, that you need to hear. Let's give this time from the first top speakers, Mr. Dwight Hutapea. I would like to read a little bit about the resume, okay, about the first speaker. Mr. Dwight Hutapea graduated from UNAI, University Advent Indonesia, by the year of 2014 for his bachelor. And then he continued his study, master degree in Thailand, Prince of Songkla University. Then he worked as a nurse. Then he continued his study for his PhD. He's a candidate PhD from Philippines. Let's give this time for him to share his topic about nursing making an impact on society. It's your time, Mr. Dwight.
Okay, good morning everyone. Selamat pagi.
Good morning.
How are you all doing? Thank you so much for the introduction for me. And thank you also for this opportunity for me to share about this topic to all of you. And I'm also grateful this morning I can share to all of you by Zoom. One thing that I'm blessed and truly thankful, even though this pandemic is still happening around us, even though this pandemic is not stopping yet, but one advantage of this pandemic, we can see each other easily by Zoom. Like, for example, I don't need to fly to Jakarta or go to Jakarta to see you guys. We can see only in Zoom. And we don't need to pay a lot of money to go for our transportation. That's one benefit, according to my opinion, about this pandemic. And I also want to say greetings to all of you and send my regards to all of you. I also want to say welcome to all of you to join this webinar this morning. There are several people that I've known here in this group. And I also want to welcome Mr. Wawan from PPNE also. And my professor also will be one of the speakers here. Actually, she's not from America. She is Dr. Channel. She's from Philippines, and she's also working in China. And my other friend also, Sir John Paul, he's from Qatar. He's from Qatar. He's working in Qatar also. So let's begin. Let's start about this topic. Okay, nursing identity. Like what Mrs. Lina has mentioned about identity. What is an identity? We as nurses, we as workers in hospitals, or we as students, we must know our identity as nurse. We must know what is our identity. Once we know what is our identity, we will know what is our role in our job. We will know what is our role to do as a nurse. Like today's seminar is very interesting. It will be two parts that we will be covering. First is soft skill about nursing. What is the soft skill about nursing, the identity of nursing? Second part is hard skill. So these two things cannot be separated from us as nurses. We as nurses, we must know what is our identity. And besides that, we as nurse, we also must have skill in order for us to give caring to our patients or to the community that are around us. Okay, so before we go ahead, I would like to share screen. Okay. Okay. Can you see my screen? Bisa lihat screennya? Okay. Okay, thank you. So, nursing making impact on society. So, today's presentation will be focusing on what is actually nursing and how can nursing make an impact on society. Because we as nurses, we must know what is our identity, what is our role, and how can we bring impact to our society. So these are the outlines. So most of us here who joined the webinar this morning, most of us maybe are workers who already have many experience in the hospital. And some of us here are still students who are planning to work in the future as a nurse. So this topic is really relevant to students and also to co-workers in the hospital. And for us as nurses, like what I've mentioned previously, we as nurses, we must know what is our role, what is our identity as a nurse. Okay, and I want in this part so that it's not only me be sharing. I want all of us here to contribute also. So I also want to hear your voice also. I want to see your faces also. So if it's possible, to please turn on your camera if it's possible, so I can see your beautiful faces and I can see your handsome faces also. Okay, let's go on. To all of us, I want to ask you, do you know what is your identity as a nurse? Anyone want to share? It's okay, you can speak in Bahasa and Miss Lina can translate it in English. Anyone want to give your opinion? What is your identity as a nurse? Anyone want to share? Okay, anyone want to share? What is your identity? Or what is nursing actually? Do you know what is nursing as your discipline? Anyone to share? I hope that it's not only me will be sharing. Maybe Miss Lina, can you share something? What is nursing actually, in your opinion?
For
So,
me,
okay.
Since you mentioned about nursing, you cannot operate on skills, okay? So as a nurse, you identity equivalent qualities. Jadi, tadi seperti Pak Dwight menyampaikan di mana perawat, ilmu dan skill seorang perawat tidak bisa dipisahkan. Jadi bagi saya, untuk menunjukkan saya seorang perawat, identitas saya sebagai orang perawat, saya harus mempunyai kualitas, quality dari
Okay.
ilmu dan juga skillnya.
Okay. Thank you, Miss Lina. I think someone raised their hand. Mrs. Santi, maybe you want to speak or share? Or I don't know. Someone raised their hand. Ada yang mau bagikan lagi yang lain? Jadi, what is Miss Lina saying, that nursing identity, nursing has a quality. Okay, nursing has a quality. Anyone else? Okay. According to Virginia Henderson, she is a nursing theorist. All of us know about Virginia Henderson. Okay, according to her, nursing means to her is the unique of functions of nurse is to assist the individual. Okay, and the keyword here, to assist individual who are sick or even well in the performance of those activities contributing to health. So here we can see that nurse is to assist individual. Either they are healthy or they are sick or well in the performance to contribute health. Or it's a recovery of or to a peaceful death that he would perform unaided if he had nursery strength, will, or knowledge. And to this, in such the ways to help him gain independence as rapidly as possible. So what I'm saying here, according to Virginia Henderson, nursing is a discipline that assists someone who is sick, or even though he is well, so that they can have a good health and they can be independent, how they can control their own health. Okay, so the second part is, what is the concept of nursing? What is our role as a nursing, or what is our task as a nursing? Okay, for students, for coworkers, we all know about this. Our task as a nurse is to promote health. Why? To promote health is, as according to the definition of Virginia Henderson, is to contribute health. So if we don't promote health, how can someone be healthy? So our first task as a nurse is to promote health. The second one is to prevent disease. So it's not only to promote or give health education, but our role or our task as a nurse is to prevent someone to get sick, someone to get a disease. The third one is to help ill person to be healed. Someone who is sick, and our job and as a nurse is to help them to be healed or to assist healing. Okay. The fourth one is to assist a dying patient to pass away with quietness or peace and dignity. So that is our task as a nurse. The fifth one is the client is a holistic human being, including suffering, personal, and healthy person. So our task as a nurse is to give an holistic care to someone, okay, including suffering person and health person. The sixth one is our task as a nurse is not only working in a hospital, but also in families, community, and the whole society. The seventh one is nursing is not only a science, but it's also an art. We'll see that in another slide. So the nursing science attached importance of human beings' living environment and interaction between human being and its environment. The ninth one is nursing science is greatly perfect and developing science. So we can see here our task as a nurse is a big task. We have a big responsibility to do. So maybe first time when I entered nursing, my mindset that time was, okay, my job as a nurse is to work in the hospital when I was a student. But when times go on, when I read and I see many things, nursing is not only about that. Our role as a nurse big is big. So our job as a nurse is to bring positive outcome to someone. And our task is not only to heal physically to someone, but our task is to give holistic care to someone. Because a person, maybe he feel physically healthy, but sometimes he's not healthy on the mind. So that's our job as a nurse to give a well promotion to patients, to someone, to prevent them not to get disease and so on. So we can see here that our role, our task as a nurse is not easy. It's not an easy task. Okay, it's not an easy task to do. It's not an easy task to do. So we as a nurse, we as students of nurse, we as workers of nurse, we must be proud of ourselves. We must be proud that we are a nurse because we have a big task to do. It's not only healing someone, a person, but we also have an impact for the community around us. Okay. The third part is what is the philosophy of nursing? Okay. So we can see, as what I've mentioned previously, nursing is viewed as both an art and a science. So nursing is amazing. It's not only talking about science or ilmu, body of knowledge, but it's also an art, which reflects the concept of nursing that is related to the concept of nursing. Like what I've mentioned previously, the concept of nursing is to promote health, to prevent illness, and so on. So nursing is an applied discipline which expresses itself in practice, and it has its foundation rooted in scientific empirical knowledge, theory, and research. Nursing is also expressed as a caring, therapeutic, and teaching discipline. So nursing is a broad discipline, and it has a scientific empirical knowledge which is focuses on theory and research. And this also expresses us to give caring, therapeutic, and teaching discipline. So the goal of us as nurses is to give optimum client wellness. It's not about health, but wellness, kesejahteraan in bahasa. It's not, bukan hanya tentang kesembuhan, kesehatan, tapi kesejahteraan. Kita, our role as a nurse, peran kita sebagai perawat untuk mesejahterakan masyarakat, individual. And the maximum level of functioning. The nursing interventions are evidence-based and stem from their core of knowledge. The professional nurse must be appreciated the role of informatics. So our role, the goal of nursing is to give wellness to someone. Wellness not to individual, but community also. Okay. To continue, philosophy of nursing includes also a belief, which means identity and value, with regard to man in general and specifically man as a learner, teacher, nurse, client, beliefs about health, illness, society, and so on. So all of these things must be related, included to the spiritual, moral, intellectual, and so on. Emotional needs, physical needs, and social needs. So these are the needs of each individual: spiritual, moral, intellectual, emotional needs, physical needs, and social needs. So this is the first part that I'll be discussing about what is the foundation of us as nurses. I believe all of us know this, but the goal for this seminar is not only for us to know about this knowledge, but for us to be proud to be a nurse, for us to be proud to show our identity as a nurse. Even though maybe our salary as a nurse is not too big here in Indonesia. Mungkin gaji kita sebagai perawat tidak terlalu tinggi di perawat. But kalau kita benar-benar mengetahui identitas kita sebagai perawat, kalau kita tahu, if we know our identity as a nurse, we will be really proud to be a nurse. As what I read about nursing, we must be proud to be a nurse, especially for students who are joining this program, this webinar this morning. For you students who are joining the seminar this morning, who are planning to be a nurse, you must be proud to be a nurse. And if we are proud to be a nurse, we'll give the best care to the patient. We'll give the best care to the patient. Okay, so in order for us nurses to give an impact on the society, we as nurses must know what is a good quality nurse. Like what Miss Lina has mentioned about nurse is related to quality, right? Good quality nurse. So what does it mean to be a good quality nurse? So that if we have a good quality as a nurse, we can bring impact to the society. Okay, society is not only including environment, but also around us. How can we as nurses can bring a good quality to our society? Okay, so our qualities as a nurse, okay, according to our founders, Florence Nightingale and other theories, quality of nurse included truthfulness, love, caring, commitment, compassion, acceptance, punctuality, fairness, self-esteem and tolerance, appreciation, creativity, imagination, confidence, empathy, humor, kindness, morality, courage, accountability, authenticity, alertness, intelligence, efficiency, self-discipline, openness, and independence. So this is our qualities as a professional nurse. All of this must be in our identity. Okay, I won't go deep on this individually, but this is what we need to have as a nurse. We need to have as a role of nursing. Okay, so according to studies, good quality has two parts, which means the outcomes of the delivery care. That means that we as nurse, we must have to bring a good outcome to delivering care. Second one is about its own providers as a care. So the first part we will see a good quality of nurse. So I took this part from several studies. Okay, according to Dawood and maybe in 2008. Okay. So according to this study, okay, what does it mean by aspect and outcomes of delivered care? And this study have mentioned that in order for us to bring a great outcome to a patient, we must provide patient holistically. And it must be patient-centered, and it must be a continuous care. So according to several interviewed that this study have found out, that she interviewed students and other people also. He's saying that here, I feel that good quality nursing is holistic care giving, looking to all aspects of the individual life. So in order for us nurses to bring a good quality and or bring a good outcome to patient and bring a good impact to the society, we must provide an holistic care to the individual. Okay, this is according to students. Students felt that I feel that good quality nursing is giving holistic care to someone, all aspect individual. Okay, according to modern matron, she said that good quality nursing is being able to care patients' basic needs without compromise, because basic nursing care is the foundation of what nursing is all about. So what she's saying is, it's not only giving holistic care, but what is the basic needs of each individual without giving compromise. According to Junior Matron, good quality nursing is complete, flawless care with the patient central to it, where the patient could not ask for anything more, which means that patient must be our centered care. Another director of nursing and operation also been interviewed, and he has mentioned like this: ensuring that the fundamentals of care are addressed across the board. Once confident that this is successfully achieved, to the high standard, building on fundamentals to provide more specialized input where needed. Another also mentioned here, palliative care and CNS, holistic care, including physical, psychological, social, spiritual care based on social understanding of illness health. According to research nurses, the use of holistic care approach encompassing spiritual, social, psychological, and physical care. So what I'm saying here, for us as a nurse to give a good quality and so that we will bring a good outcome to patient, we must give an holistic care to the patient. Okay, holistic care, which means spiritual, social, psychology, and so on. This must be the way we care for the patient or to the society that is among us. That's the first one. The second one is to provide empathic and compassionate care. Okay, in order for us to bring a good outcome to the patient. Okay, nursing care should involve treating patient with respect and dignity. I want to underline respect and dignity. According to several interviewed also, according to nurses and intermediate care, treating people with dignity and respect. We as nurses, we need to treat people with dignity and respect. Okay, kita harus melayani seseorang dengan dignitas yang baik dan penuh hormat. Okay. Kemudian berikutnya, according to a consultant nurse, passionate become communication, empathy, attention to detail when caring for an individual. Communication. So, in order for us to share empathic and compassionate, is by a great communication, empathy, and so on. Third one, according to Max Millan, okay, she said that caring for a patient as you would care for yourself or member of your family. So, how for us to give empathic or compassionate care to someone is by treating someone like we are treating our own family or ourselves. Good quality nursing is self-awareness and compassionate care. This is according to students. The third one, okay, is providing high standard evidence-based care. So our role as a nurse here to contribute to society to give a good outcome is by giving a high standard evidence-based care. So whatever we'll be doing to patient, it must be based on evidence. It must be based by evidence. Okay. This aspect referred to using research evidence to inform practice and deliver high quality care that produce positive measurable outcomes. So for us as nurses, we must always update about the newest evidence that we can bring caring to patients. So I want to share a little bit. So one time I was talking to a doctor who interviewed me, and he said that to me that why nurses right now always follows doctors requirements. Why don't they become more critical to share their knowledge to us? And I talked to him, yeah, for in my opinion, because maybe us as nurses, we are not updating our knowledge by looking the newest update. Yeah, and he said, yeah, I agree. So here we can see that actually doctors want to collaborate with us nurses. But how can we collaborate with them if we don't upgrade our knowledge about caring to patients? How can we not we collaborate with doctors and other disciplines if we are not upgrading our own discipline by looking the newest evidence base that we can bring to patient? um, Last time maybe I shared also in another webinar also, one time i was um, I was dealing with a patient when I was taking my master's. So this patient just got chemo, and we know that each patient who got chemo will have a side effect: nausea, vomiting, and so on, and hair loss, so on. And my patient that time, the side effect that he felt was nausea and vomiting. And we as nurses, in order for this patient to be provide their need, is by giving them a good nutrition. But that time the patient don't want to eat at all, because every time he eats, he always vomit, and he has no he don't want to eat because of that nausea and so on. So what I did that time, I looked at a paper, evidence based. How can I deal or treat with this kind of situation? So I searched an article, evidence based article. What can I do? And I found out what I can do that time is by giving massage on the foot. And if I found this intervention in theory books, we cannot find it. But I found that in a journal, an article. So I massaged the patient's foot, and what happened that time? Maybe because of relaxation and so on, that time the patient wants to eat. He wants to eat, and he even add more food after what I've done to the patient. So what I'm saying here, we as nurses, we need to update our way of caring to patient by reading the newest update we can bring to the patient. And whatever we will be doing to patient, it must be based by evidence. Okay. The fourth one is ensuring safe, effective, prompt delivery care. We must make sure what we'll be doing to the patient is safe, and it will bring a benefit outcome to the patient. Okay. The fifth one is educating and supporting patients. I won't read all. Educating and supporting patients. The seventh one is empowering patients by enhancing patient involvement, valuing and encouraging patient choice, and advocating for them was an important dimension of a high quality care. The next one is continually improving the standards of care delivered. So this is part of how can we bring a good outcome to delivering care to a patient. Okay. The second part is providers. We as providers or nurses. Okay. We as staff or nurses, we as nurses should deliver an adequate level of staff to devote enough time for patient. So our job as a nurse also, I know this is also a phenomenon or a problem that we're facing as nurse in hospital, that it's really hard to give more time to patient because there are a lot of patients who's coming and we really need to give care to other patients. And maybe because only few that time who is working on that shift, maybe they cannot give more time to patient, but patient really need more time where we can talk to them, we can communicate with them, we can give health education to them. But in this time, it's really hard to do that, we as nurses, because we have many things to do. And this is our task, this is what we need to think of. How can we give more time to patient? How can we give more time to patient? It's really hard. But this is what we need to do as a staff or nurses, to devote more time with patient. And we as a nurse also should give good communication skills to them. Well, highly skilled, well trained, motivated, no judgment, and so on. This is what we need to have as a nurse in order for us to give care. Okay? We need to have a good communication skill and so on. And also the environment. Okay, the environment should be clean, should be safe, and should be controlled by good, high-quality provision. Okay, so according to Wood also, 2008, what does it mean by a good nursing? Is number one is professional and technical competence. Number two is by giving empathy to the patient. And the third one is efficiency, good management, and organization, including good leadership, seamless collaboration, and cooperation, and so on. This is what it meant by giving a good quality of nursing. Okay. He also said here that good quality nurse meant that we as nurses, number one, is by giving a holistic approach to physical, mental, emotional needs, patient-centered, and continuous care. Second one is efficiency and effectiveness combined with humanity and compassion. Third one is high-quality evidence-based practice, safe, effective, and prompt nursing intervention, patient empowerment, support, and advocacy, and seamless care through effective teamwork with other professions. So this is our quality as nurse that we need to give or deliver to patients in order for us to bring an impact to them. Okay. Okay, we still have time. The following one is the value of nursing impact on patients and society. Now, we will go deep. What is our value as a nurse? What is our value as a nurse in order for us to bring impact on patients and society? Okay, let's see. Okay, is my voice still clear? Masih jelas suara saya? Am I speaking too fast? Or
Good.
okay, good. Okay, we'll continue. Okay, let's continue. So, according to Florence Nightingale, our core nursing value is nurses need to put patients in the best state of nature to cure them. In other words, our value as nurse is to give the best care to patient. I repeat, our value as a nurse is to give the best state of nature to cure them. In other ways, we as nurse need to give the best care that we can do in order for patient to be cured, to be healed. That is our role as a nurse. So it's not an easy task because we know that many patients has many personality that we need to face. But we as nurses, we need to know how to get along with them in order for us to give the best care to them so they can be healed. Second one is enabling environment to assess care, to make positive health choices. So this is our value as a nurse. The key word here is to cure them. And they can be independent to themselves to give a positive health choices to themselves. This is, according to Florence Nightingale, our core value as a nurse. What do patients and carriers value? According to Gift at All, Our value is by giving empathy, social skills, by being active listeners, and good communication. Being patient, confidence, honesty, preparedness to learn from patient, and no judgmental attitude. So this is our value that what patients want us to do is giving empathy, being a good listener, being a good communicator, being patient, being confident, honesty, and we learn from patient and no judgmental attitude. Okay, so our core value and nursing practice care is like what I mentioned previously, by giving holistic nursing care. Second one, by giving simple tasks, often required embody high level skills, requires academic training and relies on research. So our core value and nursing care, the keyword that what I found out here is we as nurses, we need to have a skill also in delivering care to patient by relying on research, relying on what I've mentioned previously, the newest update that we can bring to patient. And the most important thing is by giving holistic care to the patients. Okay, next one is nursing role, aspect of the nursing role that they valued or care most. So what is most nurses valued about themselves by caring to someone? Okay, this is also from Maben and Griff, 2008, according to a study. The first one, she said, by making difference to patient's life. Okay, so our value as a nurse is to bring difference to patient's life or bring impact to patient's life through a positive patient outcomes and satisfaction. See, our job as a nurse is not easy. Our job, our task as a nurse is we must think, we must be creative to think, how can we help patient to have positive outcomes? And we must bring changes in their lives. According to lung cancer clinical nurse specialists, they mentioned here that the small things make the patients careers is small things. For example, small things like whenever they need help, we help them. Small things. According to oncology nurse, good quality nursing assists individuals, families, and communities to optimize their health and well-being in whatever environment they come together. Second one is our value as a nurse is to be close contact with patient. By being close contact with patient, we will understand to address patient physical and mental needs. But we are close with them. We will be able to know what is their needs physically and mental needs. Okay. Third one is by delivering excellent care. Being competent and professional while treating patient with care and respect and preserving their dignity. Okay. The third one is working in a team and being a role model. So this is also one of our value as a nurse, according to nurses, that our role as a nurse is to be a model. Model to who? Not only model to patients, but also to our coworkers, to peers and juniors. Okay, but that's according to breast care nurse. But according to community nurse, care which is delivered by reflective, well-informed, motivated, non-judgmental staff with patient best interest in mind at all times. Okay, and our value as a nurse also is to continue develop by learning and improving. How can we develop ourselves is by maintaining skills, by following like this, for example, webinars, by updating research, by learning from experts and so on. We as nurses, we need to have a value of always growing and learning and improving ourselves to give the best care to patients. Okay, this is from Mabon and Griff. Also, according to Dawood and Mabon, 2008, pretty much the same. What is our value as a nurse? It's pretty much the same. Making difference to patients' lives is pretty much the same. Close contact with patients, excellence in care delivery, working in team and being a role model, continuous professional development, and so on. So we can see from these two studies that we as nurses, we have a value that we can get in order for us to bring changes to the society. And we need to have these kinds of value in order for us to bring changes to our society. Okay, now that is the role, the aspect, or the understanding of nurses itself. Now, according to public or other care. Okay, so according to another discipline or public, nursing, according to them, the value of nursing is a caring and human attitude by is giving caring and human attitude. So this is according to them. Okay, by respecting privacy, confidentiality, and preserving dignity. Second one is respecting patients' values and beliefs, understanding their needs and treating them equally. So this is what we need to do as a nurse to care with a good attitude by respecting their privacy. Secondly, by respecting their values and beliefs. Therefore, we as nurses, we must learn about humanity. We must learn about how to get along with other people. How can we understand them? Because we know that each person has their own values. Each person has their own beliefs. We as nurses, we need to know how to get along with their beliefs so that we can give the best care to them. Okay. The second one is putting the patient first. So we as nurses, we must put patient first. Okay. By what? By keeping patients informed about and involved in their own care. So we as nurses, we must put patient first. This is what their understanding about us. By keeping patients informed about involved in their own care. So we as nurses, we must involve patients in their decision making. Second one is by communicating with patients. Sorry, can you please mute? Thank you. Third one is meeting patients' basic needs. So this is what it meant by putting the patient first. Okay, there are three parts: by keeping patients informed and involved. Second is communicating with patients. Third one is meeting patients' basic needs. Third one is delivering high standard care service. Fourth one is easily, timely, and convenient access to care. So from this short presentation presentation, I want each one of us to be open to see what is our value as a nurse. Secondly, how can we as a nurse will bring benefit to society, will bring changes to society by what I shared from several studies. So the conclusion for us this morning is, in order for nursing to make an impact on society, we must have a good quality in nursing care. We must be professional, and we must give safety, effectiveness, humanity, and compassion need to be our first priority. So this reflects that nursing was not only a profession, but it needs skills on an art and an attitude. See? So our job, our role as a nurse is not easy. That's why we must be proud to be a nurse, because what we're doing to patients is really amazing. We're doing amazing tasks. And maybe our biggest satisfaction as a nurse, yes, I'm not saying that we don't need money. Yes, we still need money. But for me, myself, my biggest satisfaction when I was working, and I have experience in clinical settings, when I care for a patient and the patient can be healed, that is the most satisfaction that I can get. The most happiest part of my life is when patient is feeling down, they're hopeless, but me as a nurse, I can give caring to them holistically. I can hear them with compassionate. I can give the best care to them, and they can be healed. Third one, close relationship with patient and the ability to make difference in lives were among the most value aspect of their role as nurses. So our biggest role of nurse is to bring difference in patients' lives by having a close relationship with them. Lastly but not least, it is all took in account that we are potential users for of the service and indicated that as potential patients, they would value being respected, treated with compassion and care, and being kept informed about and involved in their treatment. So what I want to us to hold on to be reminded that we as a nurse, we have our own identity. We have our own value. And with that value we have in us, we as nurses, we can bring changes to our community. We can bring changes to patient. Like what I've experienced to you guys, to you all previously, how I can bring changes to my patient when he was sick by giving the best care, by listening to him, by researching the best care I can give to them. And the patient will be thankful. And that is our biggest satisfaction when patient will be healed. Because our concept of nursing is to bring changes to patient and bring health to them. And they know how to deal with themselves. So I hope this short presentation can open our minds and our eyes to see what is our value and how we can bring impact to our society. Thank you so much. I hope that this short lesson can open our minds before other seminar will other presentation will share another amazing topics also that is related to nursing identity. So thank you so much. I hope we learned a lot this morning. I bring back to the moderator.
Baik. Thank you very much, Mr. Dwight. It's a very excellent. Dirinya. Apakah seorang perawat yang baik? Tidak cukup baik. Tidak cukup baik untuk menentukan identitas. Tetapi di dalam diskusi itu saya dapat menyimpulkan, menunjukkan seorang perawat dengan identitasnya harus berkualitas. Kualitas dalam semua aspek yang holistik. Mental, spiritual, ya. Lalu sosialnya dan lain semua. Holistik di dalam pelayanan yang kita berikan sebagai seorang perawat. Selain kualitas seorang perawat, yang terpenting juga adalah value. Bagaimana value seorang perawat menunjukkan identitasnya di dalam pelayanannya kepada pasien atau dia punya clients. Ya, tadi sempat disebutkan di situ adalah dengan kembali, ya, pelayanan yang holistik, ya. Lalu apa? Berikutnya adalah mau mengutamakan pasiennya dengan memberikan yang terbaik untuk pasiennya. Dengan bagaimana caranya? Menunjukkan identitas seorang perawat. Seorang perawat tetap mau menggali ilmu. Ya. Tidak berhenti setelah selesai kuliah, tetapi tetap menggali ilmu, memberikan pelayanan-pelayanan yang baru, ya, dengan penggalian ilmu secara membaca buku, ya mengikuti seminar, ya mengikuti pelatihan-pelatihan, dan juga melihat jurnal yang terbaru. Sekali lagi, terima kasih banyak Bapak Dway dengan presentasi yang begitu baik. Pada waktu ini kami akan memberikan untuk pertanyaan. Langsung ditanyakan pada Bapak Dway.
Signal ya. Halo?
Ya, jaringan kayaknya.
Yeah, I think signal, ma'am. Okay. Actually, there is a question in the chat box below. Sini ada pertanyaan. There is a question. Saya mau bertanya, bagaimana caranya kita sebagai perawat mengubah pola pikir masyarakat tentang kehidupan sehari-hari yang kurang sehat? Misalnya, masyarakat tidak patuh dalam pembuangan sampah, tidak patuh dalam kebersihan di lingkungan sekitar. Apa yang harus kita lakukan sebagai seorang nurse yang ada di lingkungan tersebut? Okay, so I will try to explain in English. So there is a question here. How we as nurse can change the behavior of someone? Like, for example, how can we change the behavior of someone when they are not having a good lifestyle? For example, they are throwing the trash wherever they want. They're not putting in the right place. They are not obeying about health. So how can we as nurses change their behavior? Okay, so I would like to answer this question. This is really good. Actually, for me personally, untuk saya pribadi, untuk mengubah perilaku seseorang itu tidaklah mudah ya. To change someone's behavior is not easy. It's not an easy task. But what I've known, how can we change their behavior? How can we change their behavior? It really takes time. So there are several theories that we can use in nursing, how to change behavior. Okay, maybe you can search also. We can use several theories that we can use to change someone's behavior. We can use health belief model. We can use Pender's model. We can use other theories, for example, like trans-theoretical model change in order for someone to change their behavior. For me, myself, how I change someone is by giving the best education to them, by convincing them that what they need is really important, by convincing them what they need is really important, and tell them that if they're not obeying health, they can get a worse or worsen disease and so on. So in order for us to give the best education and the right health promotion to them is by opening their mind to see if they're not obeying or they're not being to adhere, something bad will happen to them. And if they think that, okay, if I'm not obeyed, then this will happen, most of the time they will want to obey they will want to obey to what the nurses are giving to them. So, but it's not an easy task as a nurse to change behavior, to change someone's behavior. It really takes time. It really needs time for them to be changed by giving education, by being patient to them, by being close to them. Okay, and once they believe in what we are saying, once they believe in what we are trying to tell them, and they believe that what we're saying is true, they will follow us, and they will try to be adhere to what they want, to adhere to health and so on. So maybe this my answer can answer your question.
Okay. Terima kasih. Berikutnya, ada yang mau bertanya? Silakan. waktu. Silakan yang mau bertanya. Ya.
Okay, if no one want to ask, I'll ask then. Okay, maybe anyone, or maybe I'll ask if not. Sorry, signal maybe.
Oke. Pertanyaan kesiannya,
Oh,
masih
Kita kayaknya.
signalnya kurang bagus.
Sepertinya signal ya.
hello. Sorry, I think the reception is not really good here. Hello. Can you hear me? Bisa dengar nggak?
Ya, silakan Dwight.
Yes, Dwight, we can hear you.
Okay, udah kedengaran? Can you hear me? Because I think the reception
Yes.
is not really good here because it's raining here, so the reception is not really good here. So ada pertanyaan lagi or not? I'll ask question. Hello, sir John Paul. How are you?
Hello, Dwight.
Anyone else? Atau nggak lanjut aja, Kak? I think.
Lanjut, Dwight.
Oke. Atau lanjut aja ke pembicara berikutnya ya?
No,
Kalau misalnya
ada pertanyaan
nanti
satu lagi. Ada pertanyaan satu
Ada.
lagi.
Oh. Ada pertanyaan lagi? Actually, this topic is not very hard ya, nggak terlalu berat. It's very basic. It's very basic. So I think most of us already understand. Okay. Okay, Rosa. Okay, there are several questions here. Number one, masih banyak perawat-perawat Indonesia. Okay, Dimas Adi Saputro asked, there are a lot of nurses here in Indonesia who care for patients and family that didn't give holistic care to patients. How can you give these suggestions to the nurses? Thank you. Okay. How can we give these suggestions to nurses is by reminding them that this holistic care to patient is very important. And why is very important? We must also open their minds by giving the newest update evidence that we can give to them. And we need to convince them that this is need to be done. And how can we convince them is by reminding them, always reminding them, and giving the newest update to them. And hopefully, when we continue to talk to them, to share to them about the newest evidence that we have found, hopefully they want to give the holistic care to patients. But on the other hand, it's not an easy task to do, because by giving holistic care to patient needs time. And we know that we as nurses, we are very we are very hectic with our duty in the hospital. We need to do this, and then suddenly there's another patient need help, so we cannot be focused. So this is also one thing that we as nurses, we need to figure out together. How can we deal with this phenomena? Maybe by making a great system in the hospital in dealing with patient and so on, or maybe from the top pemerintahan, yeah, or from PPNI and so on. Okay, another question here: how to make people aware or not believing in COVID? Ask how to show the identity. Okay, how to make people aware of not believing. What does it mean? How to make people aware of not believing. Oh, I ask how to show the identity of our nurse. Okay, for us as a nurse to show our identity to those people who don't believe in COVID is by trying to understand their value, their belief. Like what I mentioned previously, we as a nurse, our role as a nurse is to know the belief, the value of each person. Okay, we must know why don't they believe in COVID and so on. But that's why we need to assess them more deeper and find out why they're thinking like that. Because someone don't believe in COVID and so on, it's because there's factors behind it. And we as nurses, we need to assess it more deeper. Why this patient, these people, they still don't believe in COVID. We need to go deeper to them. We need to know their belief, their value. That's why what I mentioned also in the slide previously, our job, our role as a nurse is also to know the value of patient, to know their beliefs. In order to know their belief, we will know how to get involved and to talk to them and be closer to them and try to change their perspective and so on. Okay, I hope it answers your question. Okay, another question is, bagaimana trik agar tetap eksis dalam teamwork jika ada beberapa di antaranya yang toxic person? Waduh. What is the trick in dealing with coworkers that is so it won't be too toxic? How ya? Bagaimana trik agar tetap eksis dalam teamwork? Yeah, for me, what will I do is to focus what is my main job. Untuk fokus sama apa fokus saya dalam merawat pasien. Ya, dan fokuslah untuk mencapai bagaimana pasien itu bisa sembuh. Focus on how patient will be healed. Because I know that sometimes in work we'll be toxic with our coworkers and so on. But we must put our mindset, what is our focus? Our focus is to bring the best care to patient and for patient to be healed. Okay. Another question here also, bagaimana caranya menyadarkan masyarakat tidak percaya COVID? I think this is also same question. Okay, I already answered it.
Oke, terima kasih Pak Dwight atas jawaban semua pertanyaannya. Apabila ada partisipan yang kurang puas, boleh langsung japri ke Pak Dwight. Okay. Dan kita akan masuk kepada sesi yang kedua. Okay. And now we go on to the second topic. It's about...
Mem, sebentar kita foto bersama dulu untuk dokumentasi. Jadi
boleh semua buka dia punya video. Ini ada 9 ya slide. Boleh dibuka semuanya supaya kita bisa mengambil foto bersama sebelum masuk kepada sesi yang kedua atau topik yang kedua. Saya masih lihat.
Who will take the picture before second speaker? I think mungkin teman-teman, Bapak Ibu boleh menyalakan kameranya karena ini katanya butuh untuk didokumentasikan juga.
Sebagai report ya, jadi mohon
ya, untuk report.
Untuk bersedia buka kamera sebentar ya.
Silakan, Ibu Sastra.
Iya.
Oke, semuanya kita foto dulu ya. Ikuti apa-apa saya. 1, 2, 3. Oke. Untuk slide selanjutnya. 1, 2, 3. Oke, untuk foto terakhir. 1, 2, 3. Oke, terima kasih semuanya. Oke, silakan saya kembalikan kembali.
Baik, terima kasih untuk sesi fotonya. Baik, berikutnya, the second topic. Well, the topic is about sharing the nursing identity by Mr. John Paul. Mr. John Paul comes from Philippines, I guess. I think Mr. Dwight can introduce him. Can you introduce him to us?
Okay, so Sir John Paul, his nationality is from Philippines, but right now, currently, he is working in Qatar. And if I'm not mistaken, in research, right, Sir JP?
Yes.
Yeah, research as a researcher in a hospital there, and he also had experience teaching also in Philippines in many schools. And actually, Sir John Paul is also my friend, and he is my classmate also, and he will be also sharing to us this morning.
Hello. Good morning, everyone. Selamat pagi.
Good morning.
How's
Selamat
Indonesia? Can I share my
Indonesia
screen
is
slide?
Yes.
Yes.
Well, Sir JP, you're very handsome using suit.
Thank you so much. So, good morning, everyone. I am John Paul Ben Silang. I'm currently the acting director for nursing research in Hamad Medical Corporation in Doha, Qatar. I hope you know where Qatar is. It's in the Middle East. It's near Saudi Arabia because the most common country in the Middle East, Saudi Arabia. But actually, there's also Qatar. So I worked in the Philippines before as a teacher, as a professor in a state university. My clinical background is in operating room, emergency, post-anesthetic care as well. So actually, I am taking PhD in nursing in Silliman University, where I met Dwight. He's a good friend. Yeah, I agree with that. And I'm so happy to see him again because it's been like a long time already. We haven't met in the virtual meetings and classes. And I see how he really improved as a mentor, as a presenter, as a nurse, as a professional nurse. So I'm really proud to see him around and presenting and sharing to you some ideas about what is really nursing. And I can really feel the passion within him, the way he presented the value of nursing and how we should value our profession and our patients. So congratulations, Dwight, for a very good presentation. I would like to thank everybody for inviting me for this conference. I've been to Bali, Indonesia before in 2011, and I really had a great time there in Bali. So I hope COVID-19 will be controlled more so that eventually I can go back to Bali. I told Dwight about Bali, my experience. Okay, so let's move to my topics. I hope this topic is really interesting to you. I see some 58 to 70 participants, nurses from Indonesia, and I hope you see the value of shaping your identity as a nurse, shaping your identity as a nurse from Indonesia. So that will be my topic for today. Shall I proceed, Dwight? Okay. So in my presentation, there will be 5 parts. The first part is we're going to review how the nursing profession was developed and the definition given to this term. Discuss the attributes of nursing profession. What are the 4 domains of professional identity in nursing? And how are we going to promote our professional identity as nurses? And review 3 evidences about or research which tackled professional identity in nursing. So let's move on to the first part. Let's define nursing profession. But before we move to the definition, let's try to see how nursing identity was developed way back with Florence Nightingale, right? But during the 1870s to 1950s, they see nursing more of a vocation. Vocation in a sense that there's a virtue of good character. If you have a good character and you have a nursing background, then that's your identity as a nurse. But in 1960s, the nursing profession developed several competencies. So these nurse competencies that we have right now is actually derived from a behavioral psychology, which they think is not enough to say the identity of nursing profession. That's why now, at present, several scholars and experts are trying to combine the virtue and also behavioral principle of nursing practice. Because they believe if we combine having a good character and that competency in nursing, having them around, then we can establish our own professional identity as a nurse. Because if we look back, before, we are viewed as like servants, like we are viewed like assistants to the doctors. They think that we cannot function without the doctor because we depend on the doctor. That's what we're trying to change. We have our own identity as a nurse, as a nursing profession. That we have our own role. As what Sir Dwight said, we have our own character, we have our own professional, we have our own discipline. So looking at the nursing profession in 2011 as defined by the Institute of Medicine, nursing practice, they said, should be practiced in the full extent of the profession. So when you're a nurse, you have to practice it in a way that you can really be seen and developed as a nurse. Not just like being an assistant of the doctor or just like a servant. That's what they trying to say before. That nurses should not be just assistant, but work as a partner. When you say partner, it means you're sharing your ideas, right? You're sharing your knowledge to the doctor. You're sharing your knowledge to the respiratory therapist about treating COVID-19 patients. So you work as a partner, active partnership. It's not like you are there and you're just listening to the doctor. No. Share your ideas, share your knowledge, show your skills, how you can be a good nurse. Okay, in a way, if you share yourself as a partner, then you are helping the organization to improve. You improve your hospital. You improve your healthcare services. Don't just sit there and take care of the patient. No, you have to help the hospitals and the healthcare systems improve. You must help how the doctors take care of the patient, which actually is happening right now, right? Even the doctors ask you, what are we going to do with the patient? It means he's trusting you. It means he's partnering with you. That should be the identity of the nurse, not just sitting there and listening to the doctors, listening to the artists, listening to the other professionals. You work as a partner. That's what IOM is saying. You need to practice to a full extent that you are a nurse and a partner. So there was an event that happened in USA. They called that the Think Tank 1, okay? During the Think Tank 1, there was like a gathering of 50 participants who were all nurses. And they made this organization, which they call the ISPIN, which stands for International Society of Professional Identity in Nursing. So the task of the team is to create what is really the identity of nursing profession. What makes you different from other healthcare professionals? What makes you say that you are really a nurse? That's the thing, right? So that's what the ISBIN is trying to do. So they defined the following to make us really a unique profession. We are different from the doctors, we are different from the chemists, different from the biologists. We need to identify our domain of nursing profession. What is within us as a nursing profession that is not the same with others? What are the competencies of the nursing profession? And then they created something that will reflect, that will tell us that if you know your professional identity, then you can create an impact. So they created the tree of impact. So if you look at the tree of impact, it's a symbolic meaning of how the professional identity is formed and how the professional identity can have an effect. Okay, so if you look at the bottom of the tree, you will see the roots. And in the roots, you see the foundations of a professional identity of nursing. Okay, and that is, you need to be, if you look at the tree, what words can you see in there? You have social support. You have psychological safety, inpatient environment. These are the foundations that will form your professional identity. But along with that is you need to be with integrity, accountability, knowledge. You must have the knowledge of the nursing profession before you before you identify yourself as a nurse. Then in that way, you can bear some fruits because there'll be some positive effects if you know the identity of yourself as a nurse. Okay, you will have good engagement. You will have good clinical judgment. These are the things. I mean, the thing is that if you know your professional identity and develop it, eventually have a good impact. That's the thing. There'll be some positive effects. Then they gathered again in the think tank 2. And in the think tank 2, the organization developed the mission. What is the mission of the organization? To illuminate and foster professional identity of nursing around the world. So that includes Qatar, where I'm working right now. That includes my country, Philippines, and that includes Indonesia. Certainly, that you need to promote, illuminate, and foster, build, okay, your professional identity as a nurse in Indonesia. What is unique among Indonesian nurses? Something like that. What makes their nursing profession different from others? And what makes their nursing profession the same from all nurses? You need to establish that. So the vision of the ISPIN organization is that every nurse, that includes you, I suppose 73 of you are nurses, that includes you, every nurse in the world should embody, should feel, should act, should think as a nurse. Okay, you need to embody that yourself, the professional identity, okay, of nursing, so that you can promote the well-being of the people you serve. Because if you don't know your professional identity as a nurse, then you cannot work effectively as a nurse. You cannot promote health, as what Dwight is saying. We cannot promote the well-being of the people that we serve, the families, the communities in Indonesia. That's the thing. So you need to know your professional identity. So now the organization make another term of what is nursing profession, professional identity of nursing. They said it refers to the sense of oneself. What is sense? What is sense of oneself? Sense, you can feel, you can hear, you can touch, you can see yourself, okay? And in relationship with others, meaning you work with others, not only yourselves. After sensing yourself, you need to relate yourself to others. Who are these others? The patients, the families, the communities, your workmates, your fellow nurses, right? Doctors, and influenced by the characteristics, the norms, and values of the nursing. So once you sense yourself and you relate yourself to others, this should be based on the characteristics, the norms, and values of nursing. Okay? When you talk to the doctor should feel that you're a nurse. When you talk to the patient should feel that you're a nurse. What is that? It's not like when they see you, hi doctor, it's not like that. They should say, hi nurse. Okay? Because at times in the clinical setting, when the patients see us, they will say, good morning, doctor, because they think we are doctors. So how can we promote our professional identity? if the patient do not recognize that there is a nurse, that there is an Indonesian nurse with them. So when you sit near the patient, they should feel that you are the Indonesian nurse serving me or helping me to get well. That's why if you know your professional identity as a nurse, you think like a nurse, you act like a nurse, and you speak and talk like a nurse. That's the thing, okay? So let's go back so that you will know how to become really like how you identify yourself as a nurse. You make sense of yourself, you work with others. This working and sensing should be based on the nursing discipline. Then eventually you think, you act, and you talk as a nurse. Do not act and talk and think like a doctor, okay? You have your own identity, okay? It's very clear, okay? So what happens if you don't know your professional identity? The question now is, do you know yourself? Do you ask yourself, do I know myself? Do I know my own self as a person, as a nurse? Because if there's a problem of knowing yourself, you don't identify yourself as a nurse, then this will happen to you. You have failure in clinical reasoning. You cannot reason as a nurse. You might reason like no scientific basis. You might reason like you don't base it on the nursing principles. You might reason not based on the science of the human body. So you must have professional, or else you cannot act and do like a nurse if you don't know your professional identity. And you cannot grow because at first you don't know that you're a nurse, right? So how can you grow to become a head nurse? How can you grow and become a nurse manager or a director, perhaps like me? So how can you become a nurse researcher? How can you become a nurse educator if you yourself don't know your professional identity as a nurse? So for you to grow and become more as an expert nurse, you know Patricia Benner, right? Patricia Benner said you need to start from a beginner, then eventually become an expert. And you cannot be an expert if you don't know your professional identity. So you cannot grow, okay? You remain the same in the same state. So if that is the thing, so what happens if you know? Sorry for the slide. What if you know? What if you know your professional identity? You will have a positive well-being. You'll be satisfied with your work because you know your identity. You know your limits, you know your role, and you become an asset to the healthcare organization because you become a partner, okay, to the patient, to the workers, and also to the organization. You'll be an asset, okay? We're done with first part. Let's move on to the second part. Are you excited now how to shape yourself into the nursing profession identity? I hope I empower you now to, like your question right now should be like, then how can I become a nurse? How can I integrate the professional identity of a nurse? Okay, so what makes me distinct as a nurse? Okay, that's the thing. So first thing is you need to know your attribute and shape that within you, build that within you. So the first thing is, you are a nurse right now, right? The question is, what should I do as a nurse, right? Okay, should I give medication to the patient? Should I make order on what to do with the patient? Should I make a nursing care plan? Okay, so the first thing is you need to embrace first, what is the rules? What is the rules of the society about the way they see a nurse? And what are the expectations of the society whenever they see an Indonesian nurse? They see a nurse, a Filipino nurse, something like that. So there should be a professional standards or codes within your organization. Okay, what are the professional standards or codes of practice of nurses in Indonesia? This will tell us from the society perspective, he or she is a nurse. Okay, But in the international, we have the International Code of Nurses, or the ICN, right? By the International Council of Nurses. So they make a uniform code, practice standards on how nurse should be identified professionally. I hope you know the International Council of Nurses, okay? So your country should have your own professional standards of nursing practice, right? And you need to follow that, because that's what the society expect you to do, expect you to become. Clear? And then you need to function within the boundaries of the prescribed role. So you need to practice it as stated in your practice standards in Indonesia, or the International Council of Nurses. Do not go beyond that in time, in function, within the scope of practice. So that's why, if you notice, in certain countries, there are board exams for nurses, because the board exams will tell you that you know what to do as a nurse. If you will not pass the board exam, or if you will not graduate a nursing course or a nursing degree, because other countries don't have board exam, they have nursing degrees in a certain school or university. If you did not complete these subjects or pass these subjects, then definitely they see you as you don't really have the competence, or you don't know what to do as a nurse in your area, in your country. I hope you get that. Okay, you should follow a set of standards to be a nurse. Then what should I be? How can I become a nurse? Okay, in myself. It's more of like making decisions from the framework of rightness, because we are made to do the right thing. Are we made to do the wrong thing? No. Even in the exams, when you take exams in the nursing, they will give you several options, right? For example, how are you going to give the antibiotics to the child? Okay? Are you going to give it intramuscular, intradermal, right? Subcutaneous? Are you going to give it per mouth, per oral? There's a right thing to do. So we should do the right thing. So become nurses. So you need to follow also the individual's core values, because doing the right thing is inherent to us, right? We are trained to do the right thing. That is an inherent quality to everyone. So it depends on yourself right now. You need to control yourself to do the right thing, and that makes you a nurse by profession, doing the right things to become a nurse. Next, ethically act. How am I going to act? Okay, ethics means what is the right or the best thing to do. Okay, what the society should dictate you to do, which is right. So which one is right, which one is wrong? So you operate on the foundation of values and making fair and just decisions personally and professionally. You need to think of the best decision that is fair, not harming the patient. Okay, not putting the organization in danger. You need to protect the patient. That's what Dwight is trying to say, right? So that's why you need to know the ethics of your practice. If you take up nursing, there will be like a topic on ethics, right? So at times you will see some bias, because in real life, bias exists, but make sure that you don't consider this as part of you need to see this, but you need to reduce the bias or remove the bias, eliminate the bias in decision making. Then you can do an ethical way of acting like a nurse. If you consider the bias and neglect the bias, just do it with bias, not doing the right thing, then that's not ethical. Do the right thing. Like, for example, confidentiality of the patient. Are you going to reveal the information of the patient to your mother, to your father, or to your friends? No, that's not right. That's not ethical. So keep the confidentiality of the information of the patient. Don't share to others. That's one thing of doing an ethical way of treating data about the patient. Then how do I grow? So as a nurse, you need to grow. Okay, you need to become, as what Patricia Benner is trying to say, you are from this stage, beginner, then you become an expert. Okay, as you go on with your practice, you grow. Okay, there should be a continuous positive growth, professional growth, along in the continuum of your practice. So the more you work in the area, the more you become an expert. Have you tried like you're working and you already expect what will happen to the patient? You see a patient, a pregnant mother for the first time, okay, first pregnancy. What will you expect from the mother? She will have more challenges in delivering the baby. And you develop that one because you notice that one in your practice, okay? And the more you grow, the more you metamorphosis, the more you undergo metamorphosis and transform to a higher level of maturation in your profession. Like for me, for instance, I worked as a clinical nurse before, then I become an educator, then I became a researcher. And then I realized that nursing profession actually involves growth. And that is part of professional identity. You may not become a researcher, you may not become a teacher, but in your area, you become the head nurse, you become the source of, what do you call this? People depends on you because you know well of your patient, you know well of the organization, you know well of the practice. That is growth. You need to flourish that with you. You need to grow with that. And the last one is you need to change your identity. Do you believe that the world changed? Indonesia changed, right? Indonesia before is different from Indonesia now. The world before is different from the world now. I'll give you, for example. Before, is there cell phone in your in the world or in Indonesia, in the Philippines? No, there's no cell phone before. What have you noticed in the picture that I'm showing you right now? Anybody would like to share? What do you see in the picture and how do you see the change in the picture? May I hear from anybody? Hello? Any volunteers who would like to?
Halo, ada. Halo, mengikuti.
Hello, yes.
Halo,
May I know
halo.
your name, sir? Hello, yeah.
Halo, halo.
Yes.
Yes.
What do you see in the picture? How do you see the evolution of the nurse?
I think the equipment.
The equipment, very good. The equipment. See, before you have this equipment inserted in the pocket of the nurse, scissors, pens. But as you see, as the nurse progressed to the present right now, there is like a cell phone. There is like she's holding a gadget in the right hand, pockets with many controllers, stethoscope, and you can see in the ear. Yeah, there's earphones. So the world is changing. In fact, right now there's telehealth, right? There is electronic health records. So we need to evolve, okay? As we progress through developmental stages in life, multiple identities emerge. The profession, the nursing profession identity may be like this now, maybe in the future it will change because the world changed and we have to adapt to changes. So it is very important to understand how these identities may change and new behaviors accompany these changes. So you have to behave also in the way the world changed. It's part of professional identity shaping because we're talking about how to shape you according to your professional identity. And that is you need to evolve. Okay? And understand the transition because before you're a student nurse, right? Like me, I am a student nurse. Then I became a clinical nurse. Understand the transition from being a student to becoming a professional nurse. What is your identity now? Because a student nurse has a different identity from a clinical nurse. So you need to change. You need to understand this one for you to grow and to become like, so this is the professional identity of nursing. This, how should I become as a nurse? So as I said a while ago, there should be a practice standards that you need to follow for you to know your identity. And this example is the ICN, Code of Ethics for Nurses. So the ICN Code of Ethics for Nurses is composed of statements of what are the ethical values. What is ethics again? Okay, doing the right things. What are the right things? What are within the standards? your responsibilities, and professional standards of nurses. So organizations, countries are actually following the International Code of Nurses as to what nurse should do in the hospital and what is her role. Okay? But it varies when it becomes to countries because there are so many factors we need to consider. Culture, economy, resources. So the code of practice in Indonesia may be different from the code of practice in the Philippines or from Qatar, but there are similarities because of the International Code of Nurses by the ICN. So the ICN says that this code of practice can guide everyday ethical nursing practice and can serve as a regulatory tool to guide and define ethical nursing practice. It can be used by nurses in everyday choices. Okay. The revised code highlights the need to protect and support nurses and ensure they have the appropriate education, training, and resources to provide the highest quality of services to the patient. Okay, quality of care. So the thing is, like, there should be a standards that identify you as a nurse in your country, and you can follow the International Code of Nursing. Okay. Now we're done with the second part. Let's move on to the third part. How much time do I left? Have I left? Dwight? Do I still have time?
Yeah.
Okay. How many minutes do I have? Still have?
I think
20?
15 more minutes. 15.
15. Okay. I have 15 minutes. Okay. So know your domain. So what is with you as a nurse? What is your domain? What is in your realm? Okay. First is you must have leadership as a nurse. Okay. As a leader, you need to have influence. Okay. How can you convince a patient to take the medications? How can you convince the patient to stop smoking? Okay. How can you convince the patient or the mothers to do family planning? Or how can you convince the patients in the community to perform practices that prevent malaria, which is common in Indonesia? And I heard that there's also malaria in Indonesia. Same with the Philippines for malaria. So how can you convince them? You can convince them if you have the power of influence. And that is how to inspire. Okay? You need to inspire others, but before you inspire others, you need to inspire yourself. If you cannot inspire yourself to do good things, promote health, prevent diseases, treat diseases, then you cannot influence others. So you need to inspire yourself first for you to transform others. And in the transformation, there should be a shared decision making. It should not be only you who's deciding, but also the patient, the community, the family should also be part of decision making. Then you have a good leadership skill. Okay? Knowledge. Can you become a professional nurse if you don't go to school? If you don't know the standards of practice? The standards of practice can be learned in school, right? Can be learned in the training, seminars, okay? In fact, you are tested in the exams, in the school exams, right? So you need to have the knowledge. And knowledge and learning does not stop in the school or after taking the exam. Knowledge should be built. Okay, as you experience your practice, as you work in the hospital, okay, as you do some critical reflection, because at times there are errors in the hospital, right? There are even conflict with the doctor, conflict with the nurse. But these are telling you to reflect. What have I done wrong? Why is it that patient did not follow my instruction? That is critical reflection. Okay, that is building knowledge within you as you practice. And what Dwight keeps on saying, research, know the research, the updates. What is the recent updates? Then you have the knowledge. So the source of knowledge is like your experience, your reflection of your experience and practice, and updates about nursing practice. Okay, and try to apply this information, then it becomes a knowledge. Next is values and ethics. I think Dwight's keep on saying value. What are the values of the patients? Okay. So within your practice, you need to be guided, okay, by a set of core values and principles in your conduct. So in Indonesia, in wherever you work, like for example, you go to America to work as a nurse, you go to Qatar or Saudi Arabia or Middle East to work as a nurse, you need to know the core values and the conduct of your practice in that area, so that you know how you're going to work as a nurse with your own identity, okay, as a nurse. Next is professional component. It's very important to behave professionally. Have you noticed some teachers, they will tell you, oh, you need to behave like a nurse. In fact, they will tell you, stop doing that. Behave like a nurse. Because a nurse, by profession, you should have your own identity. You have the way to think, the way to act, and the way to talk as a nurse. That's very important. Especially for the teachers right now who are teaching right now, is joining the seminar. You need to tell them to act, your students or your colleagues, to act, to think, and behave like a nurse. Because we have our own identity. Until we don't do that, they don't identify as a nurse. Okay, so let's go back to the domains. You must have the knowledge. So you must finish your BS nursing or diploma in nursing. You need to build your knowledge in nursing profession. You need to learn from your mistakes, learn from your practice. You need to read research. You need to read updates, attend seminars, attend conferences. Okay, you must have leadership. You need to have the power to influence others, and to influence others, you need to be inspired by yourself, and also encourage others to have a shared decision making. It should not be only you deciding, also the patient, the families, or the organization should be deciding. Professional component: think, act, and behave as a nurse. You need to have set of values and ethics as to what to do is right and what is not right as a nurse. Okay, we're done with the domains. Let's go on to promoting professional identity. So you know the attributes, you know the domains. How can we promote our professional identity as a nurse? Number one is education. Okay, as what I discussed a while ago, before, nursing profession identity is more of a virtue, a vocation. That's why you have different ceremonies in nursing. You have the pinning and badging ceremonies, something like that, having a good character. But now, there should be a combination of virtue and competencies. Okay? That's why we need to educate practicing nurses, also the managers and the directors and the administrators, about what is the identity of nursing profession. What are the domains? Okay, what are the domains again? Leadership, knowledge, professional component, and values and ethics. And the benefit that it can promote job satisfaction, it can promote a good well-being, it can promote a good working partnership with the doctors and the organization. Number two, develop a professional identity statement for the organization. So you need to meet, okay? You need to meet and discuss about your professional identity in your organization. So this is our professional identity, okay, in relation to the professional identity of nursing recommended by the ISPIN. So there should be like, what is the professional identity of nursing in Indonesia? Okay. Next, align your definition with the domain, okay, and the organization's vision, values, and professional model. Because one main factor in professional identity is the context, which means where are you working and what time are you working. As I said a while ago, professional identity now is different from professional identity in 1970s, in 1860s. Because professional identity changed with time, right? So you need to know the organization's vision, your hospital's vision, the Indonesia's vision, values, and professional model, and try to develop the domains and definition of the professional identity of nursing in Indonesia. Next, utilize exemplars and debriefs of actual practice situations. So you need to talk to the nurses, okay? Who has examples of showing professional identity, okay? These are people who are so inspiring, people who are successful as a nurse, people who patients look up to. I think you know these people in your hospitals. There are like popular nurses. They're very popular because of their good service and the professional identity. So talk to them, ask them how they embody, how they develop the professional identity of nursing. Okay, then everybody will learn from her experience or from his experience. Okay, last one is create a brand consistency. Okay, do not drastically change the professional identity of nursing. Create a brand, keep it, okay? And try to make a distinction of your nursing professional identity from others. How you differ from the doctor, how you differ from respiratory therapists during COVID-19. Okay, what is the role of the nurse during COVID-19? That's a professional identity. How did the nurse behave, act, and help the organization during COVID-19? That's a professional identity. Okay? So you need to keep and maintain the brand of the nursing profession as an identity from others. Okay? We're done with the part 3. Let's move on to the part 4. Let's move to the last part. So I searched several articles, published articles about professional identity. So I choose the best 3 so far so that we can learn from these evidences. As I said a while ago, one of the things that can build knowledge in the profession of nursing identity is to look at the updates in research. What are the new knowledge generated in research about professional identity? Okay, then we can learn from that. So the first one is really good. I saw this article. It was like, what is the professional identity of Japanese nurses? Okay, how do they see professional identity? Maybe you can do something like this in Indonesia. Interview some nurses. How do they see the professional identity of Indonesian nurses? Okay, so the aim is to explore. So definitely possibly they do qualitative research. Okay, the process of how you can professionally identify yourself, establish professional identity of Japanese nurses. So number one is you can identify or build your professional identity by learning from working experience. As I said a while ago, reflect what made you committed a mistake, what made the patient smile, what made the patient recover, what made the doctor happy with your work. Learn from working experience. Okay, recognize the value of nursing. How important is nursing, okay, in your organization? As what Dwight keeps saying, what is the philosophy of nursing? Okay, how are we being derived? How are we going to practice? Okay, education. That's very important, right? Having commitment to nursing and integrating nursing as part of yourself. Because by definition, sensing oneself that you're a nurse is one of the important elements to know the professional identity of nursing. Okay, and they said in conclusion that bonding into nursing, the more you stick yourself into nursing principles, the more you develop your professional identity to nursing, and that is what's happening in Japan. Okay, in Japan, they see establishing professional identity by sticking, by adhering, by bonding with what is nursing. Okay, that is the way to establish professional identity in Japan in terms of nursing. Another study that I found out which is really good is exploring now how the new registered nurses identify professional identity in the hospitals. Because there are many settings. There's also hospital, there's like community health centers, right? There are like academe, okay? So the study aims to describe and explore the experience that contribute to the construction of professional identity. What is the construct of professional identity among hospital nurses 1 to 3 years post-graduation from the school? They found out that the professional identity is influenced by the situation. It depends on the situation. As what I said a while ago, the professional identity of nursing depends on the context, the time, okay, and the situation that is happening. Second is the need for balance and support in the practice environment. Whatever experience you encounter in the practice environment that needs balance and support, that influences the construction of professional identity in the hospitals. And another thing is the need for organizational support. The more hospital supports you, okay, the more it is working well on establishing professional identity. And the last study that I found out is a literature review about what are the factors that can influence your perception towards professional identity in nursing. Okay, and the finding says that you yourself is one of the factor. Okay, the nurse itself is a factor. You cannot establish the identity of nursing if you don't consider the nurse herself, right? And how the nurse act in the area, right? The practice tells you that this is the professional identity of the nurse. Okay, and the last one. That's why it's very important that you think, you act, and you behave as a nurse, because that is one of the factor. And the last one is the practice setting. That's why, where are you working? We'll have a development of a specific professional identity of the nurse. So for Indonesia, you can have your own professional identity, but built within your specific context or area of practice. Okay? But one thing that is I like to highlight in their project, because it's a literature review. A literature review means you compile several studies and try to review the findings, right? They found out that the study about professional identity over time is actually lacking, under research. It means it needs more research projects, So maybe in Indonesia, we can have 5, 10 research projects about professional identity. That could be a good one, right? I'm giving you a topic for your thesis already. Okay, in conclusion, nurses, as we are, all of us, 73 of us, should cultivate, adopt, name, form, and foster. What do you mean foster? Build it, feed it, okay? Nurture it. Nurture the professional identity of nursing, okay? Nurses, 73 of us, are the faces and representatives of professional identity. We are the nursing, and we illuminate, we display, we show what is nursing, okay? And that will shape professional identity of nursing. And the last one is that the concept of professional identity in nursing needs more research. So I'm so happy and so glad that you included nursing identity in this gathering. Because until we don't talk about it, then it will not be fostered, flourished. The more we talk, the more we do research about it, the more we establish a concrete professional identity of nursing. That's it. Thank you.
Wow. Thank you so much, Sir John Paul, for the wonderful presentation about shaping our identity as a nurse. So,
Dwight, how do you say thank you in Indonesia?
Selamat. No, terima kasih.
Salamat.
Terima kasih.
Salamat. Terima kasih.
Yes, terima kasih.
Terima kasih.
Yes, like what Sir John Paul has mentioned, that we as nurses, we need to shape our identity by the update of what is happening right now. So, to all of you, if there are any questions, feel free to ask. If you're shy to speak, you can chat in the text box.
Yes.
I think there are a question here from Bruce. Wait, let's see. From Ferry Slitonga. The question here is, as a professional, a nurse should have position as a partner to doctor, but in the daily reality, the nurse position just as a servant to a doctor. This condition is made by the culture of healthcare organization or management of the hospital. What should we do to change this condition?
Okay, that's a very good question, a really good one. I can relate to that. I can totally relate to that. Actually, when I worked as a clinical nurse before, not in the academy, not as a director, I really felt the same way. Like you feel like whatever the doctor tells you to do, you follow. Okay, that's the thing that we want to change. I'm so happy that you mentioned that. How are we going to change that? According to the ISPIN, the way to change the doctors from seeing us as like assistants or seeing us like servants, even to the patient, some patients, they see us as like servants, right? Is to know really our professional identity. Okay, you need to shape yourself according to the professional identity of nurses, because doctors, if they don't feel you as a nurse as should be, they will remain to treat you the same way as it is. That's why there's a practice standards. You need to know the practice standards. And with the practice standards, you need to be an expert of it so that it will show to you, it will emanate the way you talk, think, talk, and behave is a nursing profession, not just a nurse, professional. You're a professional. You should be treated a professional, not just somebody, a helper, or like somebody who just follow what he wants. Okay, that's why the professional identity right now of nursing profession is strengthened. And as what I said a while ago, the face and the representation of the nursing profession is us. So it should start with us. And how we're going to start that? We ourselves should be aware of what is our identity as a nurse. Then we need to talk, think, behave as a nurse professional. Okay? Because before we think nurse is like somebody who helps the doctor. We are professionals. You need to fight for your right in a professional way. You need to talk in a professional way. You need to consider problem and solve the problem in a professional way according to our identity. Then slowly, Shwashya, nurses, doctors will eventually, okay, so they are not just helpers. They are professional nurses. We need to listen to them. I think this one is really important also for those nurses who have been in the practice for how many years? Like 20 years, 30 years in the operating room, 30 years in the labor and delivery. At times the doctor will ask you, right, nurse, what am I gonna do? Nurse, what should I do? Right? It means the doctor is asking help from you as a partner. That is your identity. Okay? So this is a good start. Be a leader, have the knowledge. These are domains, right? Be a leader, have a knowledge, know the values and ethics, and know the professional component of being a professional nurse. Think, act, and behave as a nurse.
Thank you, Sir JP. I hope you answered this question. To Ferry Siltonga, apakah terjawab pertanyaannya?
Ya, terima kasih. Jadi saya bisa.
Hello, Ferry.
Ya, hai.
Selamat. Good morning,
Selamat.
Ferry.
Selamat pagi.
Are you from Bali?
No. I'm from Batam.
Batam. Where is that? Is that far from Bali?
Near Singapore.
Batam, Pulau Batam.
It's near Singapore.
Near Singapore.
Near Singapore.
Yes.
Okay, good.
Oke, dari jawaban yang disampaikan, jadi saya sebagai perawat bisa menangkap, karena ini kan kebudayaan ya, kebudayaan suatu negara mungkin atau suatu daerah, dan di Indonesia khususnya yang saya bisa tangkap, perawat dan dokter itu mungkin kita punya kita profesional dalam pekerjaan kita, tetapi di satu instansi itu khususnya di Indonesia ini belum mengakui profesi kita, jadi kita itu memang belum dianggap. Walaupun mungkin seperti yang tadi sudah disampaikan, dokter itu terkadang bertanya kepada kita, ini sebaiknya bagaimana ya, karena kita sudah memiliki pengalaman di dalam situ, tetapi ya hanya sebatas itu. Kalau kita melihat di profesi yang lain, kalau kita memiliki satu skill itu semakin meningkat. Tetapi kalau kita bekerja di instansi di Indonesia ini, khususnya di rumah sakit itu tidak berlaku. Apalagi kalau kita tidak getolnya itu harus naik gitu. Jadi ya begitu sajalah. Intinya kalau kita profesional, mau dimanapun kita bekerja, diakui apapun tidak, tetapi tunjukkanlah profesi Anda. Sebagai perawat ya, tunjukkanlah nilai yang terbaik yang harus kita lakukan kepada pasien. Mungkin itu yang bisa saya tangkap. Terima kasih.
Oke, terima kasih. Sir John Paul, you understand?
It's a very long one. But I feel that it's more on the experience. So it's a good, I think it's a good comment. What is it like?
So actually what she was saying that actually, yes, she agreed that we need to show our identity, our professionalism of nursing. But the problem here in Indonesia is about culture. About the culture where the doctor and nurse, the doctor always think that we as nurse, we are their servant, something like that. But we need to establish our identity as a nurse, as a professional nurse. But it's really hard to change that culture in Indonesia, and like nursing and doctor, something like that. So she agreed what you have mentioned. So she said like, yes, we need to increase our identity as a nurse, our professionalism as a nurse. Because also when she was working, sometimes the doctor will also ask questions to the nurse. But it's only just like that. The relationship with doctor and nurse is just like that. Just ask questions, something like that. But they don't think that we are their collaborator, something like that. So this is our homework that we need to do. So yeah, maybe nanti saya tambahkan ya. Saya coba tambahkan. Jadi memang budaya, I'll speak Indonesia, it's okay, right? Okay.
Yeah.
Jadi sebenarnya budaya Indonesia seperti itu ya. Kita ngerasa bahwa memang kita itu di bawah dokter. Tetapi sebenarnya buat saya pribadi itu karena sudah diedukasinya seperti itu dari dulu. Udah di mindsetnya seperti itu dari dulu bahwa kita itu adalah di bawah dokter. Padahal sebenarnya kalau kita lihat dari filosofi nursing, dari teori keperawatan, we have our own discipline gitu. Kita punya disiplin kita sendiri, dokter sendiri, berbeda alur jalannya. Dan seharusnya mindset kita adalah perawat, nurse and doctor works together as a team, not doctor alone, nursing alone. We work together for the benefit of the patient. Karena peran kita sebagai perawat itu berbeda dengan peran dokter. Kedengaran nggak? Oke.
Can I say something, Dwight?
Oh yeah, sure.
Okay, I really like when you narrate, when you share your experience. I think the way things to go is to do a research about it. Try to interview some nurses and try to interview some doctors about the way they see nurses and the way the nurses feel about their professional identity. And by research, you have results, right? And the findings of this research can be used eventually as the way to maybe make a guidelines or make a policy. But the thing is that you need to really understand also. That's why you need to gain knowledge or research about how do you perceive professional identity from your side and how doctors perceive you as professionals. That's a way to investigate and explore, gain knowledge about this. And then, eventually find a way on how to resolve this. But the way is you need to really explore and study and talk about it. That's the way to go as well. You need to do research, talk about it, about a professional identity. Then they will learn about your professional identity. Make them understand. I think that's what I'm trying to say. Make them understand and then focus with what can you do with the patient and how you can show to them that we are nurses in a professional way. We are like this.
Yeah.
Okay?
Terjawabkah, Saudari Ferry?
Oke, terima kasih.
Oke, terima kasih.
Thank you.
Thank you untuk partisipasinya. Next question. Where, ya? There's a lot of questions here. Izin bertanya. Oke. Nama saya Rusdiani Isan, perawat nurse dari puskesmas. So she's a nurse from community. And she said she wants to ask question. But I think this is related to pandemic COVID. Saya mau bertanya, di masa pandemik seperti ini, masih banyak masyarakat yang belum percaya tentang COVID. Bahkan ada Bahkan ada yang sudah terkena gejala COVID-19 tapi masih disembunyikan karena mereka takut isolasi. Apa yang harus kita lakukan untuk mengatasi masalah seperti ini? Terima kasih. So, this nurse, Mrs. Rusdiani, she's a community nurse, and she was asking about this COVID-19. There are many people still don't believe in COVID-19. So when they got this COVID-19, they are scared to share to the nurse because they're scared to be isolated. So what should we do as a nurse to educate them and to change their behavior, something like that?
Yeah, I think during the COVID-19 pandemic, everybody was like in crisis, I think. Even the nurses were in crisis that time. But the way things are is that one of the domain of professional identity in nursing is the leadership, and that is to influence others. Okay, so for you to really because it depends on the case as well, right? But the way to do as a nurse is to really make them feel about your presence. I mean, share information, the right information about restrictions, okay, about the policies, because during the COVID-19 policies are changing fast, right? So as a nurse, you need to really share information, educate them, and influence them to really how to practice, how to prevent COVID-19 transmission. Then they can feel our presence, right? So that's the way to go. As a nurse in the community health, I know it's not an easy task, but they're expecting from you. The people from the communities are depending on the healthcare providers, not only to the doctors, but also to the nurses. So lead, influence them to do the right thing. That is professional identity of nursing, right? What should be done? What should not be done? Okay. What are the restrictions? What should be the way, like vaccinations, where to get vaccinated, how to convince them, because vaccination is one issue during the COVID-19. Okay, as a nurse, how can you convince them to get vaccination? Okay, so these are the things you make them feel of your presence. Okay, lead and influence them to do the right thing. Okay, as a nurse during COVID-19, it's not easy. It's not easy, but you have to as a self, you need to not give up. Okay, so that they will follow you, and they will eventually follow the right thing in COVID-19.
Okay. Thank you, Sir JP.
Yeah.
There is 2 more questions here.
Okay.
I think your topic is very interesting, so many audience want to ask many questions. So,
yes,
do you agree this is the nursing identity, which means that the professional image is an outward reflection of the deep personal and internalized process of the nurse's professional identity? The question is how to start and apply it.
Okay, it starts really with you as defined by the professional identity of nursing. You need to make sense of yourself. The first thing is you need to really know by knowledge what is nursing, and you need to be aware of yourself. Okay, what are your weaknesses as a nurse? What are your strengths as a nurse? What are the things that you need to build within yourself as a nurse? That's the way things to go. It goes with your innate being. Sometimes, as what the ISPIN is saying, is that doing the right thing is inherent, right? But being a nursing as well is you need to really know what is a nursing principle. Because everybody knows the right thing, but you need to know the nursing principles, the nursing norms and values, characteristics, for instance, to really do what is the right thing in a nursing way. So that's why it goes in you first, and you want to relate to others. Because if you cannot relate to others as a nurse, then they will not identify who are the nurses by profession. So you need to relate yourself as well. So you start within you. It's an innate thing.
think Sir JP lagi koneksinya kayaknya. Halo? Wah, kayaknya keluar deh. Oke, kita lanjut aja dulu ya, bentar. Ada pertanyaan satu lagi. Di sini sambil menunggu Sir JP-nya. Kayaknya masalah teknis ya, Wi-Fi. Sini pertanyaannya adalah, how to explain to the client's family his family died because the client's family blamed the nurse and doctors for his family's death. Nurse and doctors have worked professionally. Is Sir JP masuk belum ya? Is Sir JP here?
Hello, I'm back.
Okay.
Sorry.
So there is one more question, Sir JP.
Okay.
How to explain to client's family because the client's family blamed the nurse and doctors for his family's death? Because we nurse and doctors have worked professionally. How can we deal with this?
Deaths. Okay. So it depends on the situation, you know. You really have to assess the situation as what is mentioned as what I mentioned a while ago. And in the study that I reviewed, one of the studies says that you have to know there's a situational influence on the way you behave, act, and talk as a nurse. So you have to know the situations first. Is the family, some multifaceted factors. Does the family have more support system aside from you? Does the family have only few support system aside from you? You need to know the practices, the cultural practices of the family. If they will blame you, then try to analyze the situation. Why are they blaming you as a professional nurse? Okay, talk to them. Okay, offer support. I think it goes with the behavioral part, competency on how to deal with deaths among patients. Because, you know, in the process of death, there's a grieving process. And we know in the grieving process, there are 5 stages. In the first stage of death, this like grieving because of death is denial. So it's really the first thing that they will experience, right? They deny the situation. Try to acknowledge that. That's part of the human process by theory. Second is you have your the A1, okay? You have the anger. They will get mad at you. They will scream. At times they will hurt you. That's part of the process. So anticipate that one, that anger will follow. Then eventually have the bargaining. They will blame you. You are the one who's the cause of the death. Then eventually they have the last stage will be acceptance. Okay, they will have depression, they'll be so sad, and eventually acceptance. So they go through this process. They deny the situation, they become angry with you, that's part of it, that's expected. They blame you, bargaining, they become sad and depressed, and in the last stage, they will accept the death. As you notice in your experience, in the end, they will accept the death, right? But before the death, before the acceptance, they will get mad at you and they will blame you. But that's the part of the grieving process. I think you feel that the same way when you lost someone, right? You can't accept the death. You become mad at yourself. You become mad at the staff. You become mad at the world. At times you blame God. That's bargaining. Then you become sad and you cry and you don't want to eat sometimes. And eventually, in the long run, you will accept the death. So try to acknowledge that it's a norm. It's theoretically part of the grieving process. Any person feels that way, right? You feel that way before when you had someone, a loved one who died as well. So just support, anticipate that this will happen, but eventually help them to go towards accepting the death in the end. Okay? Right,
Thank you so much.
Thank you. I hope we answered it right.
Okay. Okay, thank you so much for the answer.
Thank you.
Because of time, if any one of you want to ask questions, you can ask again later if there's still time. Or if not, you can chat Sir JP privately in the chat box. So thank you so much, Sir JP, for the wonderful
Thank you so much. Thank you
presentation.
so much. I hope there will be another one.
Yeah. Yes.
Thank you. Thank you so much,
So
everyone.
much. And
Promote professional identity in nursing, okay?
thank you.
Thank you, guys.
Thank you. So right now we will proceed to the third speaker, and it's a privilege for me to introduce the third speaker. So the third speaker, her name is Dr. Chanel Concepcion, and she graduated from nursing March 1994 in Velas College, and then she continued her master's in science in nursing in Philippines University of the Philippines, Cebu City, 2000 from 1995 to 1996. And then she also continued her master's in health social science, April 1999, in De La Salle University in Manila. And also, she graduated her doctor in philosophy of nursing in Silliman University, 2013. And she has a lot of experiences. She was also one of the adjunct professor in Silliman University and in many places also around the world. So it's a privilege for us to hear from Dr. Chanel Concepcion. So this time is yours, Dr. Chanel. Thank you so much.
Thank you so much, Dwight, for that kind introduction. Good morning to everyone.
Good morning.
Hi.
Good morning.
It's great to have JP and Dwight. These are two of my very brilliant PhD students. I'm so honored to be here and be able to speak to you. The moment that Dwight invited me to speak to in the Indonesian nurses, I was so excited that I had to accept it straight away, even though I didn't consult my schedule and everything. Indonesia is one place that I really wanted to visit. I've never been, and I hope that if the pandemic ends, we will be able to visit your country. So thank you so much for inviting me, Dwight. Thank you also, Dwight and JP, for kind of preparing or setting the stage for my talk today about the vision of the nursing vision for the future. So let's begin. I know many of you are probably excited to to have your lunch in a short while, so I'll try to keep up with the time. I know you're so tired, so if some of you are listening to me, you can stand up, stretch a little bit, so that you will feel relaxed and there's good circulation. They said that sitting is the new smoking, right? If we sit for a long time, it's not very good for our cardiovascular health. So just try your best to kind of exercise while listening to me or stretch a little bit. Let's begin. In 2020, that was last year, it was designated as the World Health Organization designated it as the year of the nurse and the midwife. So it was about that time that, the nurses we're at the forefront of COVID-19 and fighting this, this outbreak. And this celebration was supposed to be kind of a year-long celebration, challenging the conditions that often face nurses and advocate for increased investment in nursing workforce. But we all know what happened, right? The coronavirus outbreak began in earnest. And, we were all grappling to navigate our life through this, unknown territory. And we each have our own stories about the pandemic. Many of us have probably lost loved ones, friends, and even our colleagues. And sometimes it's been, such a long time that we get so tired of thinking about coronavirus, and we become so desensitized, sometimes indifferent, because it's just not leaving us very soon. So during the early part of the pandemic, people were consistently, cheering us on. I remember, I think in the UK, they had this time in the evening where they give a clap, or they clap their hands for the healthcare workers. and in a way that's bringing the nurses and many of the healthcare workers to the forefront, and they recognize the value of nurses. So we were heralded as heroes and sometimes angels, but we have to question ourselves, are we really heroes? Well, the International Council of Nurses brought out a statement, and he says, nurses are humans. They are not angels or superheroes. They have the same needs and rights as everyone else. They are skilled, knowledgeable, highly educated professionals who provide people-centered holistic care throughout the life journey. So even though it seems so good to hear that we're heroes, but there's a problem with that kind of mindset. It's because we can, we can fight everything, right? Or we are shielded from all the difficulties, but in reality, we're still human beings. And we have suffered a lot as a profession during this pandemic and even before the pandemic. So this COVID-19 has really left us exhausted, emotionally drained. It's one wave after the other. And sometimes we have thought about a lot of creative solutions, but it's not working. The nurses' morale have really gone down. Many healthcare members are struggling daily to cope with so many patients, low staffing, lack of resources, and it just continues on and on. I got this, this is probably not updated, but there was the Indonesian National Nurses Association in March 2021 reported that 15,000 nurses, more than 15,000 nurses in Indonesia were infected with COVID-19 and 274 deaths. And this is really, this is reflected also in many parts of the country, including the Philippines. So it's not an easy journey to be in. So nursing has claimed to be, we are the most trusted, loved profession for many years. In the United States, they always have this poll, this survey about who's the most trusted profession, and nurses are always either number one or within the top three. But in reality, we feel there's also some disrespect, and professionally we're not respected. And you just talked about, even though how much professional you wanted to be, but there's always this culture that is not easy to change. We could be as professional as we can get. We know our identity, but sometimes the culture is really an uphill battle for us. So we have to know, like we said, because this session is about professional identity. Before we are able to really truly know what is our identity, we have to know where we are and where we're going, not only as an individual, but also as a profession. So my talk is a little bit more in a macro level, not only looking introspectively in ourselves, that's part of it, but looking at what's happening with nurses around the world and where are we heading as a profession. So like I said, we're talking about the current state of nursing as well as the future of nursing. So for the very first time, the World Health Organization and the International Council of Nurses issued this report on the state of world's nursing, and it was released last year. So some of my observations are drawn from this report. At the same time, some are personal reflections, being in nursing for a long time, almost 30 years, and being a nurse educator for 23 years. And my nursing education is both in the university setting, where I'm an adjunct professor in Silliman University, and also the practice setting. Right now, I'm the director for nursing education in Guangzhou Cancer Hospital. So in both worlds, I've seen both academic and professional settings as well. So I will put here my observations as well. So nurses, we are the largest professional group in healthcare. So it accounts for about 90, almost 60% of healthcare occupations across the world. So in a way, we are a force to reckon with, right? This translates to about 27.9 million nurses. And I think this probably include midwives. And 19.3 of that are professional nurses. 6 are probably associate and other classifications. So you can see that our population is expanding, but we have to think, is that enough? Is it equitable? Is it sufficient to meet the rising needs And is it leaving some of the population behind in terms of healthcare? The World Economic Forum, I think this is probably in Davos, published that the world needs about 6 million more nurses. There are other reports that there's about 9 million kind of deficit of nurses all over the world. Earlier, I asked Dwight, is there a shortage of nurses in Indonesia? And I think you said yes, right, Dwight? So I was able to find this this picture about the density of nursing personnel per 10,000 population, but this is a little bit not updated. This is 2018, but you can see here the red, orange, and kind of orange shade are the ones that are lesser nursing population. The ones in blue are the ones that have more nursing population. So you can see here the United States is very bluer than blue, and the big countries, the more richer countries, more industrialized countries, have more nurses actually. And the sad thing is, a lot of the nurses, especially from the Philippines, are migrating to these countries who have, you know, more or less adequate nurses, but still they report a lot of shortage. So this is Indonesia. So we are just like the Philippines, we're an archipelago. There's a lot of islands, composed of a lot of islands spread throughout. And I think in 2018, there's 2.4 nurses for every 10,000 population. So that's really, you know, a shortage in terms of nursing personnel. Another thing that a lot of the countries here in this report, is 18 countries are undergoing, is that their nurses are getting older. It's an aging workforce. So that will be a big problem, because if you have nurses retiring in the near future, then, you know, that could add to the shortage of nurses. Another issue that we're currently facing is the educational preparation of nurses. Their majority of the countries reported there's a minimum duration of nurse education is about 3 years. And there's different minimum education or training levels for nurses. In the Philippines, we only have one. Every nursing curriculum that we deliver is all a bachelor's degree. It's a 4-year degree course. And I was reading about Indonesia. I have found out that I think there's different levels or different nursing preparations as well. So you can see here, these are the average duration for education for nurses. There are others that are 3 years and 4 years. I think that's the majority. Most of the time it's 3 or 4 years. So in the past Future of Nursing IOM Institute of Medicine report, they have encouraged that the best preparation for nurses would be a bachelor's degree, or BSN, which is usually a 4 or 5 year course. And one of the nurses, her name is Linda Aiken. She has made a breakthrough research and looking into the educational levels of hospital nurses. Although this is hospital and surgical, hospital nurses and surgical patients, but it resonated because it was published in the Journal of American Medical Association. It's not even in a nursing journal. But what she found out, the objective of her study was to examine whether the proportion of hospital registered nurses educated at a BSN level or higher is associated with risk-adjusted mortality and failure to rescue. So is the level of education of nurses having an effect on the deaths of surgical patients, and also how serious their complication is, and how they're able to rescue patients who needed resuscitation? So what she found out in that research, the conclusion in that research, is the hospital with higher proportions of nurses educated in a baccalaureate or BSN level or higher, surgical patients experience lower mortality and failure to rescue rates. So this was used by many countries, especially the United States, that their requirement with at least 85% of their nurses should have a bachelor's degree. Because in a way, this research is really evidence-based and show that the more education the nurse has, the better patient outcome there will be. So right now, there are so many countries all over the world that are going towards advanced practice nursing or advanced practice registered nursing. About 78 countries are reported to have advanced practice nursing roles. I also asked Dwight if there's an APN program in Indonesia. I think there is a specialization, and that could be considered advanced practice. Sometimes there's a lot of issues around advanced practice nurses because there's a lot of regulation. Are they? You have to ask whether they're able to prescribe. Are they able to create their own practice? So there's just a lot. In the Philippines right now, we're working towards creating the APRN program. Silliman University is identified as one of the pilot school. We have not started it yet, but we are collaborating with an American university. It's Case Western Reserve to be the pilot school for advanced practice registered nurse in the family health practitioner track, and then towards the doctor of nursing practice. And I'm involved in this project. It's not easy. A lot of people were talking about how good this is for a long time here in the Philippines, but making it happen is really, really a very difficult task. It's not easy to do it. So mostly if you're an APPN advanced practice nurse, master's degree is kind of your entry level. And just like in Indonesia, your nurse specialist program requires a master's level. Another thing that's unique in just generally in nursing is that 1 out of 8 nurses practice in a country other than one where they were born or trained. That means there's a lot of nursing migration. And we feel it so much here in the Philippines because many of the Filipino nurses can easily find work in the United States, UK, like JP is in Qatar, in the Middle East. We have so many Filipino nurses just all over the world. So what the cost of that is that in the Philippines, we lack nurses, and we lack, of course, because the salary here is a little low. They would always look for greener pastures. We cannot prevent that from happening. Another thing in nursing is that nursing remains to be a highly gendered profession with associated biases in the workplace. So we cannot deny the fact that it is highly, it's dominated by females. I'm so glad to see like Dwight and JP thrive in the nursing profession, even though they're males. But because of that, there's a lot of biases and it goes back and forth. The statistics show that about 90%, more than 90% of nurses are female and about 81% of nurses are male. But sometimes there is a disparity between the salary. So even though there are more female nurses, most of the time they get lower salary compared to the male nurses. So these are just realities that our profession is grappling with. And also the working conditions. There are so many different working conditions and issues, even if you're in the United States where they have a lot of resources. We still hear a lot of reports and complaints about how the working conditions are not good. But a lot of the countries are working so hard to improve the working conditions of nurses, but sometimes it's just not enough. So in that report, the State of the World's Nursing 2020 report, it underscored the centrality of nurses as a part of integrated teams in making critical contributions toward universal health coverage and other national and global health objectives. So if you're probably familiar with the World Health or UN Sustainable Development Goals, there are health-related development goals there. These are global goals that we wanted. And each of our countries, maybe in Indonesia, Philippines, wherever we are, we have national goals in terms of health. And we cannot reach those goals if nurses are not engaged or nurses are not involved in reaching those goals. So whether they like it or not, we as nurses are very important in the health of our people and in reaching our goals as nations and globally as well. So what is the future of nursing? Like I said, there's 28 million nurses worldwide. And because of that sheer number of nurses, we can't implement wide-reaching changes in the healthcare system. Sometimes you say, okay, we're from the Philippines, we're from Indonesia, we're not probably as developed as the United States or European economies or other industrialized nation. But when I attended the international conferences in other places like in Seoul and Barcelona, the conversation is the same. There are always struggles about being recognized, being valued as nurses, having a voice in the conversation about healthcare, anything. It is a struggle anywhere in the world, especially in nursing. But I think we can work something individually, organizationally, and in national levels and international levels to change the way people see us as professionals. So our vision of nursing. So sometimes we're looking at nursing, maybe I graduated about more than 20 years ago. And my vision, if you ask me that time when I graduated, what would nursing be like 20, 25 years later, I would probably be looking at, oh, it's really virtual things, a lot of technology, gadgets here, there. We just work in our, devices and all of that, really high tech and everything. But the reality is that it's this. Our ICUs, probably those of you who are working in ICUs could relate to this. We have so much gadgets all over the place, gadgets that are not talking to each other, no interoperability, lines here and there and everywhere, So even though we kind of envision nursing to be so smooth and savvy, the reality is, we are still struggling, and we're probably there's still so many issues that we have to work with. And with a pandemic right now, it looks like this probably is even a nicer photo, but there's more and more issues that we have to deal with. So I think the National Academies of Health, the Johnson Wood Foundation in the United States, came up with this new report about the future of nursing from 2020 to 2030. That looks like a long way off, but we don't know. After 30 years, it will come by so quickly. So some of the things that I'm going to talk about today is looking at some of these things about what are some recommendations, and again, others are about my observations as well. So I'll just talk about six things. The desired future in nursing, and then I'll talk about this one by one. So the first one is nurses as a part of a multidisciplinary team. And I think JP has talked a lot about this, that we should be involved, not just to be thought of as somebody who is the doctor's assistant or not contributing anything to the conversation, to the dialogue that is going on about our patients' health. We have to acknowledge in ourselves and as a profession, as a group, that we are part of this multidisciplinary team, right? And I think JP was right when he said we are partners. And partners, I mean, we're equal. We're not lower or inferior than the medical profession. We're not even higher. We're partners. We work together. And I understand the reality of, the struggles that nursing have to be recognized, to be respected among the colleagues, among the peers. I also worked briefly as a chief nursing officer in a hospital. And when I started my chief nursing officer role, I said, I wanted this hospital to recognize nurses, to value nurses, and to put nursing at a certain level. But I struggled so hard, and I think I did not really reach my objective, but I really understood that this is better said than done. It is so difficult to really, because you have to make sure that the board, the people who are sitting in the board, the owners of the hospital, the policymakers, the stakeholders really understand the value of nurses, really understand their role, and really respect, right? So in organizational level, it's very difficult. National level, it's also a struggle. So what does it mean to be part of a multidisciplinary team? Maybe this is something that would give you a concrete idea about how nurses can collaborate with different people in the team. For example, you have a stroke patient. The doctor would probably say, okay, maybe we should do a right-sided CT scan. We will have these medications, anti-thrombolytic, antihypertensive. The dietitian would come in and, have a conversation about prescription about what the patient should take. The physical therapists would talk about, exercises and rehabilitation. Social worker would talk about community services when they go out. But what about the nurses' contribution? We have to remember that we are partners. We have a lot to say about our patient's health. So maybe in a case of a stroke patient, we can talk about impaired bed morbidity, risk for falls, maybe because the patient has limited mobility, there's pressure ulcer or self-care deficit, inability to cope, not only for the patient, but as well as the family. So you can see here that nursing is visible in the multidisciplinary team, providing collaborative care for a person with stroke or any other condition. One of the conversations I heard when in international nursing conferences, they say we have to have a seat. The nurses should have a seat in the table. In leadership, in the boardrooms, in decision making at hospitals and healthcare, we need to be part of that conversation. So they were saying if they do not give us a seat in the board, in the table, let's bring our chair and let's push ourselves and really assert ourselves to be part of that conversation. And in that future of nursing document, they also looked at the roles of nursing in the 21st century health system. So I think Dwight and JP just talked about, sometimes we think about nursing as only in the hospital setting, but we have to really think outside the box and say there are so many nurses that have a big role to play in the community setting. And one of that that's recognized by WHO is the universal healthcare coverage. Our aim in most nations is that everybody should have access to health, right? Sometimes there's a lot of health disparities right now. Only those who have money or those who have those who are in the urban areas have access to health, but those who are poor or in rural or remote areas have less access to care. But if we wanted to achieve universal health coverage, the frontline providers are nurses who are in the primary healthcare setting. And we are there to prevent a wide range of communicable disease, even non-communicable diseases, right? And we take care of patients from womb to tomb, all across the spectrum. And then there's also emergencies, epidemics, and disasters. Disaster nursing is a growing field right now. And with the pandemic, I think there's a need to have nurses who are able to deal with disasters, because the COVID pandemic is a disaster. So we need to be able to deal with that and be educated and equipped and capable to do these things. And also we need to think about health and well-being. So it's not just taking care of the sick, but also taking care of the well, addressing social determinants of health, collaborative action, addressing even climate change, ensuring access to vulnerable groups, including especially women and young people and children, and even the elderly. So you can see that our role is not just, if somebody says that you're just a doctor's assistant, you can show them this one and know that we have so many roles that we play as nurses. Another thing that we look at in the future is we have to be able to optimize the contribution of nursing practice. So planners and regulators should optimize, how nurses could contribute to the whole healthcare of populations, of the organization, of the people we serve. And actions would include ensuring that nurses in primary healthcare teams are working in their full scope of practice. Yes. Can we have your microphone turned off, please? Okay, thank you. So there's a growing model they called nurse-led clinics. Okay, in many areas where there's a nurse practitioner, and even those who do not have, they are building this model that nurses are leading the clinics and leading, looking at patients and consulting patients, because in most countries there are not enough doctors, right? So we are the ones who could, take on that role. It doesn't mean that we will do all the doctors, roles, but we can help in closing this gap or health disparities, or making health more accessible to different populations. So improving access to primary health care, and this would also include the conversation of exploring advanced practice nursing roles. So this is something that I saw in one of the articles. It says in Indonesia, will be challenged to bring the nursing profession from a current state to a desired future state that will include defining the role of clinic nurse specialist, which you have right now. All stakeholders will need to be engaged to develop the role and scope of the APN. Sometimes one of the groups that are very resistant about advanced practice nursing are the physicians, right? So our strategy here in the Philippines is we have to engage the physician. We have to consult them, that we're not going to replace them. It's not a threat to their profession. We are there to answer the different needs, especially those people who cannot see a doctor. Maybe in their lifetime, they cannot even see a doctor. So we're there to fill the gap. We have to work together instead of compete with each other. So these are stakeholders, the doctors, administrators, people who provide finances, because even if you're very idealistic, but there's no money placed, there's no investment in terms of time, money, and resources, this kind of advanced practice nursing would sometimes, not work. So educating our nurses for the future. And I think many of us here are educators, and we have to really think about, are we preparing our nurses today for their roles in the future? Not just, just getting a license or having a diploma, but are we preparing them for the future? I've learned that in Indonesia, you have different levels: vocation, academic education, and professional education. But I think it does not matter. According to this article by Betriana, Tanyoka, Locsin, and Nelwati, and Dr. Tanyoka and Dr. Locsin are good friends of ours, and Dr. Locsin is one of our professors, JP and Dwight's professor, and they really looked at the situation in Indonesia. And they said that despite the variety of educational levels and the limited number of graduate school programs, nursing education in Indonesia is steadily improving. And I think this is really commendable. Nevertheless, transforming the discipline to advance the professional practice of nursing requires more interdisciplinary collaboration, especially with expert nurse researchers from international arena. So it needs to be collaborating not just within the country, but internationally. And there's also another article I saw about the new era of nursing in Indonesia and visions for developing the role of the clinical specialist. And in the conclusion, they said that nurse specialist graduates in Indonesia are not empowered with conducting nursing research. I think JP has a point there that we have to get our nurses ready and have a capability to do research, because that's how we can know what's going on. We can advance the profession and influence policy. And we should be able to also know how to do evidence-based practice, initiation of evidence-based practice, especially if you're in the practice setting. When you're in the academic, usually they have a lot of research, but it should also extend to the practice. And evidence-based practice should also be kind of a norm in practice settings. And also quality improvement. Improving quality of care. There's so many tools out there and so many education that you can do so that nurses will be able to be aware of quality improvement practices and methodologies.
Bingung kan?
Yes, we're okay. There is maybe we can ask to unmute, to mute. Okay, good. Sorry. All right. So there are so many education pathways, right? So it could be a nurse, a provider, registered nurses, advanced nursing practice, whatever you want to call it in your country, nurse practitioner, clinical nurse specialist, certified registered anesthetist, or if it's the midwife, then whatever. But we need to be able to give nurses, opportunities and pathways where they can learn more, engage them in lifelong learning, and if they want to advance, they have that opportunity to advance. Then the other one, when we talk about the future of nursing, is really not just to take care of our patients, and that's really important, but to take care of our nurses, right? Even right now, so many nurses are just about ready to quit, right? Nursing workforce need to be strengthened. So we need to take care of our nurses because they're subjected to long hours, risk of attack, in some settings, sexual harassment, unfair treatment, many things. and salaries are so low, you name it. So we have to really not keep a blind eye to it, but really think about how can we retain nurses. When I was a chief nursing officer, my main problem was recruiting nurses and retaining nurses, because sometimes the hospital is like a revolving door. They come in and they go out, and in the Philippines right now, what is attractive for many of the nurses is our call centers. They get more paid there. They have better working conditions than working in the hospital. So retention is something that we really, those in leadership positions should really think about. Think about the working conditions, the occupational safety of the nurses. Are we giving them enough PPE? Are we giving them enough rest? What are the salaries and benefits? Are we giving them hazard pay? And sometimes it's not just the pay that nurses really are concerned about, is the non-monetary incentives like health insurance or opportunities for growth. So many things that we need to think about so that we can retain our nurses and they will not go away and fly away and go to some other professions or to other countries. And the other thing is nurses should be able to leverage health technologies and informatics. I am teaching right now health informatics. JP is one of my students, and there's just so many technologies, so much technologies that we can think about that nurses need to know, from electronic medical records to point of care technologies, so many things. So whether we have those high tech or low tech, we need to be able to use them in such a way that it could benefit it could benefit our patients, and we could move towards societal model where care is tailored to more like individualized patients, looking at technology, modernizing to scale, looking at virtual health, and reach the goals that we wanted for our patients and for our profession. The International Council of Nurses said that we as nurses are at the forefront of incorporating advanced technology into healthcare without using the human element. Maybe you say, oh, I don't want technology because that will make, everybody will become robots and people will be replaced with robots. I don't think the human element will ever be diminished, even with the use of technology. Right now, there's so many robots, right? I was just attending an audit class at Texas Tech on health informatics, and there's one nurse from Cedars-Sinai who was talking about their robot. It's not a humanoid robot, but a robot in their hospital that's, helping to transport, making everybody smile. And it's been a very successful project for them. I also was able, when I was in Kyoto, I was able to meet some nurses who were working with humanoid robots with Dr. Loxine. And this is a robot that really looks like a human being. And they're teaching these robots to be more empathetic, to be able to read, emotions and things like that. So it sounds scary, but it is something that we really need to embrace if we are moving forward. I just wanted to show you this very short clip about some of the technologies that looks like they're really futuristic, but some of them are already what do you call this? Are already here. So just a short clip for you.
The world changes, but some things never change. Difficult moments can make time stand still, but love can make a lifetime pass in the blink of an eye. You said I'd understand that someday, and then I blinked. And you were gone. Alarm off.
Good morning, Sophie. How did you sleep?
You tell me, Oz.
447 minutes of confirmed sleep, 34.2% REM. Slept like a baby.
Increase floor temperature.
Increasing floor temperature.
And start me a slow drip, will you? I'm going to take a shower.
Of course, Sophie. scheduled for you an appointment at the microclinic. Your full medical history and self-exam results from this morning has been confirmed received. And your primary care doctor, Liz Childress, has been notified of your appointment.
Sophie, we've been expecting you. I'm Lily, your technologist. Let me show you to your personal pod.
Mom, where do I begin?
Our pods will help put you at ease. They're equipped with sensories.
I remember you telling me how you would sing to me before I was born.
It's going to be okay. Before we do any further testing, we're going to go over the results of your self-exam. But first, let's give you the sensory atmosphere you requested, shall we?
That you were convinced it was why I have such great taste in music.
Step up to the scanner and relax your body. Remain still. And 3, 2, 1. Good. Lift your arm above your head. Remain still. And 3, 2, 1. Good.
How the mere thought of me was all it took for love to grow stronger than anything you'd ever known. The invisible things that consume us. Love. The fear you had dealing with this, and how different it is for me today.
You look great. All right, now you're just gonna lay down for me.
Facing the very same thing that took you from me. You told me once, we can look so deeply into ourselves that we miss what's most important.
So, I'm afraid the MRI does show a suspicious lesion in the left breast. Based on appearances and outputs from the artificial intelligence application, probability of malignancy is high. That's the not so good news. The good news is that we caught it early, and when we look at global
I've been thinking about that lately.
we predict an excellent outcome for you.
But I see something now that was harder for you to see back then.
About next steps.
Hope. Hope in the world that surrounds me, in the people here to guide me through. You told me it was something I'd find when I needed it most. And I have.
Sophie, you've got a really good team here. As I told you before, I think things are looking really good. Hi, Mom. How was the news?
What I hoped for.
Look at her.
I just wish you could be here today to see it. And to meet your great-granddaughter. She has your smile.
Everything is set for tomorrow's party, Sophie. GE believes in the power of emerging technologies to advance precision health and transform patient care. The outlook for healthcare has never been brighter.
Okay, so future of healthcare. Some of these technologies are already here. I work in a cancer hospital, a new cancer standalone hospital in China, and precision targeted therapy, precision health is the way to move forward. We have this technology called proton therapy, where we can target exactly the cell or the area where there's cancer, and just provide that beam, less invasive kind of technology for cancer treatment. So, there's just so many things that are going on right now, and as nurses, we have to embrace this, leverage this technology, so we can ride our way through the future and be able to help with the our patients and get our goals achieved. And last but not the least, I think we need to be able to recognize and celebrate nurses' voice and vital roles in healthcare. So the nursing profession, like I said, has a long and important legacy in each of our nation's history, from the moment the patient would walk into our hospital, to our clinics, to our, to our schools, and to the moment they leave us, the nurses are always there to care, to comfort, to heal, do our best in delivering compassionate care. However, for all nurses, for all that we do, sometimes, like you said, they do not recognize, we are not valued, we do not get the recognition that we deserve. So recognition and celebration of the nurses is not sometimes just to show the deep appreciation, but it also has a positive impact on the morale of the staff, of the nurses, and improve their engagement. Nursing engagement is also one big thing right now, because if you have a nursing workforce that is not engaged, most likely they will leave and go away. And then you will have a problem with staff shortages. So studies have also shown that meaningful recognition has the ability to renew the nurses' commitment to their profession, bestow added pride to their work, and deepen their loyalty to both the nursing team and also the healthcare organization. The International Council of Nurses, this is their theme in 2021, which is also in my background: Nurses, a Voice to Lead, a Vision for Future Healthcare. So the vision for future healthcare to show how nursing will look like into the future and how well the profession will transform the next stage of healthcare. So for this vision to succeed, the nursing profession must be actively involved and engaged, and as members of the profession with the broadest understanding of the individual needs and the healthcare needs, nurses are a vital effort to address all the aspects of care and enable health and be able to build healthier communities. So we are leading to build a culture of health. And as nurses like JP and Dwight has said, we are leaders, right? Change may come really slowly, but it has to start with us. So many obstacles are on our way, but we should never give up, right? As we move on to the future. How can we do that? Like I said, there are no simplistic answers. This could be in government level, strategic directions, there should be policies, there should be laws, and the government and stakeholders should invest on those decisions. So we need to collaborate with the government sector, and then collaboration with critical stakeholders like administrators and nursing board organizations and many other different stakeholders, so that our dream to have that nursing profession that is valued and respected would be realized. In the organizational level, maybe we can affect change so that we will not just remain silent, right? We need to have this voice, and that's very, very important. Not to be quiet, especially if you see that there's a lot of oppression in nursing. Do not just be quiet. We need to be able to speak up, right? And as individuals, we can also affect change the culture individually, and also the corporate culture, so we can be ready for the future and live the future now. So let us seize the opportunity to commit to a decade of action that begins with investing in nursing. And this is the call for WHO and ICN. And we should be able to invest in education, in the jobs, in practice, in our workforce, and also have leaders in nursing that can really affect change in every facet in society. Thank you very much. Terima kasih. Am I saying that right? Thank you. Do you have questions that I could answer? Sorry. Any questions?
Wait, Mr. Channel, I see first for the chat room.
Okay.
We can do. And before, thank you for the material presented, Mr. Channel. It's good material for us, for sharing us. So help you your material to improve our career, our job, and all of service as a nurse in Indonesia. Mana-mana dia Mas, coba Mas. Mana coba Mas? Aku nggak lihat.
There are some people who are raising their hand. I'm not so sure. If you want to ask questions.
Mana coba ya? Dimas. Mana Dek?
If you don't want to ask questions, I will ask you a question.
Mau bertanya?
Would that be okay?
Excuse me, Mr. Channel.
Yes,
You have a
yes.
question from Ari Kurnianto Purwa Rahar. Why don't we take advantage of Indonesian human resource in dealing with COVID?
Can you say that again, please?
Why don't we take advantage of Indonesian human research in dealing with COVID?
Take advantage of research, right?
Yeah.
Is that how can we take advantage of research in dealing with a COVID pandemic? I think there's a lot of potential there. Number one is to really understand what is the situation right now. What are the main concerns? Because sometimes we just assume when we do not do research, we have certain assumptions. It's not based on, data exactly what is really the condition of the nurses. What are the things that we need to deal with? So we need to ask the right questions, and if we are able to answer the right questions, gather the data that can inform us in answering many of the issues about COVID-19, about healthcare workers, shortage of nurses. I think there's a lot of potential that research can do to answer. But I would say it's always like multifaceted, right? Research is one area that could help solve many problems, but also there are other areas like policy change, workforce issues, leadership, investment, finances. So all of these should come together to be able to solve our problems. Maybe JP, do you have more? You're the research guy. Do you have more to add?
I think the way to go is that the COVID-19 pandemic is like a lesson. It's like a learning experience, So I think if we make a research about it in a way that you become more prepared in the upcoming, I'm not praying for another pandemic, but maybe in the future, as global as climate change is happening, they are anticipating or like they're predicting that there might be more crises that will happen. So it's more of like making you prepared and making your intervention sustainable in the upcoming crisis that I hope will not happen, that might happen in the future. So we can have research about that, explore the preparedness, the strength of the nursing workforce in Indonesia in responding to crises. I think one of the things that I learned with Indonesia is that one of your priorities in healthcare is how to respond to disaster, right? And crisis management, because I think Indonesia is the same with the Philippines. We encounter floods, typhoons, natural disasters, earthquakes, volcanic eruptions. So these are crisis situations. So maybe we can study with your preparedness and how we can strengthen your workforce in nursing during crisis. That could be a good one.
Ada satu lagi ya.
Silakan.
Okay, then the next maybe others the question from the participant, maybe Mrs. Ferry Silitonga.
I think I just translated this question. I think the question was not about research, it was about human resources. Why don't we take advantage of Indonesian human resource in dealing with COVID? Yeah, but you're right. I think both research and human resource are important. But the thing is, how do we, what kind of resource are available to us? What is it that human resource? It doesn't mean that you have so many people you can answer or solve the questions in COVID, right? there's a lot of layers that you need to address before we can solve this. And COVID-19 is so complicated. But I think John Paul was right in saying that preparedness is very important. Maybe there's probably little we can do right now, but we need to be prepared for the next pandemic. I remember I was in China when the SARS happened in 2003. There were so many lessons that the Chinese government and the hospitals and healthcare learned from the SARS outbreak, that they were able to they're not really fully prepared, but they were able to implement those kinds of things, especially in infection control. A lot of the hospitals didn't have a very good infection control protocol before the SARS, but after the SARS, infection control nurses, infection control offices and departments are really in place to be able to address this. And, China, I think because it's a different government, it's a different way of doing things, but they're more successful right now actually in curbing the pandemic than most other countries. Yes, other questions?
Yes, the last question maybe from the Mrs. Ferry Sitonga. Can you, the question is, the higher the level of education, the higher the quality of care service. But in reality, what I often find in the world of work, nurses who have just graduated with a bachelor degree and are already nurses do not have the ability according to their level of education. What do you think is the cause?
Oh, that's a very interesting observation. So, in your observation, those who have higher level are not as competent. Is that the question?
Yes.
You're right. I think we need to do research on that. I think in every organization, we need to find out what those reasons are. I understand that sometimes those with experience are saying that, oh, the experience is really the one that can, save lives. And that is true, but it's also in the long run. And it's proven by that research by Linda Aiken, that if you have the knowledge base, you're not just doing it because you have done it many times this way. If you are educated, your mind is more open. You're open to newer updates, newer evidences, and then you have the knowledge base, you have, the rationale of doing things. You're not just doing it based on your gut feeling or based on what you've done for many, many years, but you're doing it because it's evidence based, and it's the most up-to-date best practice based on what you have read. One of the things, if you're very experienced, sometimes in surgery, that could be a problem, because those experienced surgeons do not listen. They do not listen to people who are warning them about some safety issues. Okay. So sometimes if you're just, depending on your experience, you get to be, your ego gets ahead of you, and you're not looking you're not working as a team, as part of the team. And this is also true in the aviation industry. The more experienced pilots are more likely to make a mistake because they don't listen to their team members. When they say there's already a mountain there, right? And there's a story about that, and the pilot is like, I'm so experienced, I do not need to listen to you. But it goes back to patient safety. Patient safety is sometimes not about education or experience, it's about team effort. How do you work together? How do you communicate as a team? Is there a good closed loop communication? Is just somebody just saying things, others are just following? A safe team needs to have good communication. If you are familiar with a Joint Commission patient safety goals, one of the goal is effective communication. You cannot, no matter how good you are or experienced or educated you are, if you don't have good team communication, your patients would probably die or it's not safe for the patients. So I hope I answer your question.
Okay, thanks for explanation. How about Mrs. Ferry Sitonga?
Ya,
It's clear.
Tetapi gini, maksudnya begini. Pada saat, sorry saya nggak bisa sampaikan dalam bahasa Inggris. Pada kenyataannya, pada saat di dunia kerja akan ada teman-teman yang baru dengan pendidikan yang lebih tinggi. Zaman dahulu kita berteman dengan bekerja dengan yang pendidikannya masih mungkin D3, begitu ya, ada yang bahkan lebih dari situ yang di bawahnya, tetapi dengan mereka pengalaman dan mau belajar dan perawatan untuk pasien itu lebih baik. Nah, sekarang kan di dunia pendidikan untuk keperawatan itu paling sedikit sarjana keperawatan. Untuk di rumah sakit ya, contohnya sarjana keperawatan harus dengan titel nurse, sudah nurse, berarti harusnya pengalamannya sudah lebih banyak mereka waktu belajar. Tetapi pada waktu mereka datang ke dunia kerja, kita kan tim di dunia kerja ini kan, mereka yang kita anggap dasar dalam bekerja itu seperti vital sign untuk pasien-pasien dengan kondisi contohnya luka bakar, pasien luka bakar vital sign-nya seperti apa, dengan penyakit tipes vital sign-nya seperti apa yang harus kita observasi, dia tidak pahami itu. Jadi tidak mungkin kan hanya kita dalam satu tim itu yang memahami tersebut, padahal mereka sudah memiliki pendidikan yang lebih tinggi. Jadi ini kesalahannya di mana ini?
Who's gonna interpret for me?
Sorry, ma'am. Sorry, Miss Dr. Channel, we can't translate in English good, but this the conclusion the Mrs. Silitonga taught that so many nurses from graduate bachelor degree and diploma in Indonesia, she get good experience from diploma, but for the new graduation from bachelor, he is not much to get the experience how but to give the apa namanya aduh sorry
Boleh membantu?
maybe some
Okay, I will
There is Miss Lina.
Okay, ma'am.
Yes, ma'am.
The question is like this, Dr. Chanel.
Yes.
See, as you mentioned, we have a different level of education. Okay? It's quite different in Philippines. In Philippines, all bachelor degree.
Right.
Okay, but in Indonesia, they have diploma, and just recently we have this bachelor, which the bachelor have included one more year that we call as a professional nurse. So what happened in the clinical setting is the diploma have a lot of experience already, but they do not have a chance to advance or to go back to the school to continue their education. But with the experience, they are more better in the clinical setting than the education, or I could say the bachelor degree. So how we deal with this? Because the diploma will not say, hey.
Right. You're right. We cannot take away the experience that those with diploma who've been in healthcare for a long time. I think that's very valuable, and I understand it because I work closely with chief nursing officer in our hospital in Beijing. But if you look at the bigger picture, and if we move forward, it's really the educated nurses who can save more patients' lives. So what we did in our hospital is there are two things. One is we provided new graduates for bachelor's degree a residency program. So in the first year of their hospital experience, we have a structured training program for them, so that we call it practice transition program, so that from very theoretical to practical, they are able to transition, and it's very, very fast for them to be able to assimilate, although they don't become as experienced as this diploma graduates with a long time experience, but they grow quicker And then later on, because I've seen many of them grow until 10 years, they become really good, competent nurses. They can even educate other nurses. They become very good preceptors so that everything will be more in a standardized way. For me, that model really works. And then another way that we also look at it in our hospital is for those diploma nurses, because it also helps them to advance their profession, and there's more incentive for them in the government to advance. We give them scholarships to continue their bachelor's degree. Maybe they get one more or two more, but the administration really pushes, gives them incentive, gives them money so that they can complete their bachelor's degree. In that way, it's also very good for their professional morale when they have that bachelor's degree. But in terms of maybe in the short term, yes, the diploma, that degree would be very helpful and makes patients safe. But I'm looking at a bigger picture. I think most of the researchers and most administrators would look at the bigger picture, that in the long run, those educated nurses could have more return of investment or better benefits in the long run.
Thank you, Dr. Chanel.
Can I add something about it?
Yes, yes, JP.
Yeah, that's a good question because it's somewhat related to my topic as well. Because I work in Saudi Arabia for 3 years as a nurse researcher, and they have the same program for nursing. They have this diploma nursing for 3 years that was created as an initial program because there's a need to produce Saudi nurses. And this program is more on the skills, more on performing nursing care. And if you're going to compare to the BSN program, it's not only about clinical skills. It's also about management. It's also about leadership. It's also about research. That's why there are added subjects, added courses, and added years to complete nursing. Because as what you see in the professional identity of nursing, you need to also know these things. You need to lead. You need to manage. And the way to change the way we are viewed by the doctors and other healthcare professionals is to know added skills aside from clinical skills. That's why maybe you can say that diploma nurses are more skilled because that is how the program was formulated. And then there's a dire need to establish identity. That's why we need to expand our role. That's why they made the BSN program in that way. And then you know what, in Saudi Arabia, in order for them to really upkeep with the international standards of practice by the ICN, then they developed the 4 years program in nursing. And then for the diploma nurses, they gave them the bridging program. But the good thing with Saudi Arabia is that everything is free. So I think the way to do things, if diploma nurses wanted to go to transcend to BSN program, is that maybe Indonesia, as I don't know, you can recommend, develop maybe a program that can, those who are interested can be screened and can give maybe scholarship, as what Ma'am Chanel says, so that opportunities are given to those who want to transcend, I think that's the way to go. I think that's why you view it as they are more skillful than the BSN graduates. And we have to also consider the practice because the BSN are the new ones and we all started as beginners. It's not like in 1 year you get all the skills. There's a transition. That's what I said. There's a transition. Your identity as a student is different from identity as a nurse. So expect that these BSN graduates will start as beginners. But as diploma nurses, you are skillful, you can help them. You have to work together. If you feel that there's a need to enhance their skill clinically as a nurse before as a student nurse, then help them. Help them to grow. You are one team. And by helping them, you're establishing the identity of the nursing profession. Doing the right things, right?
Thank you, JP, for that addition. That's the really important point. But we also understand that there's an economic and financial influences. Because if you get the diploma a little bit cheaper, right? If you're the administrator, you have to look for a cheaper. So it's very complicated. Even in America, where they can do all bachelor's degree, but there are still diploma and associate degree because it goes back to the bottom line, which is the economics of it all. Right? But again, I think JP's point is important. If nursing needs to be respected as a profession, we need to be educated in a way that we're not just technicians, We have to be
Yes.
professionals. Professionals means we need to know how to do research. We know how to do evidence-based practice. We know how to teach. We know how to lead. If we continue to just be technicians, that's all. That's how they will see us. We will not progress. We will not advance as a nursing profession.
Thank you, Dr. Chanel and Mr. John Paul. Can you give me time to translate in Indonesia?
Sure, sure.
Jadi para partisipan, bagus sekali ya jawabannya. Pertanyaan itu bagus sekali ya. Karena di rumah sakit tidak selamanya yang dibutuhkan itu clinical atau yang D3, yang diploma ya. Untuk menunjukkan identitas kita, pendidikan sangat penting. Jadi saya usulkan yang masih ada masih mempunyai titel diploma ya, untuk menunjukkan identitasnya kuliah lagi untuk ambil S1-nya. Oke, dan seterusnya, menunjukkan identitas seorang perawat. Yang diploma itu memang programnya ya untuk apa? Klinikal. Contohnya ya technical. Ya, tetapi kalau dia sudah menunjukkan identitasnya untuk sekolah lagi, ya untuk improve siapa dia sebagai seorang perawat, dia ambil dia punya S1 contohnya, wawasannya lebih luas lagi. Tapi para tamatan yang S1 itu yang baru datang ke klinikal, ya, dibilang dia punya pengalaman tidak ada, itu betul. Dan tidak bisa melakukan sesuatu itu betul karena mereka baru mulai. Tetapi menurut tadi Dr. Chanel bilang sama Mr. John Paul, biar gimana pun pendidikan itu penting sekali menunjukkan identitas kita, identity as a nurse. Ya, sebagai seorang perawat. Ya, walaupun banyak pengalaman yang D3 itu, yang S1 atau yang profesi baru masuk, profesi nurse, dalam setahun mereka akan lebih luas, lebih cepat cara berpikirnya. Tapi kembali, kita harus menunjukkan identitas, identity as a nurse. Education is very important. Terima kasih. Ada lagi yang mau bertanya? Ada lagi yang mau bertanya?
Ada mem dari Arif Waifullah itu di room chat. Saya bisa bacakan atau mem aja?
Coba kamu bacakan deh. Oke, go ahead. Bacakan, Sastra.
Okay, the last question from Arif Wahyullah.
Yes.
Why many nurses in Indonesia can network in hospital abroad, while nurses abroad such as Malaysia, Philippines, Taiwan, and other countries? Thank you.
I cannot answer for the Indonesian part. Maybe Dwight and Dr. Hatipeya can answer that. But for the Philippines, one of the things is that we are English speaking. Our education is in English. So it's easier to go to English speaking countries because we are educated in English, and the curriculum, although I don't want to say that it's based on an American, but we use a lot of books. All the books we use are actually maybe just 1% Filipino, but all of it, 90% are American books. And because of the historical connection between America and the United States, so sometimes there's an easy movement between the two countries. And because in Philippines the nursing salary of the nurses is not too great, and because there's a chance, an opportunity outside to do even better, 10 times, how many times better. So that's why it's the push factor, the thing that pushes nurses to go outside. But I don't know, what's the situation? Dwight, what about Indonesia? Why is it that not a lot of nurses go abroad?
I think Dwight's internet is very down. I think.
Can I say, how about in the Middle East? Can I share my experience?
Yeah, go ahead.
Because by the way, I work in Saudi Arabia for 3 years, and I work in Qatar right now for about 2 years and 7 months. I agree with Mom Chanel. English is really important in writing, in speaking, because if you go abroad, it's a diverse environment. You'll be working with Jordanians, you'll be working with Americans, British, Filipinos, Malaysians, and for you to understand each other is you need to speak a common language, and that is English. Another thing is like yeah, I think it goes with, I'm not so sure with the curriculum of Indonesia because I haven't been there, but I think it goes with the curriculum as well because in certain hospitals they adapted some standards in hiring about the number of units that you have in your BSN career and your diploma. So if the number of units did not match with the requirements, so you cannot go for Middle East. I think the advantage on your side is I think most of you are Islamic and in Indonesia, and in the Middle East it's an Islamic region. So I think they will hire you because you know the practices. It's an advantage, the cultural beliefs, and I think the way to go now is how you're going to blend with different languages, and that is to really start with the language. And I think you're beginning to transform with your education with the BSN. Go ahead with that so that you can be comparable with the other overseas workers. I tell you, I don't want to say that money is the carrot, but actually money is part of the carrot. I mean, I don't want to reveal my salary, but if this is the way to tell you that Mom Chanel is saying that because of the opportunities. In the Philippines, when I was a nurse, I have. Is it okay to divulge, Ma'am Chanel?
Go ahead. Go ahead.
When I was in the Philippines, I worked as a nurse. My salary is 14,000 pesos. Then when I became a professor, my salary is 35,000 pesos. When I went to Saudi Arabia, my first salary is 160,000 pesos. Now I'm in Qatar. I'm earning 300,000 plus pesos. I'm not gonna say exact.
You can
So I'm
see the
not saying,
difference.
yeah, but do not leave your country that way. But the way things are is that the good thing with working abroad is that you help the economy of your country. In
But at the
fact,
same time, JP, it's not also good for your nurses to go abroad because it will
yeah,
drain your resources. Okay,
resources.
it's good for individual, but for the country, you have to be careful to navigate that.
Yeah,
Ma'am Hotupeya, do
Both
you
the
have
policies.
any explanation why not a lot of Indonesians go abroad and nurses?
Yes, one of the reason, okay, is the English. Okay, but some university who offer for the nursing, they have like 12 units. Sorry. 12 units for the English. So it depends. It's again depends on the curriculum of each school of nursing. Okay. So I'll give you an example, like in our university here in Bandung, where I graduated. Okay. English is important. Even we offer not only in Bahasa Indonesia, okay, but we have in international section too. So we have two sections. Okay, they can choose, but before they enter the English section, okay, they have to pass the TOEFL.
Oh, okay.
Right.
So we do have, and I think that time during my time when I was a dean, okay, 2010 2014, I opened that section, English section, and then Dwight is the first batch to enter.
Are they still in Indonesia or have they worked abroad?
Some of them abroad. Even they passed their license, RN.
Right.
So I agree, English is very important. Okay.
Can I add up?
Yes, Dwight, go ahead.
Okay. Actually, maybe because of information, number one. Like, not many people know the resources, how to go abroad. That's number one. But in my opinion, most of my friends in my batch, they're working in another country, in Japan. And many from Indonesia are working in another country also. So why not many people are going abroad from Indonesia? Because number one, besides languages, number two is resources, how to get there, information to get there, and so on. And maybe the third one is because maybe Indonesian people love Indonesia. They want to work here in Indonesia.
Right.
They really love the culture here in Indonesia.
Yeah, the culture. That's a culture, yeah.
Yeah, and to go abroad is we really need to to adopt with a new culture. And maybe some Indonesian like, I prefer to stay here. And maybe another reason why they don't want to go out is because they see that here in Indonesia, the nursing is growing also. So they prefer to stay here because they can see in the future nurses here in Indonesia is growing also. So that's my point also.
Right. Yeah. It's also cultural, right? I read somewhere that, you know, it's you're more attached to your own families in Indonesia. So you, but for Filipinos, we can always grow our family there. Or sometimes when we go to when we go to America, there's a family member there. There's connection, you know. So it's much easier. So many factors, I think.
Okay, let me share with them in bahasa. Oke, jadi teman-teman sekalian yang hadir pada pagi hari ini, jadi bahasa sangat diperlukan untuk para perawat di dalam pelayanannya. Ingat kembali, kita punya pasien bukan hanya orang Indonesia. Oke, itu penting kita ingatkan, menunjukkan identitas sebagai seorang perawat. Bahasa penting sekali. Ya, khususnya bahasa internasional. Supaya kita bisa apa? Melayani dengan menggunakan bahasa internasional. Jadi kalau teman-teman sekalian yang hadir pada pagi hari ini, para partisipan, ya, mari kita sama-sama belajar bahasa Inggris supaya pelayanan kita pun lebih apa? Lebih sempurna. Kita pun lebih bisa apa? Menunjukkan identitas kita sebagai seorang perawat yang bisa melayani siapapun yang datang kepada kita secara internasional. Okay, I think I will give to Sastra. Bagaimana Ibu Sastra? Sudah selesai semuanya? Silakan.
Mem sudah pertanyaan sudah habis tadi itu pertanyaan terakhir dan mungkin langsung nanti untuk sesi ini udah selesai dari Mr. Channel. Langsung aja mungkin Mem bilang sampaikan bahwa kita berterima kasih banyak kesempatan hari ini. Nanti lanjut ke Pak Asep.
Habis ini siapa langsung? Oh,
Pak Asep.
Pak siapa?
Mr. Asep Bajaludin.
Okay, Dr. Chanel and
yes, ma'am,
and Mr. JP, John
Yes.
Paul. I'm very happy that you can share with us here as an Indonesian nurses, and that I hope to see you all again one day when we have this webinar. Okay, thank you very much. It's a very
Thank you.
It's been a pleasure. I would love to answer more questions, but you know, but this has been very interactive. Thank you so much for your attention. Thanks for inviting us.
Thank you very much.
Thank you, Mr. Chanel.
Thank you.
Thank you. Oke, sekarang kita masuk untuk yang terakhir sebelum makan siang. Itu betulkah, Ibu Sastra?
Bukan, Mem. 3 materi terakhir sebelum selesai. Jadi bisa sambil makan siang.
Baik. Kita beri kesempatan ini kepada Pak Asep dengan judul The Role of Nursing Association in Developing Nursing Practice. Silakan, Pak.
Thank you very much, Dr. Lina and Ms. Sastra. And great appreciate to Dr. Chanel and GP. Thank you very much, and Dwight as well. Really great to hear you giving us some future what are we going as the nurses, and maybe this make us more eager to go abroad, especially to somewhere else. They giving us like what the salary. Remember everyone here, the salaries make us. I was working in Australia previously, Dr. Chanel, and even really. I know it's really hard work as the registered nurse in Australia, and I have good friends as well from Philippines, Malaysia as well. But that's something I keep in my mind. I work here one day in Australia, same work in Indonesia as 1 month. So it's been make me more eager to work, more comfortable to work, even really hard work. I know it's really hard, like different with in my country. Because usually we just giving delegation from the doctor, not just giving comprehensive nursing care to the patient. So I did this experience when I worked in Australia, which is giving biopsychosocial spiritual as well, even different religion, but we're keeping them more comfortable in taking care with religion. So it's great appreciate to Dr. Channel. Thank you very much, Dr. GP and Dwight. Thank you very much for letting us really good presentation today. And let me introduce myself. My name, would you please give me chance to open PowerPoint or sharing PowerPoint, please? Still this. I think Bu Sastra still disable to share screen.
Yes. I will share screen for your see.
Okay. I think Miss Sasa I will do by myself if you wouldn't mind, please. Sama saya aja Bu Sastra nggak apa-apa untuk ini. Atau mau dibacain dulu, nggak usah dibacain.
Betul. Silakan sebentar Pak, boleh? Atau mau?
Siap, silakan.
Oke. Share screen. Okay, the next our speaker is Mr. Asep Badru Jamaluddin, and then next Dimas naikkan dikit. He is graduation from the Bachelor of Nursing from the Binawan Institute. Dimas naikkan. Binawan Institute of the Health Science, and then Bachelor of Nursing from the University of Technology Sydney, 2007 until 2008. And then she get registered nurse from the Nursing Board Australia, 2012 until now. And also Miss Master of Nursing from University Western of Sydney, 20 and until 20 to 20 and to 12. He occupations, he is a lecturer of nursing at the General Ahmad Yani Institute of Health Science, or Indonesian is called the Stikas Ahmad Yani until now. And he is also as a clinical instructor and medical surgical nursing area at Santosa Hospital, right, Mr. Asep? Okay, I think is itu sebagian dari kurikulum vitae beliau. Silahkan dilanjut Pak Asep.
Okay, thank you very much, Ms. Sastra. I'm sorry, can you hear my voice? Kedengaran suaranya nggak? Baik. Okay, thank you very much. Okay. Good afternoon, everyone. How are you today? Let me sharing with all of you guys about the role of nursing association and the development of nursing practice. This is my name, Asep Badru Jamaluddin, which is already introduced by Ms. Sasra. Thank you very much. Currently, I'm the lecturer at Faculty Health and Technology Sciences in Unjani, as well as I'm working as clinical instructor in medical surgical nursing area of Santos Hospital Bandung Central. This is already mentioned by Ms. Sastra. The objective today, I think we already great here from Dr. Channel and Dr. John, Dr. Dwight about what the nursing identity and nursing future. So there is 4 topic I'm going to sharing with all of you. The first one is nursing association in the world. The second one, the role of nursing association. The third, nursing association in Indonesia, which is PPNI. The fourth, the role of nursing association in Indonesia. Let me giving you some view about what is different between nursing board and association. I think in Indonesia we say is MTKI, Majelis Tenaga Kesehatan Indonesia, which is nursing. Same like nursing board, I think. And association is which is PPNI Indonesia, Persatuan Perawat Nasional Indonesia. we have to clear with this what is different between nursing board and what different with nursing association. The nursing board, they are focusing on regulate nursing practice and protect the public. So it's more the how to deal with the practice of nursing and protect the public. And what else about the nursing or nursing board? They protect and promote the public health, welfare, and overseeing the assuring licensed nurses from every level. So after the regulate the nursing practice, and they protect as well the public health and license. So it's mean like current name is STRS. Yeah. Jadi surat tanda registration, or sometimes in overseas or abroad we say is registered. Yeah. So the nurse is registered nurse. So this kind of job or job description of nursing board. And another thing is they have to renew as well. Like have to renew the current license as registration or STR, and they have also the licensing to do exam. This means before we finish our study, like in Indonesia, we do national examination, yeah, UKOM. And I think in abroad it's a little bit different. When I studied Bachelor of Nursing in Australia, they are automatically as a registered nurse. So I mean after finish study Bachelor of Nursing is directly as registered nurse. No need to do any national examination. So it's automatically a little bit different. And then what else? They advise on the legal scope of nursing practice. So nursing board as well, they can giving advice to do how to do guideline about nursing practice as well. What else? Qualified and competent. So the nursing board have to make sure the people or the nurses who are finished or getting the education level or registration is qualified and competent. So it's the responsible of nursing board. And then what else? They have to clear legal authorization for the scope of practice. It means we can see what is different between diploma of nursing and bachelor of nursing. I think have to clear. That's the responsible guideline from the nursing board. I think in Indonesia we can see like PK1 ya, praktek klinis 1, praktek klinis 2, and so on. I think when I was in Australia, there is the clear job description between diploma of nursing. They said is enrolled nurse, and with bachelor of nursing, which is registered nurse. So it's different. We can see the enrolled nurse or diploma of nursing cannot do like giving blood transfusion without registered nurse. They have to check both of them. So it's like this, like what the name is legal authorization. And then what else? They work to educate nurses and ever changing the law. So it means they can educate something like current update about law. They have to educate the nurse as well, and even they can giving advice to the government about the multi health care law or something like that. This is the nursing board. And what the nursing association? So nursing association is professional membership organization. I think we are clear. We do know clearly about the PPN ya, Persatuan Perawat Nasional Indonesia. We do know well about that one. So this what that one is private and requiring members to pay. So we have to pay for become member. And same in overseas as well. To be the member of professional nursing association, they have to pay. And usually they governed by board of directors. So they joining, I mean, combine with the nursing board as well. So they work hand to hand with them. And what else? The nursing association, the united voice for the nurses. It means one voice, like the PPN voice something, that's the voice of the nurses. So what else? To empower the profession and advance quality of healthcare. So they have to empower, keeping them power, the nursing profession to increase the quality of health. And some of them, like we do know that some of member of nursing association is legislative, political. It's really good actually for us. Why? How to deal with the government about the law, about the nursing standard or something like that. If some of the nursing association member is legislative or political. And what else the nursing association do? Advanced nurses their career. Yeah. They're offering the unique opportunities by what? Continuing study, education, certification, role relative competencies, and educational conference. So it means they have to provide the continuing education, yeah. Encourage the member to continue study from the diploma of nursing to be bachelor of nursing, and to be master of nursing, something like that. That's the nursing association. According to American Nursing Association, what is professional development? So professional development is vital facet of lifelong learning. So it means lifelong learning. So it means everyone have to be continue studying, continue learning, improve the skill, knowledge. Like the GP said previously, have to be will be part of the researcher nurses. So after that we can do like the evidence-based practice and something relative to it. So what else? As the lifelong learning, the nurses engage to develop or maintain competence, enhance professional nursing practice, support achievement of career goals. So it means the nursing professional development, like as the part of nursing association, they will help us as well to carry a professional nursing practice. Okay? And in the world, like ANA, American Nurses Association, is one of more than 100 national nursing organizations. I think the big one, the nursing association in the world. And usually they provide some current research about the COVID-19 and something like that in regard to nursing practice. And also in professional nursing organization will continue same thing like continuing education, certification opportunities, role related competencies, and educational conference. So it means like I said previously the nursing association is provide opportunities to do competencies and then educational conference as well as the certification. I think in Indonesia same thing, like before we apply for registration, we have to complete 20 SKP. So it means this can get the letter from nursing association. Ika Yuniarti. Okay, thank you very much. Okay, we carry on. So I think I forget to say I bring your mind to see the big one in the world about the nursing association. I give the example is ANA, American Nursing Association. And because I a part of nursing association from Australia previously, I can give briefly about what is nursing association in Australia. This one I copy paste from the nursing association in Australia. What they are featuring for the giving to the member of nursing association, they have to access to over 20-hour free CPD, continuing practice development, and the 61 topic including those module for competencies, and then pre-professional development portfolio to provide evidence to the nursing and midwifery board. So they provide like portfolio. We have in Australia we have to do our registration yearly. So every year, different with our country in Indonesia every 5 years. But in Australia every 1 year we have to we have to renew our registration nurse. But we have to provide 20-hour free 20-hour about CVD as well. So what else? Access pre-webinar and range of topic. Because we paid for the nursing association, they provide us some free webinar. And I think this is the current one from the contribution of professional nursing organization. Yeah, this some briefly the encouraging to the nursing association to give this one to the nurses or to the member. The first one is assisting nurses with the long-term effect of the pandemic. This is the current one. So it means the nursing association have to help the nurse who are dealing with COVID-19 directly or not directly. About what? About the effect of pandemic. The second one, set professional standard of practice that to which nurses can refer. So it means they have to provide standard practice for taking care of COVID-19, something like that. So it's part of the nursing association to provide some standard. The third one, they provide opportunities to engage with other nurse colleagues through a variety of mechanisms. So it means when we are joining with nursing association, we have the opportunities to know each other. Yeah, some from maybe from Java Island, they can meet with the Sumatra Island, Kalimantan Island, and something else, or even different countries as well. Yeah, because we are part of the nursing association, like in Indonesia, and if sometimes we can change to know about the nurses from overseas. Yeah. Like GP said, maybe from Qatar, from Philippines, from Australia, from USA, England. So it means we have to get opportunities if we join with nursing association. The fourth one is influence policy at the local and national level. So it means the nursing association, because it's the part of its member with, I don't know, Indonesia maybe more than 100,000. I think the nurses joining with PPNI. Yeah? So it means it's the big change to what if influence policy. Yeah. Giving to the government, we encourage this the policy for the standard, or even could be negotiable about the salary. I think we can do it by nursing association. And this my previous experience in Australia. The nursing association can ask the government to increase the salary. So it's been the good one actually. They hear us about the what the nurse want to about the salary. Yeah. It's different on the how the strong of nursing association. And what else? Developing resources, yeah, provide safe quality care. It means could be in the web. They provided a lot of resources, yeah, regarding the nursing practice. And what else? Remain recurrent in their clinical practice. Yeah. So the nursing association will keep in touch with the nursing practice. It's really relative by specialists or by knowledge as well. And then educational conference as well. Yeah, PPNI, I think in Indonesia, every day they provide some free webinar as well. So it means it's good for us to increase our knowledge, experience, as well as about the evidence based practice, the current one. What the current one, what the evidence based practice the current, so we can implement it in our daily basis. And what else? Provide support for certification. I mean, they can giving a certification for good Woundcare and something like that. But also they support for supporting document, yeah, to apply for registration. And then establishing professional standard of conduct, yeah, like code ethic, yeah. Think of code of ethics, nurse patient ratio, practitioner competencies, yeah. So I think we in Indonesia we currently try to making the standard, like how to the practitioner, because in overseas like in Australia there is the nurses like practitioner who can write some script, yeah, to like the medicine to buy giving to the patient. But there is the standard one. Not all medication can give it to the patient. Yeah, like the medical grade. And then specialty nursing organization often expand on general profession standard to provide more specific guidance. So some of them is like not only general nurses, yeah, can increase to be nurse specialists, but could be different countries a little bit different. Like in Australia, when I was working there is the nurse specialist, uh, not have to be master of degree. Yeah, some of them is like only 3-4 months did after the bachelor of nursing, they did some specialistic practice. They can get specialty in that area, medical, surgical, or critical. And what else? I can see in the top one. But they have to be enhanced member leadership ability. Yeah? So joining with the nursing association as well have to be have to change for us, like to what, to be leader. Some of the even maybe will ask the member to be moderator, yeah, and could be as the speaker or something like that. So it's meant to enhance member leadership. And then the influencing policy, yeah, like it said previously that the nursing association can influence policy, yeah, by having but representative provide national government leader and other healthcare organizations to assess issue influencing nurses and their practice, education scholarship funding for research effort. Yeah, I think most of the nursing association provide some education scholarship. Yeah. And then in I think in the developed country they're providing some education scholarship and author with opportunity to influence policy. But what? So the author is mean the nurses who are good in research, good in education level, can opportunities to to influence the policy. Yeah, they have to they provide some research, they provide some best evidence and giving to the decision maker for the law for the government. Could be they have a look and then they said, oh yes, yeah, the nurse is really hard job, they have to pay more, or same thing with the another profession, so they can do that. That's the part of nursing association. This one from back to the American Nurses Association. The ANAs provide some define standard for registered nurse. The scope of standard nursing professional development, or we can sort by NPD, describe the component of NPD practitioner should be performed. So I think this one as well have to be is part of the nursing association. Maybe Indonesia next time will do this one for the nurse practitioner. And also they will partner practice transitional learning from what? Facilitator, change agent, mentor, leader, champion of scientific inquiry, advocate from NPD specialist. So that's the thing we can do ya sebagai fasilitator, agen perubahan, mentor, pemimpin, kemudian juga pembaharu dalam apa namanya keilmuan gitu ya. Kemudian apalagi even they can new role in our ever changing healthcare system. Ya, mereka dapat juga membuat aturan atau sistem perubahan yang baru. I think Miss Ika Yuniati, I think would you mind to mute this? I can. Okay. And then the ANA as well provide two NPD. Yeah. The first one is generalist, and then the specialist. So there's have the make two level of the revised standard from generalist and specialist respectively. Okay, this one is some benefit I got from Kathleen Gaines 2019 about what is the benefit from joining nursing organization or nursing association. What education, local meeting, annual convention, networking, certification discount, career assistance, newsletter, position level, paper and statement, the professional and peer review journal, resume of your strengthening of the nursing profession. So this some benefit of nursing association joining. What else? I think we'll add from the another journal, and the area of the nursing association is they can research evidence-based practice, quality improvement. So it means more deep if we are joining with the nursing association, and part of the role of nursing association to what, to do research, evidence-based practice, quality improvement. So it's part of nursing association. When we can have a look the website of American Nurses Association, specifically about the education, they provide some tool for the member. Yeah, all workshop, certification tests, nursing education, career and professional development, clinical practice knowledge, leadership, ethics, yeah, organizational credentialing, work and environment, organization resources. And then they provide some as well. Yeah, if we need book, they provide the link, so the member can just tick the or type the name of book, so they can open it straight away. And also for there's some another resource, yeah, credentialing, research grant. I mean for the scholarship or for the research, they provide some grant. Okay. Okay. I'll now we'll be back for our nursing association in Indonesia, Indonesian National Nursing Association, which is PPNI. I think most of you we see our website, the Nursing Association. But the vision of the Indonesian Nursing Association is professional organization that is loved by members, loved by government, taken into account by other organizations. So this is the vision of Indonesian National Nursing Association. The mission is strengthening management at every level, including organizational bodies and institutions, strive and prioritize the interests of members in the implementation of professional, ethical, and beneficial practice like a profession. Build and broad effective network in carrying out the role of the organization, coordinate with government in policy and relating to the industry. So it means I think we can see if we compare with Anna previously, I think the same thing. What we have to the Indonesian Nursing Association as well is try to deal with what the government policy, try to keep the big network with another profession. And the current one, development nursing practice by PPNI, ya, Persatuan Perawat Nasional Indonesia, advocate. With advocate, we can use like some member of have problem with practice, something like that. They can help us. They're giving us some helping for the how to present, how to deal with the law, something like that. And the current one we have to proud as well. They have already provide some standard practice. Yeah, we say 3S. Yeah, SDKI, SLKI, and SIG. And the standard of each sciences. So from the medical, surgical, from the emergency community, they provide some guideline. Yeah, how to deal with COVID-19 when the patient come to the emergency department. They provide it. So that's the good thing. And the free webinar, yeah, I think PPNI provide most of all day. I think they provide webinars. Yeah, so it's mean it's good to be part of the member today, to be joining with them to see what the current one, what the issue, and what else the nurses career path and functional position of the nurse. Yeah, so this already did by nursing association in Indonesia. how to try to deal with government, to giving different point of money salary, yeah. So they provide like PK1, this one how much money they get to, PK2, 3, and specialist something like that. I think they provide like. I haven't finished yet with the dealing with the. I think because it's because of the budgeting. Yeah, the budgeting is really hard to deal with, so that's why it's more struggle yet to pass this one. So it's one in the last. Yeah, the role of nursing association for developing nursing practice. I think I take from overseas plus from Indonesia as well. I think that the role of nursing association for developing nursing practice, the first one is advocate, next standard practice, continuing education, career and professional development, collaborative partnership, research, evidence-based practice, quality improvement, and influence policy. I think this is the role of nursing association. I think PPNI is already trying to do all of them, yeah, to giving us some the strong organization. So we hope like not just in be implemented in the top one, but in the fact, in reality as well. We want to same thing, like we are partner of the doctor, not just like helper or just servant, yeah, not that one we want to. So hopefully, yeah, all of you guys who are attending in this international seminar, who already joining with the nursing association, they think I think it's a lot of benefit for us. And this reference I took from. I think that's it. Sharing for me about the role of nursing association. Thank you very much. If you have any question, you can ask me directly. I giving back to moderator. I think is any Miss Sastra?
Okay, sir. Thank you for your material presented. And now time for discuss. All our participant today. Any question?
Kalau ada pertanyaan silahkan.
Pak Asep mungkin boleh dikasih kesimpulan dalam bahasa Indonesia kali supaya peserta yang hadir bisa memahami lebih baik. Terima kasih.
Siap, terima kasih Bu Sastra. Kesimpulannya teman-teman terkait dengan nursing association, ya, kalaupun belum tadi yang saya sampaikan, saya ambilkan tadi dari Persatuan Perawat di Amerika, ya, yang besar sekali, hampir 4 juta kayaknya membernya di sana. Kemudian kayaknya Ana juga salah satu leading nurse association in the world, ya, jadi yang ada di dunia. Ya, apa yang harus dipersiapkan oleh nursing association, ya? Tadi apa terkait dengan advokasi, ya, kalaupun teman-teman kalau udah joining nurse association atau organisasi profesi, teman kalau ada masalah, ya, bisa bisa disampaikan, ya, kan ada DPK teman-teman, ya, DPK di rumah sakit, ya, tetap jadi kita berhak mendapatkan itu, ya, yang pertama advokasi. Yang kedua terkait dengan peningkatan edukasi kita, ya, apa berarti nursing PPNI memang harus menyediakan terkait dengan pendidikan, ya, meningkatkan karir kita, karir para perawat, apa dengan webinar, dengan pelatihan, kan kita bayar, ya teman-teman, per tahun itu bayar, jadi berhak, ya, untuk mendapatkan itu. Selain itu apalagi terkait dengan pengurusan STR, ya, teman-teman jangan usah ragu, gimana. Jadi kalau ada suatu hal, teman-teman kan online sekarang, ya, jadi itu berhak untuk, ya, menanyakan, mendapat bantuan yang baik dari DPK, ya, bagaimana ngurusin STR, ngurusin SKP-nya itu bisa, ya. Kemudian apalagi terkait dengan, ya, kita berhak gitu kan, lagi diurusin sebenarnya, ya, terkait dengan jenjang karir para perawat, ya, itu PPNI lagi melakukan. Karena apa? Karena nanti akan berbanding dengan biaya. Jadi teman-teman kalau deal istilahnya selain dari pengalaman pengurusan perawat klinis 1, 2, 3 itu bahkan berbeda ya tunjangannya. Nanti kalau udah disahkan berarti kan deal tuh ya, lagi diajukan terkait dengan mungkin sudah ada sebagian rumah sakit yang melakukan. Kemudian juga terkait dengan terkait dengan standar praktek ya. Standar praktek kan PPD mengeluarkan. Yang terbaru terkait dengan 3S. Jadi teman-teman kalau sudah melakukan 3S, ya SDKI, SLKI, SIKI dalam melakukan asuhan keperawatan, ya insya Allah itu aman istilahnya ya, tidak akan kena delik dan sebagainya. Kalau ada sesuatu hal kita melakukan sesuai dengan ini standar. Ya, walaupun buku 3S tidak mempengaruhi terkait dengan clinical judgment. Ya teman-teman praktek udah 10 tahun di sana, kok nggak ada di SDK SLKI kita melakukan ini betul bagusnya nggak apa-apa, itu clinical judgment ya, tidak dihilangkan, tetap ada itu ya. Kemudian juga terkait dengan standar praktis ya, penggantian change the law ya, terkait aturan-aturan itu nursing association bisa ya. Bagaimana kita di Indonesia dapat undang-undang keperawatan, itu kan berarti kita sudah punya payung hukum ya yang bisa digunakan bahwa kita itu profesi ya. Dan terakhir juga di-link dengan tadi dengan profesi lain ya. Terus terang teman-teman ya, kita masih ini juga ya. Jadi tadi kalau disebutkan sama sama GP atau dokter channel itu terkait dengan apa? Karena mungkin kita bukan klinik teknis doang, kita pasang infus, kan itu teknis ya. Suruh ngasih obat itu teknis ya. Berarti teman-teman harus meningkatkan apa terkait dengan critical thinking-nya. Jadi dikasih dokter suruh memberikan, kita harus tahu apa sih alasannya ya. Kadang-kadang teman-teman yang di ICU yang berapa lama di sana bisa ngobrol dengan dokternya, kan dokter yang baru terkait dengan pemberian obat atau terkait dengan perawatannya gitu ya. Jadi kita harus gitu ya, harus pede yang pertama, yang kedua betul harus meningkatkan terkait dengan keilmuan dan skill kita ya. Dan kita ingat kita perawat teman-teman, bukan dokter ya, berarti beda ya. Dokter juga tidak bisa melakukan kegiatan kita ya, memandikan pasien. Emang dokter bisa cara-caranya ya. Nggak bisa itu ya teman-teman, itu bukan sesuatu yang dianggap kita sesuatu yang itu mah kerjaan apa gitu. Itu justru perawat itu bisa ya, kita melakukannya juga kan dengan biopsikososio spiritual ya, bukan hanya dokter hanya biologinya doang, mungkin kita di psikologinya, sosialnya, sampai spiritualnya juga kita fasilitasi. Nah itu perawat, itu peran perawat. Mungkin itu Bu Sastra kesimpulannya dari role terkait dengan nursing association.
Baik, terima kasih Pak Asep. Sepertinya tidak ada pertanyaan di room chat. Apakah mungkin sudah clear, dan kemudian tadi penjelasan materi yang disampaikan Pak Asep juga cukup jelas ya. Dan tadi juga materi 1, 2, dan 3 itu cukup baik untuk banyak mewakili dari topik-topik yang kedepannya. Baik, jika memang tidak ada pertanyaan, cukup sekian. Mungkin Pak Asep, terima kasih banyak untuk...
Terima kasih banyak Bu Sastra dan teman-teman semuanya, terima kasih banyak dan mohon maaf atas kekurangannya ya. Terima kasih Bu Sastra.
Terima kasih Pak Asep. Terima kasih. Baik, before the next subject, we give the opportunity for Yakult team. Yakult team, Pak Mangasa was present here.
Yes.
Oke, Pak Mangasa, silakan untuk menyampaikan materinya. In English or Indonesia, setengah-setengah bisa. Karena kebetulan pemateri kita dari luar, mereka sudah kayaknya izin leave, jadi bisa disampaikan dalam bahasa Inggris dan juga bahasa Indonesia supaya penyampaiannya lebih bisa diserap oleh peserta yang hadir di sini. Karena dari tadi sebetulnya banyak banget request mana bahasa Indonesia, bahasa Indonesia. Tapi kita sedang melatih dan membawa supaya terbangun bahwa harus improve in English supaya bisa lebih banyak kesempatan untuk bisa berkarir dan mendapatkan selera yang lebih baik dan merubah hidup kita dan merubah dunia juga. Silakan Pak Mangasa.
Baik, terima kasih. Izin share screen terlebih dahulu. Oke. Okay. Okay, good afternoon, everyone. Thank you very much for this opportunity to me represent of the PT Yakult Indonesia Persada. And thank you very much for this event from International Webinar Yayasan Guna Harapan Baru. I already hear the good speakers from Philippines and from Indonesia. Thank you very much. I need for increase my perspective about the nursery. And then this is my material. I will say to you about the role of LCS in preventive gastric disorder. And we know that the LCS is a bacteria in the Yakult also, and then Yakult only had one the bacteria that is a LCS. And the agenda is the number one is gut microbiota, and number two, how about the probiotics, and then the three, LCS and the correlation of the gastric ulcer, and number four is take-home message. Okay, but firstly, I want to ask to you, everyone, have you drank Yakult today?
Yes, I
Yeah.
do.
Yes. I already won. And after that, after this time, I will drink again. Yeah, please drink. Okay, the concept of the probiotic for health, the purpose is to control bacteria with bacteria, isn't it? And then the Hippocrates, we also known the father of the medicine, Hippocrates said, all disease begins in the gut. All disease begins in the gut. And so the Elimeshnikov, 100 years ago, said the yogurt should be a miracle ingredient for longevity. He also had received Nobel Prize laureate about the longevity, about the bacteria can curing the disease in our intestine. And then after that, Dr. Minoru Shirota from Japan had a perspective from Elimeshnikov, and then he discovered the good bacteria that can reach the intestine alive. That's why he can call the probiotics, and develop the fermented milk drink that we also know the Yakult name, yeah, Yakult, yeah. And then Dr. Minoru Shirota is the founder of the Yakult, and also the first man can cultivate the LKC Sota strain live to the fermented milk drink that can drink with everyone. He succeeded strengthening LKC Sota strain in 1930, and he developed the Yakult in 1935. It took too long, 5 years, to making the bacteria alive can be the production of the Yakult. That's so that's why the Minoru Shirota also known the pioneer of the probiotics. Okay. And gastrointestinal tract, maybe we can review again. I think all of you know the huge number of the species microorganisms inhabit in gastrointestinal tract. Is dense part with more than 1,000 species and over 10 to power to 14 cells. It's a huge number, huge number, more than 37 trillion. Yeah, the somatic body cell. That's why I think the bacteria is very influencing about our state of our body. That's why the bacteria cannot be eliminated all. Maybe antibiotica can kill the bacteria, but I think that bacteria is very dependent to our body, and our body very dependent to gut bacteria, vice versa. And the three group of the bacteria in our gut is beneficial bacteria, neutral bacteria, harmful bacteria. Natural bacteria is 50% of all of the bacteria. Beneficial bacteria 20%, and harmful bacteria 20%. So if we eating the health food, the beneficial bacteria will grow up, and neutral bacteria cannot mess our intestine. But if we don't care that our food and the time of we eat That's why the harmful bacteria can increase and natural bacteria will be harmful bacteria. That's lead to disease, cause a intestinal putrefaction, produce a carcinogenic agent, and produce toxin. And right now, the scientists really intends to know about association of gut microbiota in health and disease, relating to the physical stress, gut microbiota to autism, gut microbiota to depression, gut microbiota to cancer, inflammatory bowel disease, rheumatoid arthritis, allergy, infection, atherosclerosis, diabetes, and obesity. What is the probiotic? Probiotic are live microorganisms which, when administered in adequate amount, confer a health on the host. Refer to FAO and WHO 2002. The pioneer of the probiotic is the Yakult product. No preservative and no coloring at all. And the emphasis of the probiotic is the bacteria must be alive in our intestine. It can passing to the stomach and then passing to the bile juice and then alive in our intestine. This is the viability through gastrointestinal tract. In the Thailand, Teng Rim and et al. Take a study before intake, 20% in Thailand, below detection limit about the number of bacteria, LCS. And after 1 week after intake start, the number of live bacteria is increasing. And then in China too, Wang and et al. And the colleague, before intake, 25% in China, detection limit is very, very low. But 1 week after intake start Yakult, the live bacteria, LCS, growing, increasing gradually. And then 2 weeks after intake start is more stable. Indonesia too, we also research in the Yogyakarta and Bali with Utami, Dr. Utami and colleague in the University of Gajah Mada. They say that before intake Yakult, the law of number gut bacteria is very small, good bacteria. But after that, after drink Yakult, the bacteria, live bacteria, not dead bacteria, live bacteria is increasing in our intestine. Now, this is the reported of the LCS research in our Yakult Center Institute. If you drink Yakult, reach in gut life and produce lactic acid, prevent the gut microbiota dysbiosis, and then stimulate the organic acid production. That's why they regulate gut peristaltic and improvement of gut disorder like loose stool or diarrhea, constipation, and reduce harmful substances. And then we drink Yakult, we also know the intestine is the more than 70% of our immunity in there. So if we drink Yakult, the gut bacteria can modulate immune responses, stimulation, regulation about prevention of infection and reduction of the cancer. And then we also know that gut and the brain have connected, vice versa. Let's say the gut-brain axis via the gut vagus nerve. And then if we had the drink Yakult and have had probiotics, it can suppress the abdominal pain and other disease related about that. And surprisingly, L-casein suppressed a necessary inflammatory reaction. There is a 10 of the patient ulcerative colitis in Japan. We study and before and after drink Yakult, and interleukin 6, EL6 is pro-inflammatory cytokine, as we know, is can be suppressed until 40%. So that's why LCS suppress the inflammatory reaction. Suppression rate of production of inflammation can be normal again. And more than 70% of the immune system is located in the gut. Okay, and right now Helicobacter pylori, that doctor of gastroenterologist, University of Western Australia, Dr. Barry Marshall, said the Helicobacter pylori is very, very dangerously because he can make the ulcerative in our stomach and then make a cancer. That's why the Dr. Barry Marshall and Dr. Robin Warren had a Nobel Prize in Medical Physiology about Helicobacter pylori. Yakult Central Institute, there is the two Central Institute in Japan and the Belgium. The purpose is to study the function of microorganism. That's also we studied about the Helicobacter pylori, how to reduce, how to eradicate. In our institute, we had 300 researchers in there to evaluate and how to maintain the microorganism can make help to our body. This is the Yakult effective to support to eradicate H. pylori. Seguras and team in the Yakult and Yakult in the Mexico. And then L-casein to help the eradication of Helicobacter pylori too. With this study, we can also know that drinking Yakult regularly can increasing the effectiveness of treatment therapy, and there's no side effect about that. So if we drink maybe treatment like a PPI, antibiotic triple treatment, we can also adjuvant with the L-casein strain also. Dr. Minoru Suratasret, be a good physician rather than skilled one. This is the Dr. Minoru Suratasret, because the sincerity of the how to service the patient is more valuable than a skilled one. How to sincerity, to how to loving, that is the main of the how to Yakult can give to the our customer. The scientific evidence underpinned by more than 80 years history, Yakult, there is a lot of the scientific evidence. In L-casein strain, more than 300 human study done about L-casein strain. Yeah, the number of peer review reports from the 1935 until now, more than 300 scientific evidence. No adverse event related to product for more than 80 years. To ensure safety and efficacy of LCS, Yakult, number one, we had a label food for specified health users from Japan in 1998. And then from United States, FDA, that's a very, very important institution, that the Yakult or LCS had certificate GRAS authority since 2012. GRAS is the generally recognized as safe. And then in Indonesia, we had also certificate halal MUI with a grade A. And then from BPOM RI, we have a Piagam Bintang 3 Keamanan Pangan. Yeah, and that is the very safety and the efficacy is can be proven in all of the institution, international abroad or in Indonesia too. And the take-home message in our presentation is number one, trusted LCS probiotic, very safety and efficacy. Efficacy is more than 80 years, no side effect, no adverse event. So that's why that can reliable in the 40 countries right now. And the number two, based on research, LCS is the result of the research in order to balancing the gut microbiota and H. pylori also, and normalize our inflammation if we had a big inflammation in our body. And the number three, the efficacy of LCS is proven. So that's why I hope we can drink daily, every day, as me. And Dr. Minrota said, Kencho Choju, a healthy intestine leads to a long life. Oke, terima kasih teman-teman sekalian. Mohon maaf kalau ada kata-kata yang salah. tetap semangat, tetap sehat, sukses terus. Salam sehat. Terima kasih, Ibu Sastra. I'm listening to you.
Baik, terima kasih Pak Mangasa untuk presentasi yang luar biasa. Ini untuk semua peserta yang hadir di sini, apakah ada pertanyaan terkait materi yang disampaikan oleh Pak Mangasa? Ada nggak, Mas? Pak Mangasa, terima kasih. Sepertinya yang materi yang disampaikan cukup jelas. Jadi peserta sepertinya cukup memahami apa yang disampaikan Bapak. Jadi terima kasih buat sharing ilmunya dan mudah-mudahan ke depan Yakul makin sukses, makin banyak dikonsumsi oleh masyarakat untuk meningkatkan kesehatan kita. Terima kasih Pak Mangasa. Terima kasih.
Terima kasih,
Selamat siang.
Ibu Sastra. Selamat siang.
Terima kasih. Oke. Baik, pemateri kita yang selanjutnya adalah Bapak. Ini materi 2 terakhir dari webinar kita hari ini. Bapak Mario Esau Katuk, apakah sudah berada di dalam Zoom, Pak? Di ruang Zoom?
Ya, Bu. Selamat siang.
Baik. Baik, pemateri kita yang keempat hari ini, yang kelima ya? Bukan, kelima. Kelima hari ini adalah Bapak Mario Esau Katuk, MPep, SP, Keperawatan Medikal Bedah. Ya. Beliau lulus dari Sarjana Keperawatan dan Nurse dari PSIK Universitas Samratulangi, Pak ya, betul ya? 2012 dan kemudian mengambil Magister Keperawatan di FIK UI tahun 2014 dan juga mengambil Nurse Spesialis Keperawatan Medikal Bedah di FIK UI juga pada tahun 2015. Dan juga kegiatan beliau saat ini adalah sebagai dosen dan clinical instructor di PSIK Universitas Samratulangi, dan juga beliau menjadi reviewer soal UKNI untuk regional 7 ya. Baik, kepada Bapak Mario, kami persilakan waktunya, Pak.
Okay, baik. Thank you for the opportunity and thank you for having me here. It's an honor to be a part of this webinar, and I try to deliver this material bilingual, maybe in English, but also in Indonesian. Okay. Should I share the material using this share screen feature, Bu Sastra, or the committee will help me?
Oke. Langsung aja Pak, di-share.
Oh ya, oke, baik. Okay, so today I would present about the diabetes and quality of life, a way to improve quality of life. And as we know that November is the month of diabetes, as the world celebrate the World Diabetes Day on 4th November. So I believe that it's a great opportunity for us to discuss about diabetes in this webinar, especially about the quality of life, since the topic of World Diabetes Day in 2020, it's about how the patient could access the good quality of care in Indonesia or in the world. So it's correlate with quality of life. So I think it's a good time for us to discuss more about it. Okay. This is the summary of the prevalences of diabetes in the world. the research was conducted by International Diabetes Federation. You can find this material on Diabetes Atlas 9th edition. As we can see on the screen that in 2019, the number of diabetes patients in the world was about 463 million, and it keep increase, and it is projected in 2045 it would reach 700 million. It increased about 51%. And I believe that it's a huge number that we should encounter about 20 years later. And so that now the institution, the healthcare providers should do the preventive program to, to prevent the number of diabetes patients in 20 years later. And as we can see, we as an Indonesian, we are the part of Western Pacific, and in 2019, it's about 163 million diabetician was found in Western Pacific, also in Indonesia. So what are the key messages about the diabetes? The first one is diabetes is a serious long-term condition that occurs when the body cannot produce any or enough insulin. As we know, insulin is the hormone that regulates the level of glucose in our bloodstream, or cannot effectively use the insulin it produces, or we can say it's about the insulin resistance. And the second is, we know that diabetes mellitus has two common types. They are type 1 diabetes and type 2 diabetes. But also we know there are gestational diabetes and another type of diabetes, but the common type of diabetes or type 1 diabetes is the major cause of diabetes in childhood or in teenagers, but also it can occur at any kind, in any range of age. At present, we know that it cannot be prevented. And the second one is type 2 diabetes, accounts for the vast majority, around 90% of diabetes in the worldwide. So diabetes tipe 2 ini yang paling banyak ditemukan di seluruh dunia, bahkan di Indonesia juga demikian. And another kind of diabetes is pre-diabetes. Is a term increasingly used for people with impaired glucose tolerance or impaired fasting glucose. It's the very earlier stage of diabetes. So I can say that when the person has pre-diabetes and it doesn't treat correctly, it would become a diabetes in the several next years. And the last is the gestational diabetes. The pregnant woman with gestational diabetes mellitus can have the baby that are large for gestational age. This situation would increase the risk of pregnancy and birth complication both for the mother and the baby. As far as I can tell, that if the mother have delivered a baby more than 4 kilograms, it's a risk for the mother and the baby to develop diabetes mellitus in the several next years. And another problem in diabetes mellitus is about the cost effectiveness. As we know that in regard to treat the diabetes, even the patients or the government should spend a lot of money, as we can see on the screen. According to the research conducted by Williams et al. In 2020 about global and regional estimates and projection of diabetes-related health expenditure. In 2019, it's about 760 billion US dollar that needed to spend to tackle the problem of diabetes, and it keeps growing, it keeps increase, yeah, and it's estimated in 2045 it will reach more than 800 billion US dollar. It's a lot number of money, I think, and I believe that it's not just happen in foreign country but also in Indonesia. This is the example about how economic costs of diabetes happen in the world, especially in the United States in 2017. It's about $347 billion spent for diagnosing diabetes in 2017. It's only for diagnosing diabetes. It's not count for how to treat the diabetes. And then it impacts the productivity of the citizens. About 300 million work days are lost to economy due to diabetes. And then about 277,000 premature deaths caused by diabetes, and about $31 billion spent on medication directly used to treat diabetes, and about $15 billion of which is used for insulin. We have to thankful because in Indonesia, as we know, that insulin is quite affordable for the patient for diabetes patient, because BPJS mengcover biaya untuk insulin, but I think that in other country there are a different type of different ways for the patient to afford the insulin. They have to spend a lot of money to buy insulin for their treatment. Okay. This is the signs, the specific signs of diabetes. As we know that the people with diabetes would experience a lot of signs and symptoms. For example, very thirsty, lots of drinks, urinate a lot often at night, very hungry, increased appetite, fatigue, feeling so sleepy, very dry skin infection. You know that people with diabetes is quite easier to get wounded, and also experience an unexplained weight loss. This is the acute complication of diabetes mellitus. There are three common acute complications that would occur in people with diabetes. The first one is diabetic ketoacidosis. The second one is hyperglycemic hyperosmolar state, and another type is hypoglycemia. And this acute complication would bring the patient into the life and death situation, because it's a critical stage for them. Yeah, and it's quite difficult to treat the patient if they fall into this kind of complications. And the second one is chronic complication. It's all about macrovascular complication and microvascular complication, but also the effect of long time of hyperglycemia in the bloodstream would also impair the nerve. And the macrovascular complication and microvascular complication, as we can see, and it could be found in people with diabetes. For example, retinopathy, nephropathy, neuropathy, diabetic foot, and then the cerebrovascular complication, cardiovascular complication, and peripheral arterial disease. Yeah, it's quite often found. It's quite often found in patients with diabetes. Okay, and what is the association between diabetes and quality of life? As we know that quality of life is about how people or how the patients would see their position in life, the context of the culture, value system in which they live, and in relation to their goals, expectations, standards, and concerns. In terms of treating the diabetic patient, we would say that the goals, expectations, standard, and concern, it's really have the huge correlation with quality of life. Okay, there are lots of determinants or predictors to reach the good quality of life of people with diabetes. And there are three main aspects. The first one is physical functioning. The second one is psychological well-being. And the last one is social well-being. And as we can see on the screen that there are amount of factors that would affect this quality of life. First one, from patient personality traits. There are temperament, intelligence, cognitive style, character, goal directedness, as we discussed before about the definition of quality of life, self-improvement, and locus of control. And then the relationship or interaction between physician and patient also include nurses, the effective cooperation, communication, competence, and motivation. And the last part of the characteristic of the disease, like the metabolic control, the glycemic index of diabetic patients, metabolic complication, and comorbidity. And as we can see from the conducted research that already revealed that this kind of factors have a big correlation with quality of life. I would present several research that already conducted by the researcher, and the first one is conducted by Scrum, Ben, and Fowler about depression and quality of life. And it revealed that diabetic individuals with depressive symptoms had a severely lower diabetes-specific quality of life. So we can conclude that people with diabetes who suffer depression, it would impact their quality of life. The second one is conducted by Jing et al. About the relative factors of quality of life of type 2 diabetes patients. The conclusion of this systematic review revealed that The physical exercise, glucose check frequently, complication, hypertension, duration of diabetes, diet with more red meat, and depression were associated with the quality of life of type 2 diabetes patients. So we can see that there are lots of correlated factors that would impact the quality of life of diabetic patients, especially for those who suffer type 2 diabetes mellitus. And the last is quality of life in people with diabetes, who conducted by Kia Daliri, Najafi, and Mirmalek Sani. They propose that health-related quality of life among the diabetes patient is related with socioeconomic status and better control of cardiovascular risk factors. So it can be concluded that there are a lot of numbers of predictors that relate with quality of life, yeah, as you can see on the screen. Yeah. Take for example complication. As we know that diabetes mellitus is the mother of disease, right? It can cause another kind or another type of disease, like people with diabetes mellitus would suffer the chronic kidney disease, for example, or stroke or cardiovascular disease, and it would affect the quality of life of the patient. And the second one is glycemic control, about A1C level. One of the research found that the patient who can maintain the level of A1C less than 6 or less than 7 would experience the good quality of life. And then the physical exercise is about the physical well-being, right? And then about hypertension, sexist, gender, some research found that men have a higher level of quality of life, and it's relate with their what is it? Their confidence or their self-efficacy, that quite good, right? To maintain the treatment for their self about diabetes, like maintain the diet or regularly injecting the insulin and keep the level of A1C less than 7. And then the depression, we already discussed about it before. Duration of diabetes mellitus, glucose monitoring, socioeconomic status. This is the one that become the topic of World Diabetes Day in 2021. How the people with diabetes can afford or can access the good quality of care for them. And then the age, some or several research found that people less than 65 years old would experience the good quality of life. It's because their ability to maintain the treatment in the good way, and then the treatment type, and also the educational status. It's about how the people with diabetes could gather the good information about how to maintain their self. Okay, and then we should talk about how the system would take care this kind of disease. And according to some research, this is the one that I can share with you about patient-centered care. As we know that now we are facing the transition in the way to treat the patient, and in a lot of health institution already delivered this kind of system, patient-centered care. And this research conducted by Williams et al. Revealed that the patient-centered care would affect the quality of life and self-management in people with diabetes. So the patient-centered care would involve the patient and also the family to decide how the way this treatment would run in their life. For example, the nurses would create the group of education, and it should consist of the member like another health provider like a dietitian, physician, and also the nurses. And in this kind of group, the patient with diabetes would be educated with a lot of information about how to treat themselves. And I believe that it would increase their knowledge and also would affect their behavior, or would change their way to treat themselves. This is the decision cycle for patient-centered glycemic management in type 2 diabetes. As we can see that the goals of the care is prevent complication and optimize quality of life, right? This is a lot of aspects that should be involved in this kind of system, patient-centered care. And as a nurse, we are open to deliver the good quality of care, right? We could be the coordinator of the system. As I mentioned before, as a nurse, we can create the specific group of patients that in that group we can educate, we can train them to take care of themselves. As we know that we have the self-care theory by Dorothea Orem, and it could be the framework of this patient-centered care, especially in the method, in the way of the nurses treat the patients. Okay. There are two kinds of potentially modifiable aspects. The first one is patient preference, and the second one is resources and support system. And we can take a part on this aspect. For example, patient preferences by the good educational intervention, we could change their way to maintain, for example, the A1C level, right? And also the resources and support system, for example, like patient-centered care. Okay. And the next one is empowering relationship patient and healthcare provider. As we talked before about patient-centered care, in that system also we should empower the patients. When we empower the patient in a good way, it would increase the awareness, willingness, knowledge, skills, autonomy, and self-determination of the patient. And I believe that it would affect the quality of life. This is the way to improve the quality of life through educational intervention. According to the research conducted by Mahmoud et al., the psychoeducational intervention programs can be helpful in the improvement of HbA1c or glycosylated hemoglobin levels, and health-related quality of life for patients with diabetes mellitus. And it's supported by another research conducted by Nasir Hassali Salim and Haag 2020, found that the educational program increased the interventions group level of diabetes-related knowledge and also improve its adherence atau kepatuhan dalam pengobatan, dan also impact the glycemic control atau kontrol glikemik, ya. Sebagaimana kita tahu bahwa kontrol glikemik ini sangat berhubungan erat dengan HbA1c atau level dari hemoglobin glikosilat, ya, sesuai dengan panduan dari Perkeni yang dianjurkan itu kurang dari 7 mg per desiliter yang bisa diukur dalam jangka waktu 3 bulan. Dan kesemuanya itu sangat berhubungan dengan quality of life atau kualitas hidup dari pasien diabetes itu sendiri. This is the method that could be adopted by the nurses about diabetes self-management education. It's already researched by a lot of researchers, either in Indonesia or from foreign, and almost of the result recommended this diabetes self-management education to be implemented in the way we treat the diabetes mellitus patients. We can see that the long-term outcomes of self-management education, it's about quality of life, because the good quality of life cannot be reached in the short term or in the short times, but it needs time to grow the good quality of life. It's involve the knowledge and then the behavior and also the psychosocial mediators like beliefs, attitudes, and coping skills. As the short-term outcomes, it would impact how the patients could control their blood pressure, lipid levels, glycemic control, and also weight and fidget. It is the time when they consult with their nurse or their physicians. This is one of the research that already conducted by Jahromi, Ramezanli, and Taheri in 2015 about the effectiveness of diabetes self-management education on quality of life in diabetic elderly females. So the result revealed that this kind of intervention, behavioral intervention program, significantly improved the quality of life outcomes of the diabetic elderly females. So it is highly recommended to be implemented in the method to treat diabetes mellitus patients. And what patients should do? The first and several slides before, we already talked about the system, the patient-centered care, and how nurses and physicians could do. And now we will discuss about what patients should do in terms of improving their quality of life. The first one is set achievable targets. For example, the targets of A1C, right? And or maybe the target of blood pressure. Sometimes some things that can easily measured, right? And as I mentioned before, we could involve the patients or the family in terms of deciding the targets. And the second one is physical well-being. Yeah, how to create or how to start the healthy diet and maintain it for a long time, and then do the regular exercise. Yeah, it is recommended for diabetic patient or people with diabetes to do regular exercise at least 30 minutes each day, right? Or about 150 minutes a week for 5 days, and it has a good impact for their physical well-being. And then the third is be in control. Every aspects of diabetes mellitus should be in control. And then the last thing is mindfulness training, right? To address depression, anxiety, diabetes distress, like doing some activities like meditation, yoga, or about the spiritual aspect like praying, beribadah, sholat yang teratur ya, sehingga bisa berdampak pada psychological well-being, kesejahteraan psikologisnya. Okay. The high quality of life represents the ultimate goal and an important outcome of all medical intervention in diabetic patients. If the patient's quality of life low, I believe that all the interventions, all the method to treat the diabetic patient would fail. Okay, so Dale Evans says that life is not over because you have diabetes. Make the most of what you have and be grateful. I think the positive vibe, the positive way of people think would impact their ability or their motivation, right, to live happily, although they have diabetes. Okay, thank you very much for this opportunity and your kind attention. If you have any question, please don't be hesitate to deliver. Thank you.
Baik, terima kasih Pak Mario untuk presentasi yang luar biasa. Untuk semua peserta yang masih ada di ruang Zoom, apakah ada pertanyaan yang akan disampaikan terkait dengan materi yang sudah disampaikan? Mohon maaf, tadi ada gangguan signal. Nah, memang ini termasuk kelemahan kalau seminar dengan online ya, karena jaringan itu termasuk salah satu faktor pendukung untuk bisa lancar dalam acara webinar. Baik, kepada semua peserta yang masih hadir di ruang Zoom, terima kasih sebelumnya. Namun untuk sebelum mengakhiri materi dari Pak Mario Katuk yang sudah menyampaikan materi yang sangat luar biasa, mungkin ada sharing ataupun terkait pengalaman yang bisa disampaikan sehubungan dengan materi yang disampaikan. Baik, ada satu pertanyaan buat Pak Mario di sini dari Rusdiani. Mana tadi pertanyaannya, Mas? Ini. Bagaimana cara perawatan luka DM yang benar agar dapat memproses perubahan jaringan yang baru dan bagaimana pencegahan pada keluarga yang menderita DM selain dari menjaga pola makan? Terima kasih, Pak. Silakan dijawab, Pak Mari.
Oke, baik. Terima kasih untuk pertanyaannya terkait dengan bagaimana cara perawatan luka diabetes mellitus yang benar. Walaupun mungkin materi saya bukan tentang perawatan luka ya Bu ya, tapi ya saya akan coba
Karena nanti
menjawab.
ada materi khusus perawatan luka sebetulnya habis ini sih.
Tapi tidak apa-apa Bu, nanti saya akan coba menjawab terkait dengan perawatan luka. Yang pertama mungkin terkait dengan pengkajiannya ya, karena kita harus mengetahui dulu jenis lukanya seperti apa, dasar lukanya bagaimana, warna apa, hitam kah, kuning atau merah. Kalau hitam berarti kan ada jaringan nekrotik di sana yang harus kita angkat dengan menggunakan teknik debrideman. Ya, kalau teknik debrideman mungkin teman-teman sejawat sekalian sudah memahami ya terkait bagaimana kita harus mengangkat jaringan mati nekrotik. Kemudian kalaupun dia lukanya itu dasar lukanya warna kuning, berarti ada slav di sana, ada juga jaringan nekrotik sisa-sisa debris yang juga harus kita angkat. Kalau misalnya dasar lukanya sudah berwarna merah, maka kurang lebih itu sudah ada jaringan baru atau ada granulasi, sehingga perawatannya bisa kita support untuk proses epitelisasi selanjutnya. Nah, kalau misalnya memang dasar lukanya masih warna hitam, maka kita harus lakukan debrideman dulu, supaya kita bisa tahu dasar lukanya warna apa. Dasar lukanya sampai di mana. Ya, karena kalau tertutup jaringan mati kan kita tidak bisa memastikan ini dasar lukanya sampai mana, kedalamannya berapa senti, misalnya ya. Jadi harus di debrideman dulu. Teknik debridemannya bermacam-macam, bisa surgical debrideman ya, kalau di rumah sakit bisa dilakukan dengan pembedahan ya, surgical debridement, atau mungkin kalau kita rawat, misalnya kita punya praktek mandiri dan kita rawat di rumah, atau mungkin di tempat kita praktek ya, mungkin bisa dengan mechanical debrideman ya, mungkin dengan nekrotomi ya, atau mungkin kita bisa apply enzimatik ya debrideman. Mungkin bisa menggunakan agen-agen yang mengandung enzim papain misalnya ya, buah pepaya misalnya, atau dengan sediaan-sediaan yang tersedia yang mengandung enzim-enzim tertentu yang bisa melakukan aktivitas memperlunak jaringan nekrotik ya, seperti itu. Kemudian kalau misalnya kita sudah melakukan debrideman dan dasar lukanya sudah kelihatan, maka kita bisa apply dengan dressing. Ya, dressingnya seperti apa itu tergantung dari kondisi lukanya. Kalau misalnya lukanya itu eksudatnya banyak, ya kita bisa apply dressing yang sifatnya absorben, ya bisa menyerap eksudat atau pus nanah ya. Karena kalau kebanyakan juga pusnya, lukanya basah, sulit terbentuk jaringan baru ya. Jadi demikian. Kalau misalnya lukanya kering ya, maka kita bisa apply dressing yang sifatnya moisturizing ya, misalnya yang base-nya itu water base atau yang model cream, itu bisa kita apply. Kemudian kalau misalnya sudah epitelisasi atau granulasi, di sini kita harus hati-hati jangan sampai dressing yang kita gunakan itu justru membuat luka baru, karena kan kalau granulasi kita tahu vaskularisasinya lagi baik-baiknya ya, sehingga kalau kena sedikit aja pasti bisa bleeding, bisa perdarahan. Jadi perlu kemampuan dari perawat, clinical judgment-nya seperti apa ya, untuk menentukan jenis dressing mana yang tepat. Kemudian juga selain kita fokus kepada luka, kita harus juga fokus pada glikemi kontrolnya ya. Sebaik-baiknya kita merawat lukanya, tapi kalau kadar gulanya tidak stabil ya akan sulit untuk penyembuhan lukanya. Kemudian yang ketiga, dari sudut pandang kardiovaskulernya. Kalau pasien-pasien yang mengalami peripheral arterial disease ya, paling mudahnya sih bisa diukur dengan ABI. Tapi kalau tidak ada alatnya, ya bisa kita coba palpasi arteri pedisnya ya, dorsalis pedisnya. Kalau misalnya lemah, ya itu tanda-tanda bahwa ada gangguan pada peredaran darahnya. Kalau misalnya peredaran darahnya tidak maksimal, maka suplai oksigen dan nutrisi ke area lukanya juga akan terhambat, sehingga proses pembentukan jaringan barunya itu akan terganggu. Ya, jadi tidak hanya fokus pada pada lukanya, tapi juga biopsikososialnya juga ya. Jangan sampai juga pasien stres ya. Pasien stres, sekresi kortisolnya meningkat, gula darahnya naik, ya susah juga kita mentreat lukanya ya. Jadi dalam hal ini saya mau sampaikan ketika kita merawat luka khususnya pada pasien DM, jangan hanya fokus pada lukanya, tapi rawatlah pasien secara keseluruhan ya, baik psikososial spiritualnya, supaya bisa saling support ya, dari segi metaboliknya, dari segi psikologisnya, dan juga dari segi perawatan lukanya itu bisa saling mensupport. Kemudian yang kedua, bagaimana pencegahan. Jadi memang diabetes ini kan ada keterkaitan dengan genetik ya, penyakit yang diturunkan. Tetapi juga kalaupun misalnya ada keturunannya ya, itu bukan berarti 100% diabetes itu akan dimanifestasikan ya. Walaupun ada yang mengatakan 6 kali beresiko kalau orang tua mengalami diabetes, anaknya 6 kali beresiko mengalami diabetes. Tetapi belum tentu juga anaknya ini akan termanifestasikan menjadi diabetes di kemudian hari jika pencegahannya dilakukan dengan benar. Ya, jadi pencegahan pasien DM itu kurang lebih sama dengan kita melakukan edukasi ke pasien yang sudah DM, ya. Dari segi makanannya, dari segi olahraganya, ya, berat badannya, kemudian resiko-resiko yang diakibatkan oleh penyakit kardiovaskular, ya. Jadi misalnya contoh prediabetes, seperti yang di slide saya tadi, prediabetes itu kan awalnya diabetes. Itu bisa dicegah sebenarnya, bisa dicegah sebelum lanjut ke diabetes. Itu ada penata laksanaan khusus untuk pasien prediabetes. Dan ada pasien-pasien yang sudah prediabetes, tapi dengan tata laksana yang tepat, tidak jatuh sampai ke tahap diabetes. Jadi itu bisa di-treat, bisa ditata laksana, ya. Selain makanan, kemudian juga olahraga, psychological well-being-nya juga perlu kita support, ya. Mungkin itu Bu Sastra yang bisa saya sampaikan.
Baik, Pak Mario, terima kasih untuk penjelasannya yang sangat baik ya. Tapi ada 2 lagi pertanyaan terakhir, boleh ya Pak?
Ya.
Baik. Berikut adalah pertanyaan dari Nurulita Aswiningsih. Selamat siang, kebetulan tadi ada pasien yang bercerita bahwa beliau mempunyai alat periksa gula darah. Sebaiknya alat ini digunakan rutin setiap hari atau baiknya digunakan kapan saja ya Pak? Terima kasih.
Oke, baik. Jadi pertanyaan terkait dengan pemeriksaan gula darah mandiri ya Bu ya. Jadi PDGM kalau di format edukasi pasien diabetes ada namanya PDGM ya. Jadi itu pemantauan kadar gula darah secara mandiri. Nah, memang dalam prakteknya ya memang dianjurkan itu bisa diperiksa setiap hari. Tapi dalam prakteknya pasien-pasien itu banyak faktor lah yang bisa kita lihat ya, bisa kita identifikasi ya. Misalnya beli lancet sama beli sticknya itu kan mahal ya. Sehingga walaupun pasien beli, tapi kalaupun dipakai tiap hari pasti akan berat di beban finansialnya. Itu pertama. Kemudian yang kedua, efek samping ketika diperiksa. Pasti nyeri kan ya kalau kita harus tusuk walaupun di ujung jari, tapi ada ketidaknyamanan yang akan muncul ketika kita melakukan pemeriksaan. Sehingga bisa direkomendasikan kalau pasien tidak bisa melakukan pemeriksaan setiap hari, setidaknya dalam 1 minggu itu bisa lakukan 3 kali pemeriksaan. Misalnya contoh hari Senin, pasien periksa gula darah puasanya. Ya. Kemudian hari Rabu, periksa gula darah sebelum makan siangnya. Ya. Kemudian hari Jumat misalnya, pasien bisa periksa gula darah sebelum makan malam. Kalau mau ditambah dengan pemeriksaan bedtime sebelum tidur itu juga bisa dilakukan. Tetapi ya dalam hal ini dokter atau perawat yang memberikan edukasi kepada pasien ini atau mungkin kontrolnya di mana juga harus bisa mengevaluasi kadar gula darahnya itu apakah terkontrol atau tidak begitu. Sehingga kalau misalnya kita mengedukasi pasien untuk pemeriksaan gula darah mandiri atau monitoring gula darah mandiri, kita juga harus perlengkapi pasien dengan catatan, ya. Catatan. Jadi periksa puasanya berapa, kemudian sebelum makan siangnya berapa, sebelum makan malamnya berapa, bedtime-nya berapa, sehingga ketika kontrol ke rumah sakit, puskesmas atau poliklinik atau dokter praktek itu bisa dievaluasi, ya. Kadar gula darahnya apakah sudah terkontrol atau tidak, dan juga itu akan berimbas pada treatmentnya, farmakoterapi farmakologinya, ya. Misalnya pasien awalnya cuma minum OHO, metformin, glibenclamid, tapi setelah dievaluasi kadar gulanya tidak terkontrol, maka harus dikonsulin misalnya, ya. Tapi ya decision making-nya itu dikembalikan kepada dokter yang merawat dan juga pasiennya, seperti itu. Ya, mungkin itu yang bisa saya sampaikan buat Ibu
Rulita.
Bu Rulita, ya. Mohon semoga bisa dipahami ya, Bu, ya.
Pak Mario, satu pertanyaan terakhir. Ada dua sebetulnya, cuma nanti bisa di-share ke topik berikutnya karena terhubung dengan perawatan luka. Cuman pertanyaan terakhir ini sepertinya berkaitan dengan topik Bapak. Izin bertanya, jika di usia muda, misalnya terkena umur 30 tahun, sudah terkena dengan diabetes tipe 2, apa ada resiko terkena luka DM lebih awal? Silakan, Pak.
Oke. Terima kasih pertanyaannya dari Ibu Putri, ya. Putri Karunia Nulaili. Oke, terima kasih. Jadi yang harus kita pahami dulu yang namanya kontinum, ya. Jadi patologi dari diabetes sendiri. Jadi misalnya kalau ada pasien yang terdiagnosis di usia 30 tahun, maka perjalanan penyakitnya itu sudah mulai jalan sejak 8 tahun sebelum dia terdiagnosis, 5-8 tahun sebelum terdiagnosis. Dan dalam proses itu, resiko terjadinya komplikasi baik kronik maupun akut itu sudah mulai jalan juga, ya. Sehingga kalau pertanyaannya di usia 30 tahun apakah beresiko mengalami luka kaki diabetes? Bisa beresiko, ya, bisa beresiko. Kalau faktor-faktor resiko tadi, ya, misalnya masalah neuropatinya tidak terkontrol, kemudian ada masalah di peredaran darahnya juga, ya, maka di usia berapapun setelah 30 tahun itu bisa berkembang menjadi luka, ya, bisa berkembang menjadi luka. Oleh karena itu sangat direkomendasikan bagi pasien diabetes dalam rentang usia berapapun, ya, itu untuk melakukan monitoring, pemeriksaan baik itu kontrol ke rumah sakit maupun pemeriksaan secara mandiri, ya. Luka DM itu kan kurang lebih dicetuskan oleh beberapa faktor. Yang pertama karena neuropati, ya. Saya pernah merawat pasien usianya itu belum 40 tahun, 30 tahunan, ya, mengalami ulkus diabetik. Pencetusnya adalah pasien ini tertusuk beling, ya, tertusuk beling, dan dia sudah tidak merasakan lagi sensasi nyerinya. Jadi awalnya tertusuk belingnya kecil, ya, tertusuk belingnya kecil. Tapi karena paresthesia, ya, numbness, tidak mampu merasakan sensasi nyeri, 3-4 hari kemudian pasien mulai demam. Pasien mulai demam, ya, pikirnya demam biasa, ternyata di telapak kakinya ada luka, ya, dan dipikirnya luka biasa, ya. Jadi cuma hanya menggunakan obat-obat standar lah, salep-salep standar pakai ditutup dengan perban. Lama-kelamaan area sekitar telapak kakinya itu mulai inflamasi, mulai memerah, dan pada akhirnya lukanya meluas. Ya, jadi yang saya mau katakan di sini adalah komplikasi DM itu terjadi sebelum pasien itu biasanya terdiagnosis, perjalanan penyakitnya. Jadi kalau misalnya dia terdiagnosis 30 tahun, bisa saja beberapa tahun kemudian itu bisa berkembang, bisa mengalami ulkus kaki diabetes. Pencegahannya adalah pasien harus periksa kakinya, ya, tiap hari saat mandi, saat bersih-bersih, kakinya diperiksa, ada luka enggak? Kalau ada luka sekecil apapun sebaiknya langsung di-treat, harus langsung ditata laksana oleh dokter maupun atau perawat. Teman-teman kita kan banyak yang perawat luka ya, yang yang punya kemampuan, kompetensi untuk melakukan perawatan luka. Dan sebaiknya dirawat dari masih kecil, karena kalau dia sudah membesar, sudah sampai ke tendon misalnya, atau mungkin sampai osteomielitis ya, perawatannya akan lebih sulit, biayanya akan lebih mahal. Ya, mungkin itu yang bisa saya sampaikan buat Ibu Putri tadi ya.
Putri Karunianu, Pak.
Untuk meminimalisirnya, salah satunya kontrolnya harus terkontrol. At least HbA1c-nya itu kurang dari 7 lah misalnya. Atau kalau susah HbA1c bisa periksa gula pakai glukometer juga bisa ya. Bisa dikontrol dengan itu.
Pak Mario, mohon maaf nih, ada satu lagi pertanyaan nih. Boleh ya Pak? Terakhir ini.
Iya, biasanya ya.
Baik. Selamat sore, saya Tere, berasal dari Poltekkes Kemenkes Semarang. Dimas? Mana tadi? Kenapa diganti? Izin bertanya Pak, bagaimana cara meningkatkan quality of Selamat sore, saya Tere berasal dari Poltekkes Kemenkes Semarang. Izin bertanya Pak, bagaimana cara meningkatkan quality of life bagi mereka yang pertama kali terdiagnosa DM dan baru pertama kali mengalami luka diabetik? Pastinya mereka akan berada pada tahapan denial, angry kali maksudnya, hingga akhirnya sampai pada tahap acceptance. Bagaimana cara kita sebagai perawat dalam mengedukasi dan meningkatkan kepercayaan diri pada pasien yang berada pada tahap denial? Silakan Pak Mario.
Baik, terima kasih Ibu ini
Tere, Tere
ini
Pak.
Apa ya, Tere, saudara Tere ya untuk pertanyaannya. Mungkin juga tadi pembicara sebelumnya kalau saya tidak salah Mr. John ya, Mr. JP sempat membahas terkait dengan loss and grieving ya, tahapan dari denial sampai acceptance. Kalau kita bicara soal pasien yang mengalami diabetes ya, non-communicable disease, biasanya pasien itu overthinking ya. Pasien itu pasti akan, dia bukan pasti ya, sebagian besar itu overthinking. Apalagi kalau misalnya pasiennya itu sudah cari info-info, apalagi sekarang kan sangat gampang ya. Kita bisa buka YouTube, bisa tanya Mbak Google ya. Diabetes itu seperti apa sih? Pasti mereka akan overthinking ya. Overthinking dalam arti perawatannya gimana ya? Apakah saya harus pakai insulin? Suntik insulin itu sakit atau enggak? Kemudian komplikasinya nanti bagaimana? Sehingga ketika mereka pertama kali terdiagnosis, ada banyak respon yang mungkin muncul ya. Salah satunya adalah yang loss and grieving ini ya, dari tahapan denial sampai acceptance. Nah, kalau menurut saya kita harus melihat situasi dan kondisi pasiennya dulu ya. Kalau misalnya pasien dalam tahap anger ya, lagi puncak-puncaknya nih, nggak mau nih, menolak, marah gitu, bisa marah pada diri sendiri, bisa marah mungkin pada leluhur ya. Kenapa saya kena DM, mama saya kena DM, mungkin papa saya, opa saya, oma saya ya, atau mungkin menyalahkan lingkungan dan sebagainya. Kita susah untuk masuk ke pasien dalam tahapan anger ini, karena pasti akan pasien itu akan offense biasanya. Pasti pasien nggak mau kita edukasi dalam tahapan ini, ya. Jadi akan lebih baik kalau kita menunggu ya sampai pasien bisa menerima. Ya, pasien bisa menerima kondisinya. Walaupun pasien kan mekanisme copingnya beda-beda ya. Ada yang mungkin hari ini diagnosis, besok udah langsung keterima, bisa menerima kondisinya. Ada mungkin yang butuh waktu seminggu, 2 minggu. Jadi kita juga harus menyesuaikan dengan kondisi pasien ya. Kalau pasien masih denial, masih marah-marah, masih bergaining position ya, masih tawar-menawar, bisa nggak ya minggu depan udah sembuh gitu, atau misalnya oh mungkin ini gula darahnya naik mungkin karena saya makan manis-manis mungkin dok, atau nurse mungkin minggu depan bisa nggak ya dia udah turun lagi. Jadi pasien masih belum menerima gitu loh kondisinya gitu. Jadi harus kita tunggu sampai dia benar-benar acceptance, baru kita bisa masuk ke situ, baru kita bisa masuk dengan metode edukasi seperti contoh tadi yang self management education. Ya, kita bisa masuk ke situ. Jadi memang butuh waktu bagi pasien untuk boleh menginternalisasikan semua input informasi yang kita berikan. Sehingga kalau pasien yang baru terdiagnosis DM pertama kali, kita mengedukasi pasien itu dengan tujuan membuat pasien paham dulu, pasien ini sakit apa sih? Gitu. DM itu seperti apa sih? Jadi dia bisa menerima dulu kondisinya, ya, dari informasi yang kita berikan terkait dengan DM. Ya, DM itu penyakit ini loh Pak, Bu. Perjalanan penyakitnya seperti ini, seperti ini, seperti ini. Kalau mereka sudah paham terkait dengan DM itu apa, ya, baru kita bisa masuk ke materi edukasi yang lain. Misalnya tentang dietnya bagaimana, exercise-nya bagaimana, obat-obatannya bagaimana, kemudian perawatan kakinya bagaimana supaya tidak kena luka, kemudian dari segi psikologisnya bagaimana, ya. Jadi untuk mengedukasi pasien diabetes juga kita harus berkolaborasi, karena nggak bisa juga perawat sendiri yang mengedukasi, ya. Ada dokter di sana, ada psikolog di sana, ya. Ada dietitian, nutritionist di sana, ya. Pengalaman saya dulu waktu merawat pasien DM, kita refer ke beberapa tim. Jadi misalnya dari poliklinik penyakit dalam terdiagnosis, nanti pasien di-refer ke klinik edukasi. Klinik edukasi refer ke poligisi. Di situ ada dietitian, ada nutritionist. Dari poligisi nanti di-refer lagi ke klinik kaki. Di klinik kaki di situ akan di-screening kakinya, ya. Baru diedukasi bagaimana perawatan kakinya. Seperti. Jadi dalam mode tim, ya, dalam mode tim. Atau kita bisa menggunakan pendekatan, kalau masih sulit, kita bisa menggunakan pendekatan dengan meningkatkan self-efficacy pasiennya. Jadi kepercayaan diri pasien untuk melakukan perawatan secara mandiri. Ya, salah satunya adalah dengan melibatkan pasien DM yang sudah well educated, jadi sudah teredukasi dengan baik dan hidupnya itu sudah terkontrol. Misalnya pasien sudah mampu mengatur diet, mengatur olahraga, ya, bisa menyuntikkan insulin secara mandiri dengan baik, gula darahnya terkontrol. Tujuannya adalah untuk meyakinkan pasien yang baru ini bahwa hidup mereka juga bisa terkontrol walaupun dengan diabetes. Contohnya saya misalnya, contohnya ibu ini, contohnya bapak ini, seperti itu, ya. Dengan demikian efeknya itu bisa meningkatkan pengetahuan, kepercayaan diri, dan juga tadi terkait dengan kualitas hidupnya atau quality of life-nya. Seperti itu. Ya. Mungkin kalau misalnya dia masih tahapan-tahapan awal, kita kasih pendampingan dulu mungkin ya Bu ya. Kalau misalnya tahapan denial, kita kasih pendampingan dulu. Kita kasih support dulu. Kan ada istilahnya healing presence ya. Healing presence. Jadi hanya dengan kehadiran perawat juga bisa membantu pasien untuk masuk pada tahapan pemulihan atau recovery. Mungkin itu yang bisa saya sampaikan, lebih kurangnya saya mohon maaf. Terima kasih. Saya kembalikan kepada Ibu Sastra.
Terima kasih Pak Mario untuk penjelasan yang luar biasa kepada Saudara Tere, Bapak atau Ibu ini. Mudah-mudahan apa yang disampaikan cukup membantu sehubungan dengan pertanyaan yang disampaikan. Mungkin itu pertanyaan terakhir untuk sesi dari Pak Mario ya, karena waktunya juga sudah menunjukkan 2:30 di Jawa Barat. Baik, terima kasih Pak Mario untuk kehadirannya dan udah sharing materi yang sangat luar biasa. Mungkin ke depan bisa lagi kerjasama di next event. Terima kasih banyak Pak. Terima kasih. Baik, pemateri kita terakhir hari ini untuk di seminar ini adalah Ibu Shirley Savianti Escape. Apakah Ibu Shirley sudah ada di ruang Zoom? Bu Shirley?
Sudah hadir Bu Sastra, sudah menyimak.
Baik. Baik, sudah lelah ya Bu, satu harian kita stay on Zoom. Baik, Ibu Sherly ini akan menyampaikan terkait dengan clinical guidelines for nursing on diabetic ulcer. Jadi beliau ini adalah perawat, terus latar belakang pendidikan tahun 1993 lulus dari SPK Immanuel, kemudian dari 2015 lulus dari D3 Keperawatan Stikes Immanuel juga, kemudian 2019 lulus S1 Ilmu Keperawatan dari Stikep PPNI Bandung. Kemudian riwayat pekerjaan sangat banyak sekali ini sebagai Kepala Ruangan Rawat Inap Immanuel 2007 sampai 2008 dan kemudian menjadi dosen tidak tetap di Stikes Immanuel 2011 sampai 2012. Kemudian menjadi perawat tetap di Rumah Sakit Immanuel dari 93 sampai 2006 dan Kepala Klinik Woundcare dari 2009 sampai 2020. Dan juga pelatihan-pelatihan yang dilakukan oleh Ibu Sherly cukup banyak, mungkin nanti bisa dibaca saja ya. Baik Bu, untuk riwayat organisasi, beliau menjadi anggota DPK PPNI Rumah Sakit Immanuel Bandung, Humas DPW Inwokna, Jawa Barat. Baik, mungkin itu saja sebagai perkenalan dari Ibu Sherly. Saatnya Bu Sherly untuk menyampaikan materinya. Kepada Ibu Sherly kami persilahkan.
Baik, terima kasih Bu Sastra. Tadi kalau kita sudah mendengar beberapa pembicara yang sangat luar biasa, saya mohon izin untuk menyampaikan materi dalam bahasa Indonesia karena memang bahasa Inggris saya tidak cukup baik, Bu Sastra. Jadi biar apa yang saya sampaikan kepada teman-teman sekalian bisa tersampaikan dengan baik. Mungkin kita mulai saja. Pada hari ini sebetulnya saya dapat tugas nih dari tim panitia untuk membawakan pedoman klinik untuk perawatan luka diabetes. Tapi saya tidak mengupas tuntas bagaimana melakukan perawatan pada luka diabetes, tetapi saya lebih kepada pencegahan untuk terjadinya ulkus, lalu yang keduanya kita nanti akan membahas bagaimana pedoman tentang pengelolaan penyakit dari arteri perifer, juga yang ketiganya yaitu membahas mengenai pedoman tentang bagaimana kita melakukan diagnosis dan memberikan pengobatan pada luka infeksi diabetes. Bu, saya izin share ini ya, screen-nya.
Silakan.
Oke. Oke, kalau kenapa saya tidak membahas tentang bagaimana kita melakukan perawatan luka, karena rasanya sudah sering sekali ya Bu ya, sudah sering sekali kita mendengarkan pemateri-pemateri atau webinar mengenai tentang perawatan luka, termasuk bahwa 2 minggu belakang kemarin kita juga membahas tentang perawatan luka diabetes ya Bu ya. Jadi hari ini saya fokuskan ke dalam tentang bagaimana pedoman pencegahan dari diabetic foot ulcer, lalu yang keduanya bagaimana kita mengetahui pedoman tentang pengelolaan penyakit arteri perifer pada pasien dengan ulkus kaki diabetes, dan yang terakhir adalah pedoman tentang menegakkan diagnosis dan pemberian terapi atau pengobatan infeksi pada kaki diabetes. Oke, kita masuk ke dalam pencegahan, pedoman pencegahan. Jadi sebenarnya penyakit kaki diabetes ini adalah salah satu komplikasi diabetes mellitus yang cukup serius karena akan berdampak tidak hanya saja pada pasien, tetapi juga kepada keluarga, tenaga kesehatan. Kenapa demikian? Karena proses penyembuhan luka pada luka ulkus diabetikum itu memerlukan waktu yang cukup lama dan bahkan ada juga yang berujung tidak sembuh serta biaya yang biasanya pasti cukup besar. Oleh karena itu diperlukan strategi yang mencakup semua unsur, dimulai dari unsur pencegahan, pendidikan pasien dan staf, lalu perawatan yang multidisiplin, dan pemantauan ketat seperti yang akan kita jelaskan dalam materi berikut ini. Oke, pedoman apa saja yang harus kita lakukan, yaitu yang pertama adalah mengidentifikasi kaki yang berisiko, lalu yang kedua memeriksakan kaki yang berisiko secara teratur, lalu yang ketiganya memberikan edukasi kepada pasien, keluarga, dan penyedia layanan kesehatan, lalu yang keempatnya memastikan bahwa penderita diabetes itu rutin memakai alas kaki yang sesuai. Cukup terdengar ya Bu ya? Apa yang saya sampaikan? Cukup jelas?
Jelas.
Oke. Dan yang terakhir adalah bagaimana kita melakukan perawatan kaki secara terintegrasi. Kita masuk ke dalam pedoman yang pertama, yaitu mengidentifikasi kaki yang beresiko. Nah, untuk mengidentifikasi kaki beresiko, lakukan pemeriksaan kaki ini secara rutin, minimalnya setahun 1 kali untuk pasien diabetes dengan resiko luka rendah. Jadi ada penilaian yang menurut IWGDF itu nilai resikonya 0. Untuk resiko 0 itu kita harus melakukan pemeriksaan paling tidak 1 tahun 1 kali. Nah, adapun yang harus diperiksa yaitu mulai dari hilangnya sensasi pada kaki dan kemungkinan adanya penyakit pada arteri perifer. Hal ini gunanya yaitu untuk mengkaji apakah mereka mengalami peningkatan grade dari resiko ulcerasi kaki. Nah, ketika tidak adanya gejala pada penderita diabetes, bukan berarti penderita diabetes itu tidak memiliki resiko terjadi luka. Jadi bisa saja pasien juga memiliki neuropati asimptomatik atau tidak bergejala. Juga gangguan pada pembuluh darah perifer, tanda-tanda ulcerasi yang harus dikaji lebih dalam lagi, atau bahkan terkadang sudah terjadi luka. Ini tujuannya untuk supaya tidak terjadi resiko berulang. Jadi oleh karena itu, walaupun penderita diabetes dengan hasil pemeriksaan resiko terkena ulcerasi itu sangat rendah, penilaian IWGDF-nya 0, mereka juga harus tetap dilakukan pemeriksaan secara rutin setahun sekali untuk pemeriksaan tanda-tanda dan gejala kehilangan sensasi dan penyakit arteri perifer yang tentu saja berguna untuk mengidentifikasi apakah mereka ini beresiko mengalami ulcerasi atau tidak. Nah, ini kalau kita lihat pada gambar berikut, ini adalah teknik untuk kita dapat menilai lobes, bisa dengan menggunakan monofilamin test, ya. Ini kita menggunakan persepsi tekanan, dan untuk persepsi getaran kita bisa menggunakan dengan garpu tala. Nah, ketika kita tidak mendapatkan monofilamin test atau garpu tala, kita bisa menggunakan dengan touch test, yaitu kita melakukan pemeriksaan dengan sentuhan ringan pada ujung jari kaki pasien, kurang lebih dengan telunjuk kita ya, dengan kurang lebih 1 sampai 2 detik. Oke. Lalu yang kedua itu adalah rutin melakukan pemeriksaan kaki berisiko. Jadi kapan sebaiknya kita melakukan secara rutin pemeriksaan kaki yang beresiko. Kalau kita lihat ini ada kategori 0 ya. dengan resiko luka very low, sangat rendah, karakteristik lukanya dia tidak ada CLOPS, juga tidak ada PAD, lalu frekuensi pemeriksaannya bisa 1 tahun satu kali dalam 1 tahun. Lalu kalau kategori yang pertama, yang ke-1 itu ulcer risk-nya masuk ke dalam low, karakteristik dari kakinya terdapat CLOPS atau PAD. Nah, ini untuk frekuensi pemeriksaannya bisa 1 kali dalam 6 sampai 12 bulan. Lalu untuk kategori 2 ini masuk ke dalam moderat, dari karakteristiknya terdapat CLOPS dan PAD atau CLOPS dengan foot deformity atau PAD dengan foot deformity, dan ini kita lakukan frekuensi pemeriksaannya 1 kali setiap 3 sampai 6 bulan. Dan untuk yang kategori ketiga ini masuk ke dalam high ulcer resiko, ini terdapat CLOPS atau PAD, ya, juga dia mempunyai riwayat luka sebelumnya, riwayat luka kaki, ya, dan juga mungkin saja bisa ada riwayat amputasi sebelumnya, dan ada riwayat penyakit gagal ginjal. Nah, ini kalau untuk high kita lakukan frekuensi pemeriksaannya 1 kali setiap 1 sampai 3 bulan. Ibu Bapak, kalau kita lihat ini adalah di gambar berikut adalah ini area kaki yang berisiko tinggi untuk terjadinya ulcerasi. Terlebih ketika penderita diabetes itu telah mengalami bentuk kelainan kaki, ya. Kita lihat ini titik-titiknya di mana ini berisiko untuk terjadinya luka. Ya. Ini jelas kelainan bentuk pada kaki penderita diabetes. Lalu yang ketiga, kita masuk ke dalam melakukan edukasi kepada pasien, keluarga, dan tenaga kesehatan. Yang pertama, kita menganjurkan seseorang dengan diabetes yang berisiko mengalami ulcerasi, nilai risiko dari IWGDF-nya 1-3 untuk melindungi kaki mereka dengan tidak berjalan tanpa alas kaki, dengan kaos kaki tanpa sepatu, atau menggunakan sandal bersol yang tidak terlalu tipis tapi tidak juga tinggi, ya, dan digunakannya baik di dalam ataupun di dalam ruangan. Lalu yang kedua adalah menganjurkan memotivasi dan mengingatkan penderita diabetes yang beresiko ulcerasi kaki dengan nilai resiko 1-3 memeriksakan setiap hari kedua kaki dan bagian dalam sepatu yang akan digunakan. Jadi jangan-jangan di sepatu yang pas akan digunakan itu kejatuhan benda tajam gitu. Jadi sebelum dipakai harus dilakukan pemeriksaan terlebih dahulu. Karena akan berisiko kalau tidak ada benda tajam didapatkan, pasti akan berisiko untuk terjadinya luka. Nah, lalu mencuci kaki setiap hari kering sebelumnya, setelah itu dikeringkan dengan hati-hati, terutama di antara sela-sela jari kaki. Gunakan lotion juga untuk dapat melembabkan kulit yang kering. Lalu potong kuku secara lurus. Dan hindari menggunakan bahan kimia untuk menghilangkan kalus. Dan yang ketiga, ini adalah memberikan pendidikan yang terstruktur kepada penderita diabetes yang berisiko mengalami ulcerasi kaki. Melakukan perawatan kaki yang tepat untuk mencegah terjadinya ulkus. Nah, ini kalau kita lihat adalah cara yang tepat untuk memotong kuku, ya, kuku. Jadi kita kalau lihat kita gambar yang sebelah kanan itu kita yang betul, ya, jadi lurus memotongnya, tapi tidak melekuk seperti yang gambar sebelah kiri. Lalu kita masuk yang keempat, ini memastikan penderita diabetes rutin memakai alas kaki yang sesuai. Jadi pada pasien dengan diabetes dengan resiko sedang untuk ulcerasi kaki, yaitu resiko IWGDF-nya 2, atau yang telah sembuh dari luka non plantar, resiko kaki, resiko 3 untuk penilaian IWGDF-nya, anjurkan untuk memakai alas kaki terapeutik yang mengakomodasi bentuk kaki dan yang cocok dengan benar untuk mengurangi tekanan plantar dan membantu mencegah ulkus kaki ketika terdapat deformitas kaki atau tanda praulceratif. Jadi pertimbangkan untuk menggunakan alas kaki yang dibuat khusus atau sol yang dibuat khusus. Lalu pada pasien diabetes yang berisiko untuk terjadi luka, ini maka diperlukan pertimbangan untuk menggunakan alat silikon pada sendal atau digunakan sendal khusus untuk menghindari pertumbuhan kalus. Jadi untuk pasien-pasien diabetes yang berisiko memang perlu dipertimbangkan ketika untuk alas kakinya menggunakan silikon, atau kita menggunakan sendal khusus diabetes ya. Kalau sekarang ini kan kita cukup banyak yang menjual sepatu-sepatu atau sendal diabetes. Oke. Lalu selanjutnya pada pasien diabetes ini yang memiliki ulkus kaki plantar yang sudah sembuh dengan nilai IWGDF-nya 3, itu dianjurkan untuk menggunakan alas kaki terapeutik yang memiliki efek mengurangi tekanan pada area plantarnya selama dia berjalan. Tujuannya ini untuk membantu mencegah ulkus kaki plantar yang berulang, serta dorong pasien juga untuk selalu konsisten memakai alas kaki tersebut. Kalau di klinik kami ya, kami juga tidak hanya melakukan perawatan luka saja, tapi kami juga melakukan perawatan kaki, yang salah satunya adalah manicure pedicure gitu ya. Kita menerima juga kadang pasien-pasien diabetes memang sering sekali terdapat kalus gitu. Jadi sebaiknya dianjurkan ketika pasien sudah mengalami kalus, sebaiknya pasien tidak membersihkan sendiri, apalagi tadi disampaikan bahwa tidak boleh menggunakan zat kimia. Jadi lebih baik pasien dianjurkan untuk datang ke klinik atau ke rumah sakit yang bisa melayani untuk membersihkan kalus. Lalu yang kelima adalah perawatan kaki terintegrasi. Jadi berikan perawatan kaki terintegrasi untuk penderita diabetes yang beresiko tinggi mengalami ulcerasi kaki untuk membantu mencegah ulkus kaki berulang. Jadi perawatan kaki terintegrasi ini mencakup perawatan kaki, alas kaki yang memadai, dan pendidikan kesehatan tentang perawatan kaki, dan ini harus kita lakukan evaluasi kembali dari setiap kebutuhan pasien tersebut setiap 1 sampai 3 bulan sekali. Oke, lalu kita masuk ke dalam pedoman pengelolaan penyakit arteri perifer pada penderita ulkus diabetikum. Penderita diabetes yang seperti kita tahu telah meningkat pesat selama dekade terakhir, dan banyak badan internasional sekarang ini menganggap diabetes itu sebagai darurat kesehatan masyarakat. Ini dikarenakan bahwa karena jumlah penderita diabetes telah meningkat 4 kali lipat sejak tahun 1980. Ini diperkirakan juga bahwa di negara-negara berpenghasilan menengah dan tinggi, sekitar 50% dari penderita diabetes dan ulcerasi kaki itu memiliki penyakit arteri perifer atau yang kita sebut PAD yang mendasarinya. Sedangkan untuk ulkus neuropati ini mungkin lebih umum di negara-negara berpenghasilan rendah. Pada pasien dengan diabetes, PAD mungkin tetap tidak terdiagnosis sampai pasien mengalami amputasi, karena banyak pasien biasanya tidak memiliki gejala yang klinis atau yang gejala klinis yang khas, sehingga pasien tidak menyadari bahwa dia sudah mengalami gangguan pada pembuluh darah perifernya. Nah, tes diagnostik mungkin kurang dapat diandalkan juga karena pada umumnya penderita diabetes sudah mengalami neuropati perifer. Namun tentunya penting untuk mengidentifikasi PAD pada pasien dengan ulkus kaki diabetik pada tahap sedini mungkin, karena kehadiran PAD dikaitkan dengan peningkatan resiko ulkus yang tidak sembuh, infeksi dan resiko, tentunya resiko amputasi. Nah, serta juga peningkatan resiko morbiditas kardiovaskuler dan tentunya mortalitas secara keseluruhan. Oke, lalu pedoman apa saja yang harus kita lakukan? Yaitu yang pertama adalah menegakkan diagnosa, lalu keduanya prognosis, dan yang ketiganya adalah memberikan perawatan. Kita masuk ke dalam diagnosis. Jadi periksa kaki untuk semua penderita diabetes itu setiap tahun untuk mengetahui adanya penyakit arteri perifer, walaupun dia tidak ada luka atau dia belum mengalami luka. Jadi sebaiknya dilakukan pemeriksaan paling tidak satu kali dalam setahun, dan minimal yang harus dilakukan adalah meraba denyut nadi kaki pasien. Ketika pemeriksaan klinis ini tidak dapat diandalkan untuk penyakit arteri perifer, pada kebanyakan orang dengan diabetes dan ulkus kaki, pemeriksaan Doppler atau yang kita sebut dengan pemeriksaan ABI, ankle brachial index, cukup bisa diandalkan dan terbukti cukup optimal untuk mendiagnosa PAD. Lalu untuk prognosis, selalu perhatikan kondisi vaskuler pada pasien dengan ulkus kaki diabetikum, terlepas dari hasil tes ketika ulkus tidak sembuh dalam waktu 4-6 minggu, meskipun standar perawatan yang kita lakukan sudah sangat baik. Jadi ketika ibu bapak sekalian bertemu dengan pasien yang mengalami luka ulkus diabetikum, ketika kok pas kita lakukan perawatan, kenapa ya sudah ini minggu keempat, kita mempunyai target ketika minggu keempat itu pasien dari jaringan nekrotik sudah mengalami jaringan granulasi. Jadi ketika pada minggu keempat atau lebih 4-6 minggu pasien tidak ada perbaikan, kita harus mulai, jangan-jangan memang aliran darahnya yang kurang baik gitu ya, keadaan kondisi vaskulernya yang kurang baik. Tapi sebetulnya di saat ketika kita melakukan pengkajian gitu ya, kita untuk praktisi luka, untuk perawat luka, kita biasanya sudah sangat sudah sangat familiar gitu. Ketika kita bertemu dengan luka, wah ini mah kondisi lukanya nekrotik, kering, tidak ada kehidupan. Ini jelas-jelas sudah tidak ada vaskularisasi. Jadi ketika kita menemukan kondisi seperti ini, jangan kita terus memberikan harapan. Kita bilang kita memberikan PHP sama pasien, oh ibu nanti sebentar lagi juga sembuh. Padahal sudah jelas pada kaki tersebut sudah tidak ada tidak ada aliran darah gitu, sudah avaskularisasi. Jadi sebaiknya ketika kita melakukan pengkajian di awal, kita itu sudah harus bisa melakukan pemeriksaan untuk pembuluh darahnya. Lalu Selalu juga perhatikan juga revaskularisasi pada pasien dengan ulkus kaki diabetik dan penyakit arteri perifer. Jadi ketika ulkus tidak sembuh dalam waktu 4-6 minggu juga meskipun manajemen optimal. Artinya ketika pasien sudah, oh memang aliran darahnya ini kurang baik, akhirnya kita berkolaborasi dengan dokter penanggung jawab atau mungkin dokter bedah vaskuler. Pasien sudah mendapatkan terapi untuk antikoagulan, tapi ketika kita melakukan perawatan tidak kunjung membaik, itu kita juga harus bisa melakukan evaluasi di minggu ke-4 dan ke-6. Tetapi jangan juga ketika kita menemukan pasien dengan ulkus diabetikum itu menganggap ketika lukanya tidak kunjung membaik, kita menganggap bahwa oh ini mah ada gangguan pembuluh darah gitu. Padahal kemungkinan penyebabnya dari luka tidak membaik itu banyak faktor. Jadi tidak saja hanya dari gangguan pembuluh darah, luka tidak menjadi baik itu banyak faktor. Mungkin gula darahnya tidak terkontrol gitu ya, mungkin nutrisinya yang buruk gitu. Jadi kita tidak boleh menyimpulkan langsung oh ini gangguan pembuluh darah. Padahal secara klinis kita menemukan tidak menemukan adanya tanda-tanda PAD. Gitu ya. Ini adalah pedoman untuk PAD. Jadi untuk grade 0 kita lihat pemeriksaan angka brachial index-nya itu lebih dari atau sama dengan dari 0,80, lalu didapati angka systolic pressure-nya lebih dari 100 ya. Lalu untuk to pressure-nya, through continuous oxygen pressure-nya itu sama dengan atau lebih dari 60, dan untuk grade 1 angka brachial index-nya 0,6 sampai 0,79, lalu angka systolic pressure-nya 70, antara 70 sampai 100, lalu untuk to pressure-nya 40 sampai 59, dan untuk grade yang kedua itu hasil angka brachial index-nya adalah 0,4 sampai 0,59, lalu didapati angka systolic pressure-nya 50 sampai 70, dan untuk to pressure-nya 30 sampai 39. Lalu yang ke grade yang ketiga itu didapatkan hasil dari angka brachial index-nya kurang atau sama dengan 0,39, dan pemeriksaan angka systolic pressure-nya kurang dari 50, dan untuk transcutaneous oxygen pressure-nya itu kurang dari 30. Lalu untuk treatment-nya, jadi beberapa pemeriksaan bisa digunakan sebagai pertimbangan untuk dilakukannya revaskularisasi ekstremitas bawah pasien. Itu bisa dengan USG, Doppler ya, ultrasound duplex warna, lalu bisa mengalu pemeriksaan angiografi, atau bisa juga dengan MRI. Ini biasanya kalau dokter-dokter bedah vaskuler, dia ketika mendapati pasiennya secara klinis ada gangguan PAD, misalnya kalau dokter bedah vaskuler itu sudah mainannya tidak lagi USG, tidak lagi angiografi, biasanya langsung ke MRI. Ya. Ini evaluasi sirkulasi arteri ekstremitas bawah ini mulai dari arteri tibialis hingga arteri dorsalis pedis. Jadi biasanya ekstremitas bagian bawah. Lalu ketika melakukan revaskularisasi pada pasien dengan ulkus kaki diabetik, ini bertujuan untuk mengembalikan aliran darah langsung setidaknya ke salah satu arteri kaki. Tapi alangkah lebih baik ketika mengembalikan peredaran darah yang baik itu ke dalam arteri yang langsung memasok ke daerah luka. Jadi ketika prosedur sudah diberikan, ini kita harus melakukan efektivitas evaluasi dengan pengukuran perfusi yang objektif. Lalu treatment yang berikutnya adalah memastikan maaf sebentar. Jadi setelah kita biasanya untuk pasien-pasien dengan PAD ini biasanya kita memang harus berkolaborasi dengan dokter bedah vaskuler ya, ketika memang kita melihat hasil pemeriksaan apalagi sudah total gangguan pembuluh darahnya total, itu biasanya memang kita langsung merujuk pasien tersebut pada bedah vaskuler ya. Oke, untuk treatment selanjutnya memastikan bahwa setelah prosedur revaskularisasi pada pasien dengan ulkus kaki diabetikum, pasien dirawat oleh tim multidisiplin sebagai bagian dari rencana perawatan yang komprehensif. Segera kaji dan obati pasien dengan tanda-tanda atau gejala penyakit arteri perifer dan infeksi kaki diabetik, karena mereka memang berada pada risiko yang sangat tinggi untuk terjadinya atau dilakukannya amputasi tungkai bagian bawah. Lalu memberikan manajemen resiko kardiovaskuler intensif untuk setiap pasien dengan diabetes dan ulkus kaki iskemik, termasuk dukungan untuk berhenti merokok, pengobatan hipertensi, kontrol glikesemi, dan pengobatan dengan obat statin serta biasanya pemberian antikoagulan ya, clopidogrel dosis rendah atau aspirin. Tapi jelas saja, tentu saja yang memberikan terapi adalah dokter bedah vaskuler. Oke, lalu kita masuk ke dalam pedoman untuk mengatasi infeksi. Apa saja yang kita lakukan untuk infeksi ini? Jadi, nah, infeksi luka di kaki diabetes ini didefinisikan sebagai invasi mikroorganisme ke dalam jaringan tubuh yang menginduksi respon inflamasi tubuh. Jadi biasanya diikuti oleh kerusakan jaringan. Hampir semua diabetic foot infeksi itu terjadi pada luka terbuka, karena luka dengan mudah diserang mikroorganisme. Infeksi tidak dapat didefinisikan hanya dengan menggunakan hasil kultur, namun juga dengan tanda-tanda gejala inflamasi. Mungkin Ibu Bapak sering bertemu ya dengan pasien ketika datang, kondisi lukanya dibiarkan terbuka, karena memang biasanya pada orang-orang awam itu mereka menganggap bahwa dengan terbuka luka akan lebih cenderung cepat kering. Jadi menurut mereka itu luka sudah kering itu sudah sembuh gitu ya. Tapi untuk menentukan infeksi ini tidak saja kita cukup dengan harus dengan kultur, biasanya memang sudah jelas ada tanda-tanda inflamasi di dalam luka tersebut. Apa saja yang kita lakukan? Yang itu yang pertama, kita juga melakukan diagnosis, jadi apakah memang dia ada infeksi atau tidak. Lalu yang kedua kita melakukan pemeriksaan mikrobiologi. Yang ketiganya kita memberikan treatment, dan yang keempatnya adalah surgical treatment dan penanganan untuk osteomielitis. Untuk mendiagnosa infeksi kaki diabetes ini secara klinis tentunya berdasarkan adanya tanda-tanda lokal atau sistemik dari gejala peradangan. Jadi biasanya ada rubor, tumor, dolor itu sudah jelas gitu ya. Karena akan berbeda ketika kita datang pasien gitu ya. Belum tentu ketika dia banyak jaringan mati, oh ini lukanya infeksi. Padahal secara klinis tidak ditemukan adanya tanda-tanda dari inflamasi. Lalu menilai tingkat keparahan dari infeksi tersebut menggunakan Infectious Disease Society of America. Jadi kalau kita lihat, Bapak untuk tabel di sini, ini masuk ke dalam klasifikasi 1, ya, tidak adanya infeksi. Jadi untuk klasifikasi ke-1 itu ada infeksi, ada juga tidak ada infeksi. Jadi untuk yang tidak ada infeksi itu tidak adanya gejala sistemik atau lokal atau tanda-tanda infeksi. Nah, untuk yang infeksi di klasifikasi yang ke-1 ini setidaknya ada 2 gejala lokal, yaitu yang pertama bisa ada pembengkakan atau indurasi eritema lebih dari 0,5 cm di sekitar luka, lalu ada nyeri, ya, yang padahal memang tidak ada penyakit penyerta gitu. Jadi sudah jelas kondisi infeksi di sekitar luka. Ini kita bisa masukkan ke dalam kategori yang pertama. Lalu untuk kategori yang kedua, ya, ini ada infeksi tanpa manifestasi sistemik. Jadi hanya kulit atau jaringan, bisa saja jaringan sampai subkutan, yang lebih dalam lagi terdapat eritemanya tidak lebih dari 2 cm dari sekitar luka. Lalu untuk kategori yang ketiga, ini infeksi tanpa manifestasi sistemik, eritemanya dia lebih memanjang, yaitu lebih dari 2 cm di sekitar luka, dan jaringan yang terkena juga lebih dalam, bisa sampai ke tendon, otot, bahkan sampai ke tulang. Nah, untuk yang keempat, ya, ini adalah infeksi kaki dengan manifestasi terkait sistemik. Jadi terdapat kenaikan suhu, temperatur lebih dari 38 derajat Celcius, atau malah dia hipotermi, kurang dari 36 derajat Celcius. Nah, ini biasanya juga didapati dengan detak jantungnya lebih dari 90 kali per menit, lalu pernapasannya juga lebih dari 20 kali per menit, lalu didapatkan hasil pemeriksaan leukositnya itu lebih dari 12.000 per milimeter kubik, atau bisa saja mungkin dia malah kurang dari 4.000. Nah, infeksi ini berkaitan dengan, biasanya sudah berkaitan dengan kondisi tulang yang radang atau kita sebut dengan osteomyelitis. Nah, untuk diagnosa juga pertimbangkan untuk pasien itu dirawat di rumah sakit. Jadi semua orang yang dengan diabetes dan infeksi kaki yang parah, dan mereka yang memiliki infeksi sedang hingga kompleks atau terkait dengan mobilitas kunci yang relevan. Jadi ketika kita mendapati infeksi pasien tersebut itu berat gitu ya, atau berat, itu sebaiknya kita menganjurkan bahwa pasien itu dilakukan perawatan di rumah sakit. Nah, pada orang dengan diabetes yang diduga osteomyelitis, juga yang diduga adanya osteomyelitis, kami sarankan untuk menggunakan kombinasi pemeriksaan tes probe to bone, ya, lalu pemeriksaan protein C reaktif atau procalcitonin, dan sinar X polos untuk mendiagnosis osteomyelitis. Jadi ketika kita mencurigai adanya osteomielitis pada luka tersebut, sebaiknya kita melakukan pemeriksaan penunjang. Biasanya kalau kita di rumah sakit, kita bisa melakukan dengan X-ray ya, dengan sinar X, pemeriksaan sinar X. Oke. Lalu pemeriksaan mikrobiologi. Jadi kumpulkan spesimen yang sesuai untuk kultur untuk hampir semua ulkus yang terinfeksi secara klinis untuk menentukan patogen penyebabnya. Jadi kita biasanya harus mengambil teknik kultur ini, kita harus mewakili semua area. Jadi tidak hanya ketika luas lukanya itu bisa misalnya ukurannya cukup luas ya, kita hanya mengambil areanya di bagian bawah saja atau yang ada pusnya saja. Tidak, tapi kita harus mengambil teknik kultur itu dengan mengambil sampel dari semua area. Ya. Nah, untuk infeksi kaki diabetes jaringan lunak dapatkan juga sampel untuk kultur dengan mengumpulkan spesimen jaringan secara aseptis, yaitu dengan pretese atau biopsi dari ulkus tersebut. Lalu kita sarankan juga untuk tidak menggunakan agen antibiotik dulu topika yang tersedia saat ini untuk mengobati infeksi kaki diabetes ringan. Untuk tingkatan kolonisasi dan infeksi dapat dipertimbangkan dengan penggunaan antimikrobial dressing. Jadi ketika kita mendapati pasien dengan kondisi luka infeksi ringan, sebaiknya kita tidak langsung memberikan terapi antibiotik ya, tetapi alangkah lebih baiknya kita memberikan topikal terapi dengan menggunakan antimikrobial dressing untuk luka tersebut. Lalu ketika pasien atau setelah kita menggunakan antimikrobial dressing, misalnya kita lakukan evaluasi, luka tersebut tidak membaik gitu. Nah, ini harus kita pertimbangkan untuk kolaborasi dengan dokter penanggung jawab untuk pemberian antibiotik. Lalu yang terakhir ini adalah pada pasien dengan kemungkinan terdapat osteomielitis kaki diabetik disertai juga dengan infeksi jaringan lunak yang bersamaan, ini segera evaluasi untuk operasi serta tindak lanjut medis dan bedah pasca operasi intensif. Jadi biasanya kalau kita mendapati pasien-pasien kita dengan diabetes ini terdapat osteomielitis, sebaiknya kita langsung ibaratnya memberikan rujukan atau berkolaborasi dengan dokter ortopedi untuk dilakukan biasanya pembersihan lukanya harus di ruang operasi. Jadi itu saja Ibu Bapak, jadi kesimpulannya dari apa yang saya sampaikan pada sore hari ini adalah pencegahan ulkus kaki pada orang dengan diabetes mellitus itu dilakukan berdasarkan tingkatan risiko terjadinya luka sesuai dengan rekomendasi IWGDF. Lalu manajemen penyakit arteri perifer pada pasien dengan ulkus kaki diabetikum yang dideteksi melalui pemeriksaan EBPI maupun dengan angiografi atau MRI, salah satunya yakni dengan melakukan tindakan revaskularisasi dan manajemen terapi obat antikoagulan dan manajemen diabetes. Dan kesimpulan terakhir yaitu untuk manajemen infeksi luka di kaki diabetes ini dilakukan dengan deteksi dini tanda-tandanya inflamasi serta pemeriksaan laboratorium dan kultur untuk dapat antibiotik yang sesuai. Jadi ketika kita mendapati memang ada tanda-tanda infeksi, kita lakukan pemeriksaan kultur, itu biasanya kita dengan tidak cukup dengan pemeriksaan mikroorganismenya saja, tetapi juga misalnya dengan resistensi tes. Jadi antibiotik apa yang tepat untuk luka tersebut. Baik Ibu Bapak sekalian, itu yang bisa saya sampaikan. Mudah-mudahan bisa bermanfaat untuk Ibu-Ibu Bapak sekalian. Terima kasih, saya kembalikan kepada Ibu Sastra.
Baik, terima kasih Bu Selvi untuk materi yang sangat baik. Kepada semua peserta yang masih hadir di ruang Zoom, untuk bisa langsung menyampaikan pertanyaannya lewat room chat ataupun langsung bisa menyampaikan ke Ibu Selvi. Karena ini memang sudah jam-jam yang melelahkan dari jam 8 sampai jam 3 sore, ini lebih dari kuliah ini. Baik, Bu
Udah
Selvi
berapa
ada satu.
SKS ini? Dan sampai saat ini juga yang hadir masih cukup banyak nih Bu.
Iya Bu, benar. Tapi memang udah ada 45% sih yang kurang, karena tadi ada 200 lebih sebetulnya. Tapi mungkin karena mereka banyak yang terkait berhubungan dengan dinas sih, jadi mereka izin. Tapi masih banyak ini. Ibu, ada satu pertanyaan ini dari Siti. Dimas, aku masih belum baca. Oke, ntar ya. Dari Siti Mutmainah.
Ya.
Izin bertanya, kalau si pasien diabetik tidak bisa tidur setiap malam, apa bisa memicu naiknya kadar glukosa? Ibu, terima kasih.
Bu Sastra, maaf, bisa diulang, kurang jelas.
Baik.
Ya.
Pertanyaan dari Siti Mutmainah. Izin bertanya, kalau si pasien diabetik tidak bisa tidur setiap malam, apa bisa memicu naiknya kadar glukosa, Bu? Terima kasih.
Bisa saja karena memang psikologis pasien juga bisa bisa mempengaruhi dari kadar gula darah pasien. Jadi tidak saja dari makanan ya yang tidak disiplin atau dari obat-obatan yang kita makan gitu ya, dari pasien tersebut tidak diminum, tapi juga dari segi psikologis pasien tersebut juga dapat mempengaruhi kenaikan gula darah. Mungkin itu Bu untuk Bu Siti.
Baik. Ada satu lagi pertanyaan Ibu dari Ibu Marta Hutauruk. Pertanyaannya demikian, untuk mengedukasi pasien dan keluarga pasien, satu, lokasi yang baik dan benar pengambilan darah pada pasien yang menggunakan alat glutes, dan yang kemudian, di mana lokasi yang baik untuk penyuntikan insulin pada pasien yang menggunakan suntikan insulin melalui subkutan. Terima kasih banyak.
Pertanyaan dari Bu siapa, Bu?
Ibu Marta Hutauruk, Bu.
Ibu, ini teh pertanyaannya teh panjang, tapi saya tidak bisa menjawab ini karena memang ini sinyal teh kurang cukup baik ya Bu. Saya memang lagi di luar kota.
Saya
bisa nggak ada suaranya Bu?
Saya bisa ulangi sekali lagi Bu, membacakan pertanyaannya ya, izin. Karena memang signal hari ini cukup kok, sedikit ada gangguan ya.
Iya.
Baik, pertanyaan dari Ibu Marta Hutauruk. Untuk mengedukasi pasien dan keluarga pasien terkait dengan lokasi yang baik dan benar pengambilan darah pada pasien yang menggunakan alat blood test. Dan yang kemudian, di mana lokasi yang baik untuk penyuntikan insulin pada pasien yang menggunakan suntikan insulin melalui subkutan. Terima kasih banyak. Ada 2 pertanyaan, Bu.
Jadi pertanyaannya di mana lokasi yang baik untuk pengambilan sampel pemeriksaan darah, ya. Lalu yang keduanya penyuntikan yang baik di area mana gitu ya?
Betul.
Iya. Jadi untuk pengambilan sampel darah itu dia lebih baik di area tidak di area jempol dan tidak di area ujung jari, Bu. Tidak di kelingking, tidak di jempol, tidak juga di kelingking. Jadi kalau kita lihat dari kita jari ini 5, jadi jari yang kedua, ketiga dan ketiga dan keempat. Jadi dari tangan kita itu tidak dilakukan pemeriksaan di jempol dan di kelingking. Iya, gitu. Lalu untuk penyuntikan itu untuk penyuntikan biasanya memang dianjurkan itu biasanya di area umbilikalis, Bu. Jadi memang di daerah perut gitu. Itu yang lokasi yang terbaik gitu dari lokasi penyuntikan untuk insulin. Tapi dilakukan penyuntikannya dia secara rotasi gitu, memutar gitu. Kalau ketika pasien sudah tidak nyaman di perut bisa saja sih di tangan gitu ya, bisa juga di paha. Tapi untuk pemilihan lokasi yang paling baik adalah setahu saya memang di daerah umbilikalis.
Oke. Demikian Bu Sherly, demikian Bu Marta. Apakah ada sharing terkait hal yang disampaikan Bu Sherly? Mungkin ada pengalaman di lapangan yang bisa disaringkan kepada peserta yang hadir yang lain di ruang Zoom ini? Kalau tidak ada, kita lanjut ke pertanyaan berikutnya ya Bu. 2 pertanyaan terakhir deh, karena waktu sudah hampir menunjukkan pukul 3:30.
Iya.
Ini terkait dengan penggunaan alas kaki. Maaf Bu, mau tanya, ini pertanyaan dari Mariana Raidam. Alas kaki yang bagaimana yang bisa mengurangi penekanan pada kaki? Apakah kaos kaki? Demikian Bu Sherly.
Penanganan untuk
alas kaki yang bagaimana yang bisa mengurangi penekanan pada kaki katanya Bu. Apakah
Jadi,
kaos kaki atau yang lain?
Oke. Jadi untuk tadi sudah disampaikan bahwa ketika pasien di dalam ruangan memang kita menganjurkan untuk pasien tidak telanjang kaki gitu, tapi dengan menggunakan kaos kaki. Tapi ketika pasien di luar atau di dalam ruangan juga kita bisa menganjurkan bahwa dengan menggunakan alas kaki yang tentu saja empuk lebih empuk di dalam, di bagian dalam supaya tidak terjadi penekanan, dan kita memilih sol yang lebih keras ya atau padat itu di area luar. Jadi ketika pasien kaki pasien itu terkena paku atau misalnya terkena benda-benda tajam lainnya, diharapkan sendal tersebut bisa memproteksi dari kaki pasien. Itu mungkin Bu Sastra. Untuk Bu Marta jawabannya.
Baik, itu pertanyaan dari Ibu Maria sih Bu, yang Bu Marta tadi terkait dengan edukasi yang baik. Bagaimana Bu Maria, masih ada di ruang Zoom? Apakah ada sharing terkait hal yang disampaikan Bu Sherly?
Ya udah cukup jelas. Terima kasih Bu.
Sama-sama Bu.
Bu Sherly, ada lagi pertanyaan ini. Kalau presentasi Bu Sherly biasanya rame nih yang tanya ini satu. Ini dari Hasri Kurniati S. Rumang. Izin bertanya Bu, mohon penjelasannya terkait penggunaan antibiotik seperti metronidazole cair atau tablet yang ditaburkan pada luka diabetik, karena masih banyak sekali digunakan di rumah sakit dalam perawatan luka diabetik. Terima kasih.
Oke, baik. Untuk pemberian, memang kita seringkali menemukan bahwa untuk antibiotik dari metronidazole yaitu sering digunakan untuk luka, itu sebetulnya tidak ada tujuan untuk, jadi dia sebetulnya tidak berguna untuk mengatasi infeksi. Jadi si metronidazole ini lebih cenderung kita gunakan untuk perawatan luka memang yang kondisinya dia bau. Jadi untuk mengurangi bau pada luka tersebut supaya pasiennya lebih nyaman, biasanya kita memang menggunakan pemberian terapi metronidazole untuk lukanya. Jadi, tapi untuk secara sistemik dia mengatasi infeksi, yang ditaburkan dia tidak dapat mengatasi infeksi tersebut. Tapi kita cukup bisa memberikannya hanya untuk supaya mengurangi bau atau mengontrol bau dari luka tersebut. Itu Ibu Sastra. Bu Sastra, sudah cukup puas dengan jawabannya kalau bisa.
Maaf tadi signalnya kayaknya gangguan Bu, jadi kurang jelas.
Oh,
tapi
iya.
saya yakin apa yang disampaikan Bu Sherly tadi. Maaf tadi signalnya kurang baik, tapi yakin apa yang disampaikan Bu Sherly cukup jelas ya bagi yang tadi Ibu siapa yang bertanya? Ibu Marta, benar ya?
Hasri.
Ibu Hasri. Ibu Hasri bagaimana? Apakah masih ada di ruangan Zoom? Bagaimana terkait dengan penjelasan Bu Sherly sehubungan dengan pertanyaan Ibu?
Iya, terima kasih Bu Sherly.
Baik, terima kasih. Bu Sherly, masih ada nih pertanyaan 2 terakhir ya untuk semua
Masih ada, Bu. Masih ada ini.
Izin bertanya, ini dari Bapak Ari Kurnianto Purwo. Izin bertanya, Bu, mau tanya, saya pernah kerja di rumah sakit. Apakah benar perawatan luka DM dengan, maaf, yang ada ulatnya atau tidak memakai madu asli, madu tanpa jeli, dan gula buatan dan lain-lain asli madu? Dan itu SOP rumah sakit tersebut. Pertama, dibersihkan pakai NaCl dan madu. Mungkin maksudnya apakah perawatan luka DM bisa menggunakan madu? Mungkin berikut. Demikian kali Bu Sherly. Mungkin silakan dibantu untuk menjawab Bu Sherly.
Ya baik Bu. Jadi sebetulnya untuk modern dressing sendiri saat ini juga ada beberapa yang sudah banyak mengandung madu Bu. Jadi sebetulnya memang madu bisa menjadikan salah satu pilihan untuk kita melakukan perawatan luka ketika di area atau di daerah tersebut memang tidak didapati topikal terapi atau macam-macam memang dari modern dressing, karena memang prinsipnya dari merawat luka kan adalah moisture balance ya, jadi harus lembab. Jadi dengan apapun, bahkan dengan ACL pun sebetulnya kita bisa melakukan perawatan luka. Yang penting prinsipnya adalah moisture balance. Itu mungkin jawabannya Bu, cukup.
Baik, terima kasih Bu Sherly. Demikian Pak Ari hubungan dengan pertanyaan Bapak. Baik, Bu, 2 terakhir ini nggak nambah lagi, udah stop karena kita sudah sampai overtime sebetulnya, karena tadi dijadwalkan di rollnya juga jam 3, tapi karena dari dari pesertanya masih sangat tertarik dengan materi yang disampaikan. Ini dari Pak Abdul Haris Fantri. Izin bertanya, kapan seorang pasien dengan ulkus diabetikum terindikasi amputasi? Dan untuk perawatan luka profesional, apakah harus tersertifikasi seperti CWCCA? Silakan Bu Sherly.
Oke, jadi tadi pertanyaannya kalau boleh saya ulang, kapan kita harus memutuskan bahwa bahwa luka tersebut ada indikasi untuk dilakukan amputasi, gitu ya Bu ya? Pertanyaannya. Iya. Nah, jadi ketika kita mendapati pasien kita memang sudah jelas vaskularisasi, kalau misalnya vaskularisasi mungkin Ibu Bapak pasti sudah jelas ya, ketika kita melakukan pemeriksaan dari arteri dorsalis pedis sudah tidak ada denyut nadinya gitu ya, terus akralnya juga dingin, lalu tampak luka tersebut nekrotik gitu ya, kering, cenderung kering, tidak ada kehidupan. Biasanya kita memang sebaiknya kita melakukan pemeriksaan lebih lanjut untuk mendukung apakah memang luka tersebut harus dilakukan amputasi atau tidak. Tapi ketika kita melakukan pemeriksaan penunjang dengan hasilnya vaskularisasinya masih bisa diperbaiki, gitu ya, mungkin kita jangan terlalu terburu-buru untuk memutuskan bahwa oh ini harus diamputasi, ya. Tapi ketika secara klinis memang kita menemukan kondisi dari arteri ekstremitas yang paling bawah gitu ya, dari dorsalis pedisnya memang tidak ada, sama sekali tidak ada, lalu teraba akralnya dingin gitu sudah jelas, lalu kondisi jaringannya juga kering, nekrotik hitam gitu ya. Nah itu memang sepertinya kita tidak ada pilihan lain gitu. Untuk mau tidak mau memang kita harus membuang atau melakukan pembuangan jaringan atau amputasi pada jari kaki salah satunya, misalnya kalau misalnya memang ada yang bagian dari jari kaki tersebut terdapat nekrotik gitu. Tapi ketika kita mendapati masih ada, oh ada nih arteri dorsalis pedisnya, walaupun dia ada tapi dia kecil lemah gitu ya, tapi ada gitu, lebih baik kita lakukan dulu pemeriksaan yang mendukung yang lainnya. Ini itu saja Bu. Iya.
Terima kasih buat penjelasannya Bu Sherly. Bu, aduh izin banget ini ada 3 lagi nih bertanya. Kira-kira bagaimana Bu Sherly? Karena mereka sudah setia sebenarnya untuk mendengarkan materi kita dan ikut setia dalam 1 hari ini dalam seminar. Boleh dikasih kesempatan ya Bu, biar saya bacakan.
Sebetulnya itu sudah habis kan Ibu ya waktunya ya, tapi
udah. Cuman mungkin
jadi,
mereka cukup tertarik dengan materi Bu Sherly, tapi gimana Bu? Ada pertanyaannya juga cukup bagus sih. Yang pertama itu dari Natalia Tambunan. Mungkin dia bertanya apa rasionalnya kenapa tidak bisa dilakukan di jempol ataupun kelingking, mungkin terkait tadi dengan itu kali ya, pengambilan sampel blood test dengan alat blood test mungkin.
Oh ya Bu, tadi untuk CWCC ya, CWCCA ya?
Iya betul-betul. Apakah harus tersertifikasi kata mereka?
Oh ya, untuk kalau CWCCA itu tidak ini ya, tidak
CWCC.
Iya, CWCC, CWCCA itu memang ada dia pelatihan ya, pelatihan perawatan luka, tapi tidak di bawah PPNI.
Suaranya hilang.
Gitu. Jadi kalau kita dari Inwokna, organisasi yang jelas-jelas organisasi perawat luka atau himpunan dari perawat luka yang di bawah naungan PPNI, itu kita mengeluarkan sertifikat untuk perawatan luka itu adalah BCWCN. Jadi untuk CWCC, CWCCA itu, jadi maksud saya gini, Ibu Bapak lebih lebih bijak lagi, lebih hati-hati lagi dalam memilih atau mengikuti gitu ya, mengikuti setiap pelatihan itu yang memang sebaiknya mengikuti pelatihan yang memang ada di bawah naungan PPNI. Jadi ketika tidak di bawah PPNI, saya seperti kalau kayak Inwokna, itu Inwokna adalah himpunan organisasi perawat luka di bawah PPNI gitu ya. Jadi sebaiknya Ibu Bapak lebih bijak lagi gitu. Jadi kalau menurut saya pribadi sih ya, sayang gitu, cukup disayangkan gitu, karena mungkin untuk kedepannya untuk perawat luka itu akan lebih didisiplinkan lagi gitu, lebih diinikan lagi untuk sertifikat perawat lukanya.
Baik, demikian untuk terkait pertanyaan sertifikasi tadi. Yang tadi Bu, apakah bisa dikasih jawaban sedikit terkait dengan rasionalnya kenapa tidak boleh di kelingking dan di kaki, katanya terkait mungkin pengambilan sampel blood test dengan menggunakan blood test tadi.
Iya. Jadi pertanyaannya kenapa tidak rasionalnya gitu ya, kenapa tidak dilakukan di jempol dan di kelingking gitu ya, rasionalnya kalau sebetulnya pada area mana saja boleh, tapi alangkah lebih baiknya ketika tidak dilakukan di area jempol atau kelingking. Kenapa? Karena vaskularisasi di jempol itu dia memang sedikit lebih besar ya. Jadi ketika kita lakukan penusukan bisa saja perdarahannya lebih memanjang atau lebih besar. Lalu kalau di kelingking lebih sedikit mungkin ya, lebih kecil pembuluh darahnya, akhirnya yang keluar juga darahnya akan lebih sedikit. Jadi kita akan kesulitan gitu untuk melakukan pemeriksaan. Itu saja Bu Sastra.
Baik. Satu lagi terakhir dari Rosa Ayu. lain. Terima kasih. Pertanyaan terakhir, Bu. Silakan Bu Serli.
Bu, maaf terputus, pertanyaannya apa ya?
Baik, saya ulangin ya Bu ya. Ini dari
Iya.
teman kita dari Rosa Ayumi Jayapura, Bu. Jadi izin bertanya, untuk saat ini produk topikal berupa krim khusus, sebentar Bu. Oke, terakhir izin bertanya, untuk saat ini produk topikal berupa krim khusus produk buatan perawat untuk perawatan luka, apa hanya Medcovagin saja Bu, atau ada yang lain? Terima kasih. Shirley?
Iya Bu, memang Medco cukup terkenal ya. Bahkan sampai di Jayapura itu ya Medco ya. Iya, sebetulnya banyak kalau kita dapati itu beberapa produksi dari dari perawat gitu ya, yang memang mungkin Medco lebih terkenal ya gitu. Jadi memang lebih terkenal daripada krim atau salep-salep yang lain gitu. Jadi sebetulnya memang anak bangsa kita ini sudah pada pintar-pintar Bu. Jadi sudah ada memang beberapa perawat luka itu yang lebih membuat atau misalnya digabung
produk,
ini jadi membuat produk sendiri. Tapi memang untuk Medco ini cukup
familiar.
Iya. Itu saja Bu Sastra.
Baik, dengan demikian Bu siapa tadi dari yang Surabaya itu? Yang dari Ibu yang dari Jayapura, Ibu Rosa tadi ya. Ibu Rosa gimana Bu, masih ada di ruangan Zoom? Mungkin bisa sharing atau ada ditemukan krim lain atau produk lain yang buatan karya dari perawat juga terkait perawatan luka? Ibu Rosa, apa masih ada di ruang Zoom? Ada ya? Ada yang mau di-sharingkan Bu Rosa? Atau ada pengalaman terkait penggunaan krim Medcovagin atau yang lainnya? Baik, mungkin itu pertanyaan terakhir dan juga sebagai penutup. Bu Serli mungkin bisa kasih closing statement atau sudah kelelahan untuk seminar kita hari ini untuk materi Ibu? Baik, sepertinya terputus ya koneksinya dengan Bu Serli. Baik, terima kasih semua teman-teman yang sudah hadir. Demikian acara kita hari ini. Kepada semua peserta yang sudah hadir di sini, kami mengucapkan, dan juga pembicara yang sudah hadir, yang sudah memberikan kontribusi sebagai pembicara kami hari ini, kami mengucapkan banyak terima kasih. Dan untuk semua peserta yang sudah berpartisipasi pada acara kita hari ini, sangat berterima kasih di mana acara bisa berjalan dengan baik dan lancar. Apa yang kita harapkan dari sini, mulai tadi part pertama dan part kedua juga terkait dengan bagaimana kita membangun profesi kita sebagai perawat untuk bisa lebih menghargai profesi kita, mengimprovisasi bagaimana kemampuan kita supaya bisa lebih dihargai dan mendapat nilai jual yang lebih agar bisa mendapat salary yang baik dan kemudian bisa mengubah nasib perawat dan juga bisa mendapatkan hak-hak yang layak. Mari teman-teman, seperti tadi pengalaman dari beberapa pembicara dari luar menyampaikan bahwa selain dari kompetensi yang baik, kenapa perawat dari Filipina, Taiwan, dan luar negeri lainnya bisa mendapat kesempatan yang baik di luar negeri sana, ternyata salah satu yang harus kita benahi adalah terkait dengan bahasa kita, karena memang bahasa kita gunakan untuk berkomunikasi dalam melayani. Jadi mungkin improve your English, kemudian bagi dosen-dosen yang hadir juga di sini dari pendidikan, dari akademisi, mungkin bisa menyiapkan untuk ke depannya agar bisa mempersiapkan kurikulum berbasis mungkin nursing English for nurse, berapa semester, berapa jam, menjadi kurikulum yang tetap di dalam pembelajaran mata kuliah perawatan. Karena pengalaman-pengalaman dari mereka katanya bahwa di negara mereka bahasa Inggris menjadi kurikulum yang tetap untuk bisa seperti dianggap sebagai kompetensi lainnya, agar bisa mungkin kemampuan kita sebagai perawat tidak hanya dari skill dan yang lainnya, tetapi juga kemampuan berkomunikasi dalam bahasa internasional. Demikian, selamat sore semuanya. Terima kasih untuk sudah hadir di seminar hari ini. Selamat melayani, Tuhan memberkati. Tapi sebelumnya kami mau sampaikan bahwa
Selamat sore Kak, terima kasih.
dari kita, panitia, ada seminar ya, untuk tanggal berapa nih Mas? Mungkin bisa di-share screen-nya untuk ini. Terkait dengan manajemen kegawatan pernapasan tanggal 5 Desember ya, 5 Desember dan juga tanggal 12 Desember. Bagi teman-teman yang bergabung hari ini yang setia, harga normal itu kita kasih, ini kita mau sampaikan bahwa harga normal untuk 2 paket itu 150. Tapi bagi mereka yang mau hadir hari ini, yang mau ngambil promo, kita cukup memberikan harga 100.000 untuk 2 event. Hanya hari ini. Silakan menghubungi panitia kalau misalnya berminat untuk bergabung, untuk join. Nanti pematerinya juga sangat luar biasa, ada Pak Seven, Pak Krisna, dan Pak Yudi, dan juga materinya juga luar biasa. Kami akan mencatat tadi beberapa partisipan yang berhak mendapat tiket free ya, karena tadi sudah menyampaikan sudah berpartisipasi dengan baik. Terima kasih, selamat sore. Bikin musik deh.
Sore Bu.
Selamat sore Bu. Terima kasih. Selamat sore Bu Satra.
Selamat sore Bu, terima kasih atas materi
Terima
dan
kasih.
jawabannya.
Terima kasih. Selamat sore. Terima kasih.
Selamat sore, terima kasih
Luar
biasa acaranya.
Satra dan Mbak Linda, terima kasih sekali.
Acaranya bagus banget.
Sangat bermanfaat sekali. Terima kasih.
Nah, ada event
Terima kasih banyak.
Terima kasih, terima kasih tim Narsum. Sukses selalu.
Terima kasih. Sukses selalu.
Kurang kencang, enggak?
Ini di mana tuh? Tadi tuh loh yang ada bilang, ada apa itu kok macet?
Bagi yang berminat untuk seminar berikutnya, silakan join, menghubungi admin kami ya.
Terima kasih Bu Sastra.
Terima kasih.
Siap Bu, siap.
Siap Bu, terima kasih.
Tenang, hari ini ada banyak banget dari dari beberapa provinsi di luar Jawa Barat. Kebetulan kita penyelenggara dari Jawa Barat, tapi sangat berterima kasih untuk teman-teman yang mau bergabung dari luar Jawa untuk bisa sharing dan juga berbagi ilmu di sini. Terima kasih. Sertifikat akan segera di-share by email ataupun WA bagi teman-teman yang sudah memberikan nama, yang sudah memberikan daftar nama ke admin kami. Boleh memastikan bahwa yang diberikan adalah nama yang sesuai dengan yang akan dicatatkan di sertifikat. Terima kasih.
daftar lagi, itu dibayarin. We go wrong.